And the rules of the House of Representatives for 119th Congress require each committee in a meeting open to the public to consider and adopt an authorization and oversight plan. This is why we're meeting today, to consider the Committee on Energy and Commerce Authorization and Oversight Plan. And before I recognize myself for an opening statement, I just want to remind members of both sides, I know we're going to have robust debate today. That's what our system produces, is a robust debate, and we certainly appreciate that. But I just want to remind members on both sides of the aisle of decorum in our rules. Members are advised they must observe the House standards of decorum in debate and conduct, and speak and act respectfully, and not use disorderly words or unparliamentary language. So I know we'll have a good, robust debate today, and stick to those rules. Thank you. So I will now recognize myself for an opening statement. Today's markup to consider the Authorization and Oversight Plan for 119th Congress is an opportunity to reflect on our committee's broad jurisdiction and our oversight and policy priorities. As I emphasized in our organizational meeting, the Committee on Energy and Commerce plays a pivotal role in restoring the American dream by unleashing American energy, lowering the costs of healthcare, and ensuring that America remains the world leader in technological innovation. This plan helps provide our roadmap for the 119th Congress to achieve these goals. We have already begun this effort in the beginning weeks of the Congress. By the end of the week, every subcommittee will have held its first hearing. These hearings have covered a range of priorities, including energy independence, domestic manufacturing, artificial intelligence, spectrum management, combating illicit drugs, and easing regulatory burdens on industry. Tomorrow, the Oversight and Investigation Subcommittee will hold its first hearing in the Congress, examining loans and grants made to the Department of Energy and the Environmental Protection Agency, many of which were pushed out the door in the waning days of the Biden and Harris administration. The Health Subcommittee will also hold a hearing tomorrow, its second one, examining the prescription drug supply chain, especially the role of pharmacy benefit managers. It's already clear we have many critical issues to tackle this Congress on behalf of the American people. That is why the committee's oversight plan is wide-ranging and well-balanced. To be clear, this plan is not exhaustive, and there is plenty of work to do that may not be expressly stated here. That said, the plan covers a lot of ground, again, demonstrating the breadth of the committee's jurisdiction. As is the tradition for House Republicans, we appreciate not only the opportunity for all our committee members to review the Authorization and Oversight Plan, but also to vote on it. Therefore, I look forward to our discussion today, and I'll urge a yes vote on the Oversight Plan. And now I'll recognize Ranking Member Pallone for his opening statement.
Thank you, Chairman Guthrie. Today's markup of the committee's oversight plan comes at an important moment for our country and for Congress. With both today's vote on the budget resolution and this markup of the committee's oversight plan, we have an opportunity to show what we stand for and who we are willing to fight for. House Republicans are planning to vote later today on a cruel budget resolution that directs this committee to cut at least $880 billion. These cuts are expected to come from the Medicaid program, the program that provides health coverage to 1 in 3 Americans. If Republicans move ahead with this budget proposal, millions of Americans will lose their health care coverage, all so that Republicans can give billionaires and big corporations giant tax breaks. Imagine that, stripping health care away from children's parents and seniors, all so they can give Elon Musk and his buddies a giant tax break. Now, Democrats stand united against the House Republican budget scheme. We will never support cutting Medicaid to give handouts to billionaires, and if just 3 Republicans join us today, we can protect American families and stop this budget betrayal. Committee Republicans also have a choice to make today about whether or not they're going to finally do their jobs and stand up to President Trump's actions to consolidate power in the White House to the detriment of the American people. Oversight requires asking tough questions and demanding answers from the president and the federal agencies in order to hold them accountable on behalf of the American people for their actions. Committee Republicans have silently watched as President Trump and Elon Musk have stolen from the American people by illegally withholding funds approved by Congress. To date, Republicans have refused to ask any questions as crucial investments in our districts to bolster domestic manufacturing, protect public health and the cures of tomorrow, and keep our drinking water safe and clean are being withheld by the Trump administration. Committee Republicans have silently watched as Elon Musk and his minions are seeking the personal, financial, and health care information of every American. This is a serious invasion of the American people's privacy. We have no idea what they're doing with this information. For all we know, Musk could be using it to benefit his own companies. But instead of demanding answers, House Republicans are siding with Musk and refusing to do anything to protect this sensitive data. And committee Republicans have silently watched as Musk and his minions indiscriminately terminate hundreds of thousands of federal workers throughout the nation who are working to serve the public good and to address the needs of the American people. Public servants across the board were terminated. That includes federal workers involved in nuclear safety, monitoring the growing threat of the bird flu, fighting wildfires, ensuring that our food is safe to eat and that air travel is safe too. And these terminations have been chaotic. Some employees receive a message they're fired one day, only to learn the next that it was a mistake. Musk is comfortable moving fast and breaking things, but when American lives are on the line, that's a recipe for disaster. They're also moving ahead with these mass firings without any review of a worker's work history or any analysis of the impact that job losses will have on the government's ability to help Americans. It's been a total fiasco and has shown how incompetent the Musk team is. Now, committee Democrats will not remain silent. We have been demanding answers from the administration since day one, and we're not going to stop. But it's time for committee Republicans to do their job. As it stands, the committee Republicans' oversight plan does not address these serious issues. In fact, it is nearly identical to the plan put forward 2 years ago, despite the dramatically different reality that we're now facing. And this is not an acceptable oversight plan for this Congress and the extreme challenges we face with President Trump in the White House. That's why committee Democrats will be offering amendments to strengthen the plan so that we're not only holding this administration accountable, but also fighting to ensure the government works for everyone. I'm hopeful that Republicans will recognize the need to strengthen this plan and join us in supporting these amendments. And with that, Mr. Chairman, I yield back the balance of my time.
Thank you. The ranking member yields back, and the chairman reminds members that pursuant to committee rules, all members' opening statements will be made part of the record. Are there any further opening statements? Any on the Republican side, any on the Democrat side?
I want to strike the last word whenever you're ready.
So your opening statement, or we bring an amendment up? Okay.
No, I want to strike the last word.
Okay. You want an opening statement? So we'll strike the last word when there's a amendment up before us. You want to wait till the amendment process?
You just speak on the.
Okay. When I call up the plan. Okay, when I call up the gentlelady from Florida? You're recognized for 3 minutes.
Thank you, Mr. Chairman. I want to make sure that right at the get-go of this hearing, we call out the hypocrisy and trying to get by and say this is all business as usual right now. Look, in energy and commerce, we're going to adopt an oversight plan while everything happening outside of these walls is completely outrageous. How about the first week of the Congress? The new president fires 17 inspectors general who are responsible for rooting out waste, fraud, and abuse. That law has been on the books since 1978, where we rely on inspectors general, and in this committee for HHS, for the Department of Energy, for EPA, to root out waste, fraud, and abuse and give us nonpartisan recommendations. I haven't heard one peep from Republicans to say that that is outrageous to fire these nonpartisan IGs. How about the firing and gutting of the FBI and the Department of Justice? The public integrity section here in DC resigned after the Trump administration tried to use DOJ in a coercive, corrupt way regarding the mayor of New York City. How about what the president has done to suspend the Foreign Corrupt Practices Act, the law that says that American companies can't bribe foreign countries? He's taken that law off the books. That I haven't heard one peep. How about some oversight on that? How about, I haven't heard any Republicans talk about the firing of the head of the agency that protects whistleblowers. I haven't heard one suggestion that we should do oversight when it comes to the firing of the head of government ethics, the office that is responsible for policing conflicts of interest and financial disclosure. I haven't heard anything. Your silence has been deafening when the new president and Elon Musk came in and said, we're just going to stop the funds flowing per our congressionally mandated responsibility to make sure that people are healthy and well in America. That was illegal to do. How about oversight on that? This is not business as usual. And I don't want us to start off this hearing today on the oversight plan to say, well, this is just fine. Nothing to look at here, because this is irresponsible, it's reckless, it's corrupt. You're sanctioning taking all of the cops off the beat that make government work for people. Do you just want to blow it all up? Apparently so. So you're going to hear some debate today, because you bear responsibility for this. If you're not going to speak up in the face of illegality and corruption and this mass firing and purge of government officials that are responsible for ethics and oversight, then we're going to make sure that the American people understand what is happening here. I know you're hearing it at home just like we are. And the American people are not going to stand for this kind of corruption. That's just the beginning. I'm sorry I'm out of time, but you'll hear from us all day today on this.
Thank you. The gentlelady yields back. Any opening statement on the Republican side? Any further opening statements on the Democrat side? Seeing none, the chairman now calls up the Committee on Energy Commerce Authorization and Oversight Plan for 119th Congress and asks the clerk to report.
Authorization and Oversight Plan of the Committee on Energy and Commerce, U.S. House of Representatives, 119th Congress.
Without objection, the first reading of the Authorization and Oversight Plan is dispensed with, and the resolution will be open for amendment at any point. The gentlelady from Colorado, what purpose you seek
I move to
recognition?
strike the last word.
Gentlelady is recognized.
Thank you very much, Mr. Chairman. Mr. Chairman, this plan seems generally like the plan from the 118th Congress, but of course, since that Congress, the administration has changed. And now we have an unelected billionaire, Elon Musk, and his illegal agency, DOGE, which are undertaking certain functions. Seems to me that this committee would normally perform that would be normally performed by agencies under this committee's jurisdiction. And so if I may, I have a few questions about this plan to clarify that I would like to ask counsel. First of all, page 2 of the oversight plan includes the following. Quote, the committee will conduct oversight of the National Institutes of Health and the role of federal agencies in research and grant-making policies and procedures, including how the federal agencies approve and monitor grants and subgrantees and the use of indirect costs to ensure the safe, appropriate, and efficient use of federal tax dollars. I would like to ask counsel if this includes oversight of the Trump administration's illegal attempt to cap finance and administration costs for NIH grantees. Would the investigations include that?
We have our counsel. You can answer from here. Okay. Our counsel's going down to the bench.
Ma'am, could you repeat the last part of the question?
Yes. Would the oversight of the NIH and the role of federal agencies in research include oversight of the Trump administration's illegal attempt to cap finance and administration costs for grantees at the NIH?
I'm going to echo what the chairman said in his opening statement. This oversight plan is inclusive, not exclusive.
Good, I will look forward to that hearing.
I'm not in a position to lay out what every single priority is. That's up to the chairman and the members of the committee.
Okay, so I'll ask the chairman later then. Does this include oversight of the delays in grant making in the early days of the Trump administration, including prohibiting NIH employees from announcing meetings on the Federal Register and thus preventing grant making panels from meeting in what appears to be an attempt to circumvent the court order unfreezing NIH grant making?
Through the oversight plan, the authorization and oversight plan for the 119th Congress for this committee is not exhaustive, it's inclusive. If these topics are covered in hearings over the course of this Congress, those will be questions that the members on the dais will be able to ask to the appropriate officials.
I'm gonna take that to be a yes. Under the heading Healthcare Costs, page 3 of the Oversight Plan, it states that E&C will, quote, "examine issues related to the affordability of healthcare, including areas where the federal government intervention has contributed to increased costs for patients and families." Now, vaccines, as we know, are a cost-effective and proven tool for preventing communicable disease and the costs associated. So here's my question, Council. Will this oversight extend to examining how Secretary Kennedy has and continues to spread disinformation about vaccines, which would lead to unnecessary illnesses, deaths, and healthcare expenditures?
That's a policy question, should be directed to.
No, sir. I'm just asking if it would include those issues around Secretary Kennedy's views on vaccines.
Ma'am, again, this oversight plan, as the chairman said at the outset, is not exhaustive, and there'll be plenty of opportunities to examine issues through the course of the Congress at our hearings and ask the questions.
Right, so I'm going to also take that as a yes. Now, on page 2 of the oversight plan, there's an intention to examine authorities related to preparing for and responding to chemical, biological, radiological, or nuclear threats, and to reauthorize reauthorize those necessary with appropriate changes to reflect the abuse of power and lack of transparency in scientific recommendations witnessed during the COVID-19 pandemic. So I'm just going to ask you, would this include oversight of President Trump saying COVID-19 would simply vanish, or him encouraging injected disinfectant as a solution for COVID-19?
Again, this is a policy question. This is a markup of the oversight plan considering, and it's very reflective of past Congresses for the Republican majority. And so, again, I think, you'll be able to ask these questions in the appropriate time and manner, but asking here during the markup of the oversight plan.
So what I'm hearing council say, Mr. Chairman, is that all of these
Time's
issues
expired.
would be included within the plan, and you can bet we intend to ask those questions as the hearings proceed.
Thank you.
Thank you, Mr. Chairman.
Gentlelady yields back. Are there any bipartisan amendments to the work plan? Seeing none, are there any amendments to the work plan? The gentleman from New Jersey is recognized. What purpose does the gentleman from New Jersey seek recognition?
To speak on Amendment 01-4, which I sponsored. Oh, I'm sorry, OI 4, like oversight, I guess.
The clerk will report the amendment.
Amendment to draft oversight plan, OI number 4. On page 14,
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. This amendment would add to the committee's oversight plan a commitment to examine the Trump administration's funding freeze, whether that funding freeze violates the Constitution, and whether the administration is complying with court orders that require the funding freeze to stop. Conducting this oversight is essential to ensuring that the balance of powers is respected in this Congress. The voice of the people in our democracy is not silenced. On his very first day in office, President Trump violated the Constitution by issuing an executive order that stopped congressionally obligated funds from being dispersed. These were funds that Congress promised the American people, and on day one, Trump decided to steal this money from the American people, from businesses and our communities. Since then, the administration has issued other orders, including guidance by OMB that was eventually withdrawn to put a stop to virtually all federal funding. They've also taken other steps to block money from going out through programs that this committee has jurisdiction over at HHS, DOE, and EPA. Now, these loans, grants, and other types of funding improve the quality of American lives. Substance abuse treatment clinics rely on federal grant funding. Cancer research does as well. The Low-Income Home Energy Assistance Program, which helps ensure Americans do not freeze in their homes, is funded by the federal government, as are numerous projects aimed at growing renewable energy sources and lowering energy costs. And so are efforts to remove the lead pipes from drinking water systems. Federal funds also ensure that Americans can manufacture semiconductors and microchips domestically to compete with our adversaries and fuel innovation. Other federal programs work to provide all Americans with reliable high-speed internet. Now, the courts have issued restraining orders against this funding freeze, requiring that the administration release these promised funds. But it does not appear, and I can tell you from my own experience in New Jersey, it does not appear that agencies are complying with court orders, and some appear to be manufacturing excuses and procedural hurdles as an excuse to not comply with the courts. This is a constitutional crisis, in my opinion, when the executive branch ignores Congress by refusing to spend appropriated funds and then ignores court orders requiring that they do so. Our system of checks and balances falls apart. Now, committee Democrats have already begun oversight by sending letters to HHS, DOE, EPA, and Commerce asking for information from each agency about effective programs and compliance with court orders. To date, only EPA has responded, and it did not meaningfully answer the questions that we asked. And I would remind the chairman, which he knows, that oversight is not just hearings, it's also investigations. It's also questions that you ask of agencies. The bottom line is that the Trump administration's freeze on funding was unconstitutional to begin with. It is our job here in Congress to decide what money is spent and how it's spent, not the president, and certainly not Elon Musk. And to protect the role of Congress and to protect our constituents from a president who is stealing this money from the American people, the committee must stand up to the president and conduct oversight on what the executive branch has done here and why it believes it can continue to ignore Congress and the courts. And that's why, Mr. Chairman, I'm offering this amendment. I yield back.
The gentleman yields back, and I would like to recognize myself to speak in opposition to the amendment. The proposed oversight plan contemplates oversight and accountability of spending at the departments and agencies under our jurisdiction. And moreover, the oversight plan is inclusive. It is not exhaustive. And lastly, related to the Article 3 courts in the Constitution, it's left to the judiciary. Article 3, judicial authority is vested in the Supreme Court and other courts as Congress may see fit to establish. And Congress's role is to legislate. And so we should deal with this through the legislative process, not through the judicial process. And this amendment is unnecessary, and I would encourage my colleagues to oppose the amendment, and I will yield to the gentleman from Alabama, Mr. Palmer.
Mr. Chairman, I think you accurately articulated the reasons why this amendment should be voted down. We have responsibility in Congress to handle the legislative functions, and I think we will do that in due time. I yield back.
Gentleman yields back. I yield back my time. Is there anyone else seeking recognition to speak? The gentlelady from Virginia is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chair. I move to strike the last word.
Gentleman's recognized. Gentlelady's recognized, sorry.
These funding freezes have had real consequences in our communities right now. After the funding freeze, community health centers in Virginia had to close their doors because they couldn't access funding from the federal government to pay their staff and stay in business. These community health centers provide essential services such as preventing and treating substance abuse disorders, delivering primary care and dental care, and offering low-cost prescription drugs. And for many families, especially in rural areas, they already have to travel far. They already live in healthcare deserts and pharmacy deserts, and the president's funding freeze made that situation even worse. Just yesterday, there was an article that came out in one of my local papers that talked about the increase in the number of pharmacy deserts. In Virginia, there are 51 pharmacy deserts, and these have all been identified in areas that have higher proportions of Black residents, uninsured individuals, or individuals only covered by Medicare and Medicaid, low-income households, and areas of poverty. And it identified 2 pharmacy deserts in Manchester and Fulton neighborhoods in the city of Richmond, which I represent. And earlier this month, directly in response to the president's funding freeze, the Capital Area Health Network had to close its doors in both its Manchester and Fulton locations. And those patients who had appointments were told, your appointments have been canceled, you need to go to a different health center. And the pharmacies that are in those health centers are now not available to those patients, getting rid of one of the few pharmacies that exist in those pharmacy deserts. I also spent some time in the southern part of my district, which is very rural, during the break. These are people who, many of whom work in Newport News for the shipyard, many of whom have to drive either to Richmond or Newport News for health care. And when the South Side Community Health Center closed, which is about halfway between the southern part of my district and the city of Richmond, those folks now have to drive an extra 30 minutes to get access to essential health care. And so the reason I support this amendment is because this is just one example of many, how an illegal funding freeze that the courts have said reverse are still having an impact on vulnerable communities for people who just want to be able to get their prescriptions filled for life-saving medicines or get access to preventative care or emergency care, and these funding freezes have made it even harder. These are our neighbors, these are our friends, these are our veterans, these are caregivers for many of our other families, and we cannot sit by while the administration ignores court orders when those court orders could literally be life and death for many of our constituents. Thank you, and I yield back.
Gentlelady yields back. Thank you. I will just remind that we got several amendments, so I'm going to stick to the 5 minutes. So thank you for yielding back. And so next I had the gentlelady from California, and then gentleman from Ohio. Well, any Republicans? Gentlelady from California recognized for 5 minutes.
Thank you, Mr. Chairman. I just want to make sure that everybody at home knows what's happening today. What we're doing here today in this committee is we're adopting an oversight plan. This is the plan of what this committee will conduct oversight in this Congress. In the short time since we've had a new president, there has been chaos and a slew of executive orders that have caused impacts on our constituents across the country. This particular amendment is about funding freeze. It's about basically what I call the Trump shutdown, the shutdown of dollars that Congress has allocated and the need for this committee to provide oversight on those impacts. Now, the oversight plan, I'm going to read from the actual document, says, this is supposed to include where the committee expects to conduct oversight in the 119th Congress. Later on, it says, the Committee on Energy and Commerce will hold hearings and conduct rigorous oversight over matters within its jurisdiction. Well, impacts on community health clinics are within our jurisdiction. Funding for the National Institutes of Health are in our jurisdiction. My colleagues on the other side of the aisle, you can't see them on camera, but they're laughing. This is no laughing matter. This is a serious matter about what is happening to the American people and the impacts and the concern about access to health care. I've heard from constituents and non-constituents across the country. And why does this need to be put in writing? Frankly, because we cannot trust that the other side is going to actually provide oversight. Why do I think that? Well, because Republicans have been totally silent. Where have they been standing up for their constituents? Where have they been standing up for their community clinics? Nowhere. Total silence. Why? Because they are deathly afraid of Donald Trump. They are deathly afraid of this president. So why are amendments needed to this very general oversight plan? Because there's not a single mention of providing that oversight. And we have specific instances right now of things that have actually happened, like the funding freeze. So yes, it needs to be added to this oversight plan. This is the time to do it. Why? Because if it's not done, our House Republicans who set the agenda can decide not even to hold an investigation or a hearing on the matter. And that is why this amendment is needed, and that's why the rest of the amendments that we are proposing on the Democratic side need to be put into this oversight plan. And with that, I yield back.
Thank you. The gentlelady yields back. Anyone on the Republican side? Seeing none, gentleman from Ohio, you're recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chair. I move to strike the last word and speak on the amendment. The purpose, as my colleague just mentioned, of this hearing is around our oversight responsibilities, and the amendment gets at our responsibility, our duty to ask questions and to hold people accountable for, in this case, adhering to court orders around unlawful withholding of federal funds. And obviously, and this has huge implications for our communities. People have been, they've lost their jobs, whether they work for the federal government or not. The federal freezes have eliminated roles. People are, I mean, unemployment is going up because of this, and healthcare is being diminished. I guess my question, and I hope this is in order, is the chair said, and maybe I just misheard it, was that the objection to the amendment is that the Constitution grants the Congress the responsibility to legislate. But it's not just to legislate. Our role is to provide oversight too. Oversight to federal rulemaking, how funds are spent, waste, fraud, and abuse. I think the American people are very frustrated with the fact that this Congress has not asked any questions whatsoever about what's happening with the president and with Musk, the data breaches, the withholding of funds, the indiscriminate firing of people. And as we sit here and look at a budget that's being proposed that will slash health care from tens of millions of people, where is the understanding coming from that we're not responsible for oversight, that we aren't responsible to bring these people in and ask questions, at least ask questions as to where this money is, why it's being withheld, the impact it's going to have on people's lives? Isn't that in the Constitution of the United States? I mean, this is Article 1, Section 8, that says that we are responsible for oversight. At what point do we do that? At what point does the majority say we are going to take this seriously and we're going to at least ask questions? We're going to bring in folks from the administration and say, how is this possibly legal? I yield back.
Gentleman yields back. Anyone else seeking recognition to speak on the amendment? Gentleman from Alabama?
Thanks, Mr.
Gentleman from Alabama? Oh, that's right, I yield to you, so you're recognized. You have your 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. I won't need it. I just remind my colleagues on both sides of the aisle that the Biden administration refused to spend the money that was allocated by Congress for building a border wall, and in fact tried to redirect it, and it took a court order to stop that action. I yield back.
Gentleman yields back. Is there any other discussion? Seeing none. Okay, if there's no further discussion, the vote occurs on the amendment. A roll call has been requested. The gentleman from New Jersey requested a roll call vote, and the clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? No. Mr. Griffith votes no. Mr. Bilirakis? No. Mr. Bilirakis votes no. Mr. Hudson?
No.
Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce?
No.
Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Allen votes no. Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes no. Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Ms. Lee? Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Ruley? Mr. Ruley votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone?
Aye.
Mr. Pallone votes aye. Ms. Deget? Aye. Ms. Deget votes aye. Ms. Schakowsky? Aye. Ms. Schakowsky votes aye. Ms. Matsui? Aye. Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko?
Aye.
Mr. Tonko votes aye. Ms. Clark? Aye. Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Vesey? Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Mr. Hand? Mr. Hand votes aye. Ms. Fletcher? Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie?
I vote no. How's Ms. Fletcher?
Chairman Guthrie votes no. Ms. Fletcher votes aye.
Anyone, Mr. Kane?
Mr. Kane votes aye.
No,
Or sorry,
you voted no.
Mr. Kane votes no.
Anyone else seeking recognition to call the roll? Okay. Mr. Fry, how's Mr. Fry recorded?
Mr. Fry is not recorded. Mr. Fry votes no. Mr. Carter of Georgia is not recorded. Mr. Carter votes no.
The clerk will report.
Chairman Guthrie, on that vote, there were 22 ayes and 28 noes.
With 22 ayes and 28 noes, the amendment is not agreed to. Are there further amendments? Gentlelady from Colorado, for what purpose you seek recognition?
Thank you, Mr. Chairman. I have an amendment at the desk, HE 6.
The clerk will report. What, did you state the amendment again? I'm sorry.
HE 6.
HE 6.
Amendment to Draft Oversight Plan, HE 6. On page 4, under the section Food.
Without objection, the reading of the amendment is dispensed with, and the gentlelady from Colorado is recognized for 5 minutes in support of the amendment.
Thank you so much, Mr. Chairman. My amendment is relatively simple. It says the committee will examine the impact of the administration's termination of employees on the ability of HHS to effectively protect the public health. Now, Mr. Chairman, I was appreciative that you and counsel, when I was asking my questions, said that this plan is inclusive but not exhaustive. But as I know from my many years in Congress, it's inclusive to what the chairman and the majority party want to have hearings about in oversight investigations and also investigations. I think that it's really critical that we have specific instruction in our oversight plan that we need to look at the impact of termination of employees of HHS. In the past couple of weeks, Donald Trump and Elon Musk have moved to lay off thousands of HHS employees. How many have been laid off? Well, the exact number's unclear, but news reports suggest at least 2,500 and maybe many more. My staff and I have been asking HHS for an accounting of layoffs since February 14th, but in a stunning lack of transparency, HHS has not provided any of these basic facts. Elon Musk and his Doge minions are firing federal workers indiscriminately and seemingly without regard to workers' performance or function. The firings are aimed at the easiest people to fire, people on probationary status, and they're not being carried out in a way that bears any semblance to protecting public health and serving the American people. No plan has been articulated, and so one has to ask, what's the goal here? Because to me and my constituents, Elon Musk, Donald Trump, and Doge's actions frankly appear childish and chaotic. The United States should be a bastion of consistency and reliability, especially in the area of public health. At FDA, 89 people in the Human Foods Program have been laid off per former program director Jim Jones. 89 people in the Human Foods Program, the people who make sure our food is safe, have been laid off. This includes 9 people who study chemical food additives and keep dangerous chemicals from the food supply, a goal the new administration has played lip service to sharing. And I'm sure that you, Mr. Chairman, and the Republicans on this committee also say that you share. At NIH, workers researching to understand and eventually cure cancer were fired. These cuts will slow down cures and cost lives. Each day, new breakthroughs are delayed for any reason, political or otherwise, is a day that a family cannot fight a disease of one of their loved ones. And now, NIH directors have been told that they must cut back personnel by 10% at the NIH. Many of my colleagues on the other side of the aisle have worked with me for decades to increase NIH research, to help find cures more quickly for everybody. How does just laying off 10% of those workers help us, number one, with American supremacy in biomedical research, and number two, in finding these cures that we need? Even the new administration seems to have recognized at times that the chaos has been harmful to public health. Apparently, the administration is now scrambling to hire back Center for Devices and Radiological Health employees who were fired as part of this politically motivated and ill-conceived purge. Look, Congress is the people's house. Elon Musk and Doge are ignoring Congress's directives in slashing the federal workforce and preventing the executive branch from carrying out our instructions. In the meantime, I have seen no effort by my colleagues on the other side of the aisle to help us resolve this chaos that impacts the very basic healthcare research we're trying to do in this country that we all work together on every day. We've got to examine how these firings impact HHS missions and diminish American competitiveness. My amendment is simple. It's a simple one, and I think we should have a hearing maybe next week if we can. I would seek to examine the impact of Doge firings on HHS's mission and ability to protect public health. This should be a no-brainer. And honestly, I'm baffled if anybody would not vote for this amendment. I ask for your support, and I yield back.
Gentlelady yields back. The chair recognizes the gentleman from Georgia for 5 minutes on the amendment.
Thank you, Mr. Chairman. Mr. Chairman, Republicans have always been strong stalwarts of innovation and research with the goal of ensuring our patients are healthier and our health systems are stronger and more efficient. However, as we witnessed during the COVID-19 pandemic, our public health agencies at a fully staffed level, I would like to point out, failed in a lot of ways. Gaps were exposed, fault lines were discovered, and people's trust has been broken. Before jumping to conclusions about the decisions that were made, let us remind you it has been barely a week since these notices went out. The American people clearly support the President's goals of eliminating government waste and bloat, and they want us to streamline our regulatory bodies. So before jumping to unsubstantiated claims that these cuts will hinder such innovation and research or negatively impact our preparedness and response infrastructure, let us take a moment to look and see what further action the administration takes to improve the efficiency, the transparency, and overall effectiveness of our public health system. Let us all reflect on how we can work to improve the infrastructure that failed us during COVID-19, and it did fail us. We all want our public health system to work to ensure our patients to get healthier. So let's give the administration the opportunity to do so. After all, the mandate they were given in November, what 77 million people voted for, what 77 million people said was, yes, we want to change. Yes, we want to see what this president can do. Mr. Chairman, I yield back.
Will the gentleman yield?
I yield.
So I would just say to my chairman, all these things you were saying, we need to see how this is going to work. That's exactly what this amendment says. Let's have a hearing on it and see if it's working. That's all I'm saying. Let's have a hearing and see if these labor cuts to HHS are actually achieving these goals.
Reclaiming
I
my
yield back.
time, Mr. Chairman, I believe the gentlelady said earlier she wanted to have the hearing next week. So we're going to make
That'd
these
be
kind of
great.
determinations in only a 2-week period? I think it's going to take a little bit longer than that for us to understand exactly how this works.
Yields back. The chair recognizes the gentleman from the gentleman here from California.
That's you first.
You go, gentleman.
Thank you, Mr. Chairman. First of all, let's be clear. There is no mandate. President Trump did not win more than 50% of the American population's vote. Let's stop this nonsense. It's only a ploy to try to make it seem as if these policies are extremely popular with the American people, and I can tell you that they're not popular right now. When you talk about illegally freezing or illegally making sure that the programs and the funding that Congress directs to the administration are not carried out as intended. I also need to argue under the premise that the men and women who put their lives on the line to protect us during COVID-19, that they failed. That's absolutely wrong. It's demoralizing, and it is also manufacturing distrust against the institutions that got us out of the pandemic. I mean, let's look at where the Biden administration was when they inherited the problems that the Trump administration left behind. There was over 1,000 people a day dying from COVID-19 because of the men and women from the FDA and the CDC and HHS that got together and helped us develop the vaccine and the massive record-breaking distribution of that vaccine in collaboration with states. We were able to put kids back in schools, people back into jobs. We were able to reduce the transmission of the vaccine. We were able to save lives. And look, we're here now without a mask. We're here now being able to do our daily functions without having to be careful or concerned about a deadly airborne virus coming around to put you in the ICU or to take your life. So I strongly disagree with that premise, Mr. Chairman, that the fine men and women who protected us and carried through the implementation of the public's health programs that got us out of that pandemic, that somehow they failed us. What did fail was the manufacturing of distrust that the Republicans on the other side repeatedly over and over again, saying that somehow vaccines were going to cause more risk of acquiring COVID-19, quote unquote, in some of our committee hearings, in the select subcommittee on the coronavirus pandemic, or that somehow wearing a mask to prevent aerosolized droplets in the air to protect others from breathing that in, that somehow that was child abuse, or that was going to cause you to get sick even more. I mean, all of these complete scientifically provenly false claims that somehow these conspiracies get into the psyche of the American people, that there was some kind of deep state collaboration between our public health leaders who collaborated with China and others that somehow, knew this was happening and covered it up. That continues to be the conspiracy theory narrative regarding the pandemic, and all of that manufactures distrust. So no, you're not going to get away with it. No, the fine people that work at CDC, HHS, NIH are still working tirelessly to keep us safe. And you cut those jobs, they're not going to be able to help us rapidly develop that vaccine. You cut those jobs, we're not going to be able to monitor a new pandemic virus emerging in another country or even here in our own country. You cut those jobs, we won't be able to communicate with the American people about the safest way to keep our country and our public healthy. So with that, I agree with this amendment. I urge everybody to vote yes.
Gentleman yield.
And I yield to Representative Peters.
I only need 20 seconds. I want to say I agree with Mr. Carter The sum total of this amendment is this: the committee will examine the impact of the administration's termination of employees on the ability of HHS to effectively protect the public health. Is there anyone in here who doesn't want to do that? We're not going to do it today, and we don't have to do it next week. This doesn't say next week. All it says is we will examine the effect of these terminations on the ability to protect public health. This seems like something we shouldn't be fighting over. And with that, I yield back.
And so in other words, you agree with this amendment and vote yes to ensure that these cuts don't affect their ability to implement what they're assigned to do. I yield back. Thank you.
Gentleman yields back. Is anyone seeking recognition on the amendment? I will recognize myself for 5 minutes and yield to the gentleman from Georgia.
Thank you, gentlemen, for yielding. Mr. Chairman, as you have stated at the beginning of this hearing, and it has been stated all along, this plan is not exclusive. It is inclusive. And we know as we move on that we're going to have to address a number of different things. This committee has the most jurisdiction, the broadest jurisdiction of any committee in Congress. We should keep that in mind. It would be virtually impossible for us to include in this plan everything that we're going to be looking at. So I remind my colleagues on the other side of the aisle that we are going to be looking at things as we go along. It is going to be inclusive, but this is not exclusive. We can't possibly list everything, and that's why this amendment is not necessary. And I encourage my fellow colleagues to vote against this amendment. And I yield back.
Gentleman yields back to me. Is there anybody requiring same time on my side? Seeing none, I will yield back, and I'll recognize the gentlelady from Washington, then New York next.
Thank you, Mr. Chairman. I move to strike the last word and support Ms. Diggett's amendment. What we've been seeing is taking a hatchet to the federal government, at least 10% cuts across the board. I actually just took a moment to jot down 10 things off the top of my head that the FDA does. And I wanted to just see which of these 10 things anybody would like to do away with. So let's start with this. The FDA keeps our food safe. Thought I'd mention that as we think about going to the supermarket and how much we're paying. It investigates outbreaks. You know, I took care of some kids as a pediatrician, and their mom was one of the kids who got sick in that Jack-in-the-Box outbreak, almost died from it. FDA got to the bottom of that. Remember the baby formula issue just about a year or two ago? That's the FDA's job. Okay, so that's 2. Number 3, keeps the drugs we take safe and makes sure that they are safe and effective. And as we all hunger for drugs to treat Alzheimer's, for example, we're counting on the FDA to speed those to market. Medical devices, they regulate those as well. I use an insulin pump, probably somebody in this room, and if they're not, they probably will be soon, uses a pacemaker. And I think we all want to know that those are safe. All right, here's number 5, approves medical tests. We saw the benefit of home testing during the pandemic. Number 6, medications for animals. Think about our food supply chain and wanting to make sure those animals are healthy, not just for their own sake, but for our human health's sake. What about immunizations? A hot topic these days. You'll probably hear from me, the pediatrician, again about this today. Approving them, making sure they are safe and effective. You know, they also inspect and regulate blood banks. I don't know if anybody in this room has required a blood transfusion. Probably somebody out there listening has, but boy, I want to make sure that that blood is not tainted and is safe for me in an emergency. Number 9, oversight of clinical trials. That's part of making sure that our drugs work, our immunizations work, and we have good data behind it. And then I thought I would circle back to number 10, vaccinations for animals. You know, I have Wilcox eggs in my district. if you go to Costco in Washington State, you're getting Wilcox eggs. They are a massive producer. Very afraid of what would happen, as all of us are, if their chickens were infected with bird flu. They can't wait to get a vaccine to protect their birds. And the FDA would be the organization to approve that. So I want to know, like, if we're talking about a 10% cut, which of those 10 do you want to cut? Have my colleagues thought about that and the work that they do and how important it is to all of us? I also wanted to remark on the term "the people want," because we've been hearing a lot of that in the news, in my colleagues' talking points, the people want. And I just want to tell you that, first of all, there is no mandate here. Second of all, the people in my district, they want safe food, safe medical systems, safe medicines, safe devices, and safe blood when they are in an emergency. I yield back.
Gentlelady yields back. Bob, you want to take 5 minutes? Gentleman from Ohio,
Thank you, Mr. Chairman. Strike the last word,
gentleman's recognized.
and I yield my time to the chair of the full committee.
Thanks. I appreciate what my friend from Washington, doctor from Washington, has said. And in the committee work plan, it says the committee will work to ensure the FDA is fulfilling its mission to ensure that regulated drugs, medical devices are safe, your list, effective, and available to American patients in an expeditious fashion. And I will tell you that we will monitor it, and we will make sure. We also want them to be efficient. We don't want to waste taxpayer dollars. And all the things that DOJ is trying to do, but we will ensure that FDA is operating to make sure our citizens, as my friend from Colorado talked about, and you've talked about, have safe, effective drugs in an expeditious fashion, and we'll have oversight to make sure that happens. And I will yield back to the gentleman from Ohio, who yields back. Thank you, Mr. And so we have the gentlelady from New York. We're taking recognition. The gentlelady's recognized.
Thank you. Move to strike the last word. Thank you, Mr. Chairman. I think it's important to, one of the comments that was made earlier is this idea that our concerns around our medical systems and research is unsubstantiated, that it's, quote, been just a week. But as someone who represents a large hospital network that receives a lot of research funds, telling people to wait, that it's just been a week, that we don't need to be so concerned, I think you should tell that to someone with an experimental pacemaker that's inserted in their body right now whose research is now imperiled. We've got folks in these systems, researchers, people who support this research that have just been laid off, people with medical devices, experimental medical devices implanted in their body that have been abandoned due to this reckless idea that we can just come in and lay off dozens of public servants as though their work does not matter, as though it has no impact on everyday people, as though these breakthroughs are not imperiled. The way that scientific research works, you can't just blip things and turn things off. Cancer research, medical research, short-term research, cell cultures, these are not things that you can just take out of a fridge, dump it, and put it back in again. Companies, when we talk about innovation in our treatments, companies are working to try to get these treatments approved. And these kinds of blips and delays and disruptions in sensitive scientific processes may force these experiments to start all over again, delaying approvals by months, if not even years. This amendment is very simple. It is not asking for extra dollars. It is not asking for large changes. It is not asking for structural shifts. It is saying that we need to examine these disruptions and the impacts that they have been having on everyday people to make sure that people are still safe. And respectfully, as it pertains to the FDA already being mentioned in oversight plans, in previous oversight plans, one thing that is not included in previous oversight plans that is different from today is DOJ. Doge did not exist 2 years ago. 19-year-olds were not raiding the Treasury 2 years ago. People who have no idea with medical background have not been hauling in and creating kangaroo courts for scientists to dismiss them 2 years ago. That started happening now. Elon Musk is not a scientist. He is not an engineer. He is a billionaire con man with a lot of money. He does not have this kind of good background. And in fact, while there's some disruption over that, I sincerely ask you all to examine what expertise he has in approving medical devices, in biomedical engineering devices. And if you all think that he is an expert in that, I've got a bridge to nowhere to sell you. These are people's lives that are on the line, and we cannot laugh them away. Genuinely, please, I am asking you to please support this amendment for the people who have medical devices stuck in their body. Thank you, and I yield back.
Gentlelady yields back. Is there anyone on the Republican side? Seeing none, the gentleman from Ohio is recognized for 5 minutes.
Yep, thank you. Move to strike the last sentence in support of the amendment. I am legitimately confused. People are being indiscriminately fired. And while this committee has jurisdiction over a lot, it doesn't have jurisdiction over everything, but it certainly has jurisdiction over Health and Human Services and the FDA and everything that is going to impact people's health care. Tens of thousands of public servants have been fired. All the amendment says is that we should care, that this committee should provide some oversight to push and prod and ask questions. What is the impact of these firings on the people that we serve? Why are people so afraid of this guy? And if not him, why not bring in these kids that are in our data system, that are in the payment systems, that are doing the indiscriminate firings of people that are doing critically important jobs? Why not bring the kids in and say, like, what are you doing? How is this going to impact people's health care? That's all the amendment does. It's not adding, to my colleague's point, adding anything other than language that says we are going to care. We are going to bring folks in and ask questions. It's a few dozen sentences. Not this amendment, all of the amendments. All of the amendments, it's a combination of, if you add it all up, it's a few pages. Why is this not all bipartisan? I wish people would reconsider and say, know what? We are going to support these because we agree that this is a hostile takeover of our federal government, and at the very least, this Congress is going to ask questions. I yield back.
Gentleman yields back. Anyone on the Republican side? Seeing none, Mr. Trahan, you're recognized for 5 minutes for support the amendment.
Thank you, Mr. Chairman. You know, one thing that's interesting to me on this particular amendment is that the overwhelming response from the other side is, look, this oversight plan is inclusive, not exclusive. We're going to build upon this. Of course, if we see changes, we'll adjust the plan. But, I mean, you understand that we're not going to be comforted by your faith-based arguments, right? Like, there's not a huge level of trust that you're all going to suddenly step up and do the right thing when you've all remained super silent on these mass firings across our health organizations. So it's just that is like not assuaging the concerns of the American people. It certainly isn't assuaging ours. If I was writing this plan for the 119th Congress, the oversight plan, I wouldn't have a copy and paste of the 118th Congress because so much has changed just in the first 5 weeks of this Congress. Things that should be reflected in this plan. Why wouldn't we want to understand the impact of layoffs on the CDC, on the FDA, on HHS, on NIH? That seems like something we would normally agree on if we weren't prioritizing loyalty over oversight and over checks and balances, which is our primary role here. So I don't know. I think one of the things that has become abundantly clear is that we would like it in black and white because the cuts are happening now. The layoffs are happening right now. People are being affected right now. And you all don't seem to take it seriously or to hold it in any sort of priority to put it in the plan of how we're going to conduct oversight in these next 2 years. I yield back.
Gentlelady yields back. Anyone on the Republican side? Seeing none. Gentleman from New Jersey is recognized for 5 minutes on the amendment.
Thank you, Chairman. I move to strike the last word. Thank you. The new HHS Secretary has promised an agenda of Make America Healthy Again. Let's take him at his word. If we want to make America healthy again, we can safeguard against future pandemics. We can increase public education about the most common chronic illnesses that exist in this country. We can spread the word about the safety and efficacy of vaccines. We can invest in future research for deadly diseases like cancer and Alzheimer's. But we can't do that if this administration, the Republican Party, fire public health workers across the country who, for the record, are public servants. Because my colleagues across the aisle are so focused on cost savings, even at the expense of the health and well-being of the American people. Let's put cuts to public health in perspective. For every dollar spent on public health interventions, the median ROI is more than 14 to 1. So as you make these cuts and fire these public servants, you're costing a lot more money than you're actually saving. So if you truly believe in making America healthy again, by all means, we're with you. Let's stand together, fund public health, and ensure that we provide life-saving coverage and treatment for everyone who needs it. Let's make sure that we have the public employees that we need, the federal employees, the public servants that we need to make sure that we are keeping America healthy. We all know that this plan is a 2-year plan. So over the next 2 years, we need to be able to do what this amendment calls for, which is to examine the impact of the administration's termination of employees on the ability of HHS to effectively protect the public health. And I join my colleague, Congresswoman Ocasio-Cortez, in asking, when will you be ready to do so? If a week isn't soon enough, is 2 weeks is too soon? When will you be ready to ensure that we are properly conducting oversight of HHS and the number of employees that they need to effectively protect the public health? I just remind all of our colleagues that on page 1 of the plan, it says that we should conduct oversight by reaching conclusions based on an objective review of the facts. And I, for one, do not trust this administration to deal in facts, so it's our obligation to do so here. Thank you, and I yield back.
Thank you. The gentleman yields back. Anyone on the Republican side, anyone on the Democrat side seeking recognition? Gentleman from New York, Mr. Tonko.
Thank you, Mr. Chair. Over the last several years, I've been meeting with families concerned about rare diseases and families impacted by the addiction crisis. Their hope is driven by efforts at the FDA that can discover new opportunities to address those health concerns, to combat them. Their hope is being suffocated, and it's unacceptable. I know that my good friend and subcommittee chair, Carter, has said, well, give it time. I don't think the people like what they've seen in the first 30-some days. This is totally unacceptable. They want to know that there is science-based, evidence-based discussion. They want to know there's thoughtfulness and academics applied to how we reinvent these efforts. They don't want pell-mell cuts. They don't want an on-again, off-again, stop and start, delay, court stay atmosphere that is not providing stability and is threatening the very existence of research that's being conducted and performance at FDA that is providing that hope. They don't want us to suffocate that hope. Now, many of us in the last several days have had town halls. And I can tell you at my town hall, 1,100 people wanted to know, what am I doing? What tools am I utilizing? What am I doing to make a difference? And I said, well, I'll show you one. I'm going to go as a member of this committee, Energy and Commerce, and address the markup of our oversight plan. That's the tool we have available in the minority. And so I ask that you be sensitive, that you be smart about this, because they don't appreciate the atmosphere, which is a clown show type atmosphere. They deserve more. The respect is not shown to our American families, especially those who are struggling. And we're allowing this clown show to be conducted by a team that is not well-versed in the issues. that is not utilizing inspectors general to guide them with fraud and inefficiencies and waste. We're allowing this to be left to a person who wields a chainsaw in the middle of activities, speaking callously and insensitively to the hurt and the harm that is being done by these cuts. They don't like what they're seeing in the first 30 days. They want better. And we're saying, as a team here on Energy and Commerce, please say yes to some of these opportunities that enable us to advance the cause and concerns of so many people out there who are watching this, and they are not happy. You can see the polls precipitously dropping for the leadership of this country, and rightfully so. And with that, I yield back.
Gentleman yields back, seeing no one on the Republican side, anyone on the Democrat side? Seeing none. Okay, going to be a roll call has been, sorry. If there's no further discussion, the vote occurs on the amendment. Gentleman from New Jersey has requested a roll call vote, and the clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Carter of Georgia? Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Allen? Mr. Allen votes no. Mr. Balderson? Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Ruley? Mr. Ruley votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko?
Aye.
Mr. Tonko votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Vesey? Mr. Vesey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Trahan votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no. Mr. Carter of Georgia is not recorded. Mr. Carter of Georgia votes no. Mr. Balderson is not recorded. Mr. Balderson votes no. Mr. Weber is not recorded. Mr. Weber votes no. Chairman Guthrie, on that vote, there are 23 ayes and 27 noes.
The amendment is not agreed to. Are there further amendments? The gentlelady from New York, what purpose you seek recognition?
Mr. Chairman, I have an amendment at the desk.
The clerk will report.
Mr.
It's
Chairman, could you please?
Oh, the number, the amendment
Yeah,
number?
it's OI1.
The clerk will report.
Amendment to draft oversight plan OI1 on page 14 after the section entitled.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Mr. Chairman, I'd like to call up the amendment labeled OI1, which has been done. Just days after taking office, Donald Trump attempted to remove at least 17 inspectors general from their posts. This includes the IGs from the Departments of Energy, Health and Human Services, Commerce, and the Environmental Protection Agency from this committee's jurisdiction alone. This purge is not only in violation of the law, but it is an alarming attack on the transparency and accountability of federal agencies under the Trump administration. IGs provide independent and objective oversight. All members of this committee know that IGs are regularly called to testify at our hearings because their reports and findings are nonpartisan and reliable after lending to legislation or other congressional action. After leading to legislation and other congressional action. IGs are empowered to look for waste, fraud, or abuse and ensure that our federal tax dollars are spent in accordance with congressional intent. And in fiscal year 2023 alone, IGs saved the government $100 billion. All members of this committee should be outraged by these brazenly unlawful actions jeopardizing the effective and efficient execution of our federal laws and programs. Instead of outrage, however, committee Republicans seem engaged only in lip service about the need to ensure accountability and to cut waste, fraud, and abuse at our federal agencies, and are quite comfortable and smug about relinquishing their own authority to two men, one unelected, who are the sole arbiters of what constitutes transparency and governance. Republicans are clearly more interested in playing politics than protecting taxpayer dollars. And House Republicans also have been silent about Elon Musk and his minions slashing jobs and freezing funding government-wide without any regard for whether the chaos they are creating is actually addressing waste, fraud, and abuse. So I want to urge my colleagues. On the other side of the aisle, my Republican colleagues, to take oversight seriously, regardless of which party controls the White House, and support this amendment. With that, Mr. Chairman, I yield back.
Thank you. The gentlelady yields back. The gentleman from Alabama seeks recognition. Recognized for 5 minutes.
Thank you, Mr. Chairman. I'd like to speak in opposition to the amendment. The oversight plan before us already contemplates this topic. The plan explicitly states that the committee will examine departments and agencies under its jurisdiction to ensure adequate and prompt implementation of recommendations from the administration, the offices of Inspector General, the Government Accountability Office. This language is broad enough to include oversight of Inspector General offices within the agencies under this committee's jurisdiction, ensuring they continue investigating and reporting on waste, fraud, and abuse. The Inspector Generals must be independent, but they are not above oversight. The committee has a responsibility to ensure Inspector Generals remain focused on their core mission rather than engaging in politically motivated investigations. The amendment is unnecessary, and I urge my colleagues to vote no on the amendment. Mr. Chairman, I yield back.
Gentleman yields back. This recognition, gentlelady from Florida is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. Remember how we got here. In the new president's first week in office, on a Friday night, he purged and fired inspectors general across the federal government. These are the folks who are responsible for rooting out waste, fraud, and abuse. The president at that time called them rogue partisan bureaucrats, which is a lie. These are nonpartisan inspectors general. Many of them that have jurisdiction of Department of Energy and EPA have pretty strong Republican backgrounds, actually. The new president said that this is a common thing to do. That's a lie. It is not common practice to sweep into office and abuse your power and to fire inspectors general. So, Mr. Chairman, I have a question for you. I have looked at the House Energy and Commerce press releases and social media, and I have not seen any comment by you or the majority calling into question that illegal purge of the inspectors general. Am I missing something? Have you made a statement, or has any member in the majority made a statement calling into question the illegal firing of the inspectors general?
I haven't made a public statement.
Okay. Is there any Republican member of the majority here today that has raised any concern about the illegal firing of the inspectors general, particularly the ones that oversee HHS, Department of Energy, and EPA? Well, I think that's a real abdication of your responsibility. You think that it's okay to take the cops off the beat, the ones that are responsible for rooting out waste, fraud, and abuse. I'm going to offer, for the record, a letter that the ranking member and the ranking members of the subcommittee, but I know it captures the feelings of the Democrats here today. A letter to you, Mr. Chairman, and Chairman Palmer of O&I, calling for an Energy and Commerce oversight and investigation hearing immediately to investigate the terminations of the inspectors general on January 24th by the president. Purging, and let me read a little bit of it. Purging government watchdogs without notice to Congress is a violation of the law, and it's an alarming attack on the transparency and accountability of federal agencies. I know there's a lot of discussion about how we root out fraud and achieve savings for the American people. Do you all know that in fiscal year 2023 alone, it was estimated that the work of inspectors general saved the government over $100 billion? So what the heck, you're taking them off the beat? You're countenancing waste, fraud, and abuse? I don't think you're that far gone. We say in our letter, our members deserve an opportunity to question why the Trump administration attempted to eliminate and have eliminated these inspectors general, and whether and to what extent internal agency oversight will continue. It's not just the inspectors general, by the way. A lot of the professional staffers who have deep experience in rooting out waste, fraud, and abuse have left as well. So, Mr. Chairman, I'll offer this letter for the record. I don't know that we've received an answer to it yet. I would hope that we have an answer. But most of all, I would hope that you approve Rep. Clark's amendment and that you schedule an immediate oversight hearing on the purge of the inspectors general, especially the ones that relate to our jurisdiction.
Without objection,
Yield
the
back.
letter's in the record. Gentlelady yields back. Lady yields back.
I yield back.
Gentlelady yields back. Gentleman from Georgia seeks recognition.
Yes, Mr. Chair.
Gentleman's recognized.
Thank you. Excuse me. I yield to Congressman Palmer.
I thank the gentleman for yielding. I keep hearing my Democratic colleagues say this is an illegal act. Maybe you should read the Inspector General Act of 1978 that states an Inspector General may be removed from office by the President. The President simply exercises the authority that he has under the Act. I yield back.
I yield back.
Gentleman yields back. The gentleman from Louisiana seeks recognition.
Mr. Chairman, I move to strike the last.
Gentleman's recognized.
You know, it is amazing to me if Mr. Musk and my Republican colleagues are sincere about wanting to rid our government of fraud, waste, and abuse, it seems to me that the last thing you would want to do is to remove individuals that have proven that that is their core task. They saved $100 billion for the taxpayers. Yet here we are saying we should just unilaterally get rid of them. And the silence of my colleagues is deafening, because this is not a Republican or a Democratic issue. This is oversight, and we as duly elected members of the United States Congress have a responsibility to call balls and strikes, not to hide behind partisan politics or hide behind an unelected billionaire who somehow sees this as his newest toy, who somehow sees this as an opportunity to have reverse Robin Hood, to steal from the hardworking American families and to give to the wealthiest few. This is not rocket science, my dear friends. Why would you want to remove someone who has, by the way, these individuals have worked through multiple administrations, Republican and Democrat, rooting out abuses. And I know you feel like I do because I've spoken to many of you. But your silence is deafening. The American people deserve better. The American people deserve more. The American people deserve to hear from you, to use your voices, stand up to tyranny, stand up to those who would ruin or attempt to wreck our rule of law or the core principles of our United States Constitution. I call upon our friends, do the right thing. Demonstrate courage in the face of adversity, in the face of fear of someone who may threaten you to primary you. You didn't come here to get reelected. You came here to serve the American people. Mr. Chairman, I yield my time.
Does the gentleman yield? It's okay.
Who's asking for the yield?
That's I yield to Robert Reese.
Thank you. This is pretty straightforward. I mean, if you have individuals by law who are supposed to look for waste, fraud, and abuse, to conduct audits, to make sure that taxpayer dollars are spent responsibly, to raise the alarm when they see corruption, and when you see a president who is purging them from their bipartisan role, that president is undercutting the constitutional power of Congress to have oversight, as well as opening the door for more waste, fraud, and abuse and corruption. It is that simple. When you want to build your capacity to go after waste, fraud, and abuse, you want more inspector generals. You want to empower these independent auditors to do their job. So let's make sure that we understand that this whole notion of Trump purging the federal government and freezing funds to go after waste, fraud, and abuse is simply a dog whistle. The whole notion that, oh, well, these individuals are some form of a deep state that, quote unquote, are politically motivated is only a dog whistle. What they're doing is dismantling the very fabric of our Constitution that allows the Congress, our committee right here, to provide oversight, and you're abdicating that responsibility. You are taking it lying down. You are allowing this to happen to the American people and to our Constitution. You are not saying we're going to investigate the effects of these funding freezes. We're going to investigate these effects of massive layoffs on the American people.
Gentleman, stop.
In fact, that's turning a blind eye. I yield back.
Gentleman from Louisiana yields back. Seeing none on the Republican side, gentlelady from Illinois, almost said New York, Illinois, sorry.
I move to strike the last word. Okay, found in Title V, Section 403B, an Inspector General may be removed from office by the President. If an Inspector General is removed from office or is transferred to another position or location within an establishment, the President shall communicate in writing the substantive rationale, included detailed and case-specific reasons for any such removal or transfer to both houses of Congress, including the appropriate congressional committees, not later than 30 days before the removal or transfer. Nothing in this subsection shall prohibit a personal action otherwise authorized by law other than transfer or removal. I yield back.
Gentlelady yields back. You see one on the Republican side, none on the Democrat side? Seeing no further discussion, the vote occurs on the amendment. Roll call vote the gentleman from New Jersey requests a recorded vote, and the clerk will call the roll.
Mr. Latta. No. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Miller-Meeks votes no. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Rulli. Mr. Rulli votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mr. Dunn is not recorded. Mr. Dunn votes no. Mr. Weber is not recorded. Mr. Weber votes no. Chairman Guthrie, on that vote, there were 22 ayes and 28 noes.
What purpose does the gentlelady from Washington seek recognition? The clerk will report what amendment number?
HE 8.
The clerk will report.
HE 8, an amendment to draft oversight plan, HE 8, on page 4, under the section entitlement programs, after,
Without objection, the amendment, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Mr. Chairman, we all know that there is no way to achieve the stated Republican goal of a minimum $880 million cut to spending under our committee's, billion, under this committee's jurisdiction without deep cuts to Medicaid. My amendment simply clarifies that going after Medicaid with a chainsaw will result in reduced Medicaid coverage, a program that covers a third of the people in this country, will take health care away from people in need, betray seniors, and increase health care costs overall. I'm just going to quote a Republican colleague talking about Medicaid, Representative Gonzalez from Texas. He said, quote, "At what point do you stop cutting into the fat and start cutting into the bone?" Make no mistake, Republicans are trying to cut the bones of a program that pays for health care for nearly half of the pregnancies and children in this country, for rural hospitals, and for nursing homes so that they can fund their tax cuts for billionaires and corporations. If they were serious about fraud, they would go after the predatory insurance companies that are gouging both the government and patients, as they are contractors for programs like Medicare Advantage. The Department of Health and Human Services Inspector General found $7.5 billion in suspect payments made to Medicare Advantage plans due to upcoding, in other words, making patients look sicker than they actually are, in 2023 alone. Oh, and by the way, as has been mentioned by my colleagues, Donald Trump illegally fired that Inspector General last month, whose sole job was to oversee the department and ensure that taxpayer dollars were not being misspent. That is what inspectors general do. They root out fraud, waste, and abuse, and they protect you and your tax dollars. So why aren't Republicans speaking out about this? Because they're not serious about fraud. They're not serious about lowering costs and making American lives better. They are lying to the American people, claiming that $880 billion in cuts to Medicaid is rooting out fraud, when their actual goal is to fund a huge tax break for gigantic corporations and billionaires. So I urge my colleagues who are serious about supporting their constituents and rooting out real fraud to vote yes on this amendment. Thank you, and I yield back.
The gentlelady yields. The gentleman from Georgia, Mr. Carter, is recognized.
Thank you, Mr. Chairman. Mr. Chairman, this amendment seeks to claim that the committee's goal of responsible stewardship solely involves cuts to harm Medicaid beneficiaries. Look, folks, Medicaid is an important program. As a healthcare professional, as a consultant pharmacist at long-term care facilities, I know this. It covers half of all children in the country, and it's the largest payer for long-term care for people with disabilities. Our nation's most vulnerable rely on it for care. Medicaid was intended to be a safety net program for the aged, the blind, the disabled, pregnant women, children, those living with disabilities. That's what Medicaid is for. It's also a program, however, that spending is growing at an unchecked rate, at a rate we cannot continue to finance. According to the CBO, Medicaid enrollment will largely stay flat over the next decade, but Medicaid spending will grow by more than $300 billion over the same period. Let me repeat that. According to the CBO, the Congressional Budget Office, Medicaid enrollment will largely stay flat over the next decade, but Medicaid spending will grow by more than $300 billion over the same period. As written, this oversight plan will put us on a path toward accomplishing this goal by identifying opportunities to reduce fraud, waste, and abuse in the program, while also protecting the most vulnerable among us. Our goal here today, again, is to ensure that the program is secure for future generations of beneficiaries and that it can continue to serve those in need. That's what we were trying to do, or are trying to do, with this oversight plan. We know there are opportunities to streamline the program and to generate more efficiencies for both the federal government and the states, that will not only lower costs, but also reduce red tape for beneficiaries and state Medicaid programs. In fiscal year 2023 alone, the Government Accountability Office estimated that there were approximately $50 billion in improper payments in the Medicaid program. $50 billion in improper payments in the Medicaid program. It should be a shared priority by members of both sides of the aisle on this committee that we address this issue, as this oversight plan sets out to do. This committee will continue to focus on both building on successes from the last Congress, like banning spread pricing in Medicaid and expanding access to home and community-based services, while also focusing on the long-term sustainability of the program. Again, save, sustain, stabilize. That's what we're trying to do with Medicaid. Mr. Chairman, unless there's someone else who wants time, I'll yield back.
The gentleman yields. The ranking member from New Jersey, Mr. Pallone, is recognized.
Well, thank you, Mr. Chairman. I want to say, Mr. Carter, I guess I shouldn't be surprised, but I'm a little shocked that you're openly advocating Medicaid cuts, because from what I've heard so far, a lot of the Republican members on this committee have not been willing to say that. So I guess maybe I should respect your honesty, but on the other hand, it's pretty shocking when I know that this budget resolution is saying at a minimum there should be $880 billion in cuts in this committee's jurisdiction, and possibly up to $1.5 trillion from what I can see. And I know that those cuts can't possibly happen without most of it being in Medicaid. We just don't have spectrum, maybe, I don't know, 10 billion, energy, a few billion, but basically we're talking almost $1 trillion in Medicaid cuts. Now, you can argue that there's waste, fraud, and abuse. The reality is that the Medicaid program is the leanest of all the federal programs, health programs. It's actually the biggest as well. It's bigger than any of the others. But it's the leanest of any of them as well. And so, I doubt there's very much waste, fraud, and abuse there. Certainly not $1 trillion worth. What I've been hearing from your members is, I think Mr. Guthrie, the chairman, talked about a cap, a per capita cap. I've heard about reducing the Medicare expansion from 90% to less. That, I think there are 9 states right now that have Medicare expansion that say on their law that if that were to happen, they would eliminate the Medicaid expansion. Millions of people would automatically not have Medicaid anymore under the expansion program. We're hearing about reducing, like a state like Mississippi gets 70%, I think, of their money. My state gets 40% of Medicaid from the federal government. We're hearing about reducing that. In my case, in the state of New Jersey, the budget of the state of New Jersey is about $55 billion. If you were to implement that $880 billion Medicaid cut proportionate to what New Jersey gets, we're talking about a $9 billion cut in a state budget that has $55 billion. What is that, a 20% cut for the state budget? It's not sustainable. They would have to kick people off the rolls. So everything that I've heard about Medicaid cuts is not what you're mentioning, waste, fraud, and abuse, but actually money that's being used now to pay for the program, whether it's expansion program, the regular Medicaid program, whatever. And what does that mean? It means that 60% of the people in nursing homes are paid for by Medicaid. They're either going to close or they're going to provide a lot less services. Hospitals, rural hospitals will close. People with disabilities is almost 100% of people with disabilities get some kind of Medicaid help. What are they going to do? Children, half the children in the country, their health care is covered by Medicaid. So, you know, I appreciate that you're being honest and saying that you want to cut Medicaid. It's pretty outrageous, but you're saying it. Let's, appreciate the honesty. But the idea that you're going to come up with $880 billion, at least, maybe $1 trillion, maybe even $1.5 trillion in Medicaid cuts, and that's going to be from waste, fraud, and abuse, not for this program. This program is very lean as it is. Most of the effective program that we have, federal program for health care. And so, you have to be, I know you're being honest about your willingness to make the cuts, but you have to be honest about where those cuts are going to come from. They're going to come directly from the funding of Medicaid, and it's going to mean that many people are going to lose their health care. That's what's going to happen. I yield back, Mr. Chairman.
The gentleman yields. The gentleman from Alabama is recognized.
Thank you, Mr. Chairman. Move to strike the last word. I just want to point out that what we're trying to do is save Medicaid for the people it was intended for. What's happened over the last few years is really an abomination. In the first 8 years of the expansion, for instance, there were over 740,000 people on waiting lists who got pushed to the end of the line, and over 21,000 of those died. Just last May, there were 2 reports from the Inspector General's office that showed that California improperly claimed $52.7 million in federal Medicaid reimbursement. That's fraud. That's abuse. New York claimed $20 million, but I want to point out something else here that I think is important in terms of what we're trying to do, and I'll share a quote with you. Almost all of the long-term deficit and debt that we face relates to the exploding cost of Medicare and Medicaid. If we don't get control over that, we can't get control over our federal budget. That is a direct quote from President Barack Obama. And for once, I can say I stand with President Obama that we have to get control of this. With that, Mr. Chairman, I yield to the gentleman from Georgia, Mr. Carter.
Mr. Chairman, I'm sorry, I think my short-term memory is pretty good, but my friend from New Jersey said that I mentioned the word cuts. I don't ever remember a few minutes ago when I was speaking mentioning the word cuts. I remember mentioning stabilize, secure, save, sustain, but not cuts. We need to make sure we understand what we're doing here. We're trying to save a program, an important program. I know as well as anyone, I have spent more hours in nursing homes than probably just about most of the people here put together. I understand it. I have not used the word cuts, and I don't appreciate someone putting words in my mouth that I haven't said. I said save, stabilize, secure, sustain, all of those things, but not cuts. I yield back.
I don't know who has the time, but I was going to ask if I could.
The gentleman's
Gentleman from Alabama yielded to me.
The gentleman
I
yields
control the time.
to the chairman of the
I
whole
yield
committee.
to the
Yeah, I
chairman,
just
Mr.
want to
Guthrie.
say that if you look at where Medicaid is now, if you look at the CBO score, you talk about per capita allotments, which grows with population, grows. If you let Medicaid grow at the rate of medical inflation, you let it grow so today's dollars, every state gets exactly the same dollars next year based on whether qualifications for Medicaid or not. Don't change anything and grow. It's a $900 billion. So Medicaid is estimated to grow $900 billion over the next decade beyond medical inflation. Beyond medical inflation. And so we know what President Trump said. He said it publicly. We're gonna make sure that we honor what he said about Medicaid, but there's opportunities to save money. This very committee voted in the IRA to I got criticized for taking money out of Medicare when you voted to do the price setting for Medicare Part D and took that money and spent it somewhere else. You guys didn't classify that as a cut in Medicare. And so what we're saying is there's opportunities to reform the program, stabilize the program. And also, if a sick child goes to the doctor in Kentucky, the federal government gives 72 cents. If a healthy adult goes to the child in Kentucky on Medicaid, the federal government gives 90 cents. We think that's an unfair setup as well. And so we want to make sure that people are covered, that Medicaid is adequate for every state, and they're not cut from where they were before. But we can also look at the growth and deal with the growth. And if we continue to have unending growth in healthcare spending in this country, the whole budget's going to implode, all of healthcare spending. Employers are being pushed by the employer plans that they spend. Healthcare costs are just continue to grow. And if we don't address it, we're not going to have a budget, we're not going to have a country, we're not going to have a future for our children. And so we can deal with Medicaid, and you will see a plan to deal with Medicaid that doesn't cut Medicaid, that gives the opportunities for people to be covered and to people have access to health care, and also meet what the criteria the president has set down about what he wants to do with Medicaid. I'm sorry, I said Medicare, I mean Medicaid. I'm sorry. I yield back.
I yield back.
The gentleman yields. The gentlelady from Illinois is recognized.
I move to strike the last word. There are two women in my congressional district who have suggested that what they need to do is to commit suicide. They are in a senior home in a very nice building, and they rely on Medicare and Medicaid. And they have investigated this. You don't just decide about taking your own life. They investigated this and what would happen to the amount of money that they would get in order to be able to keep their own lives. And these are not people who are scammers. They are not just trying to get money. They are trying to live a modest life. So at this home, there was a group that got together with them and talked them out of suicide and promised that they would work as hard as they can to make sure, and that we would definitely, and I said I would as well, organize to make sure that they wouldn't be left without their life-saving medication. We're talking about among the poorer people in this country. And how can we just say no? And you're saying, oh, well, we have all this proof. But I certainly have talked to and a number of experts in this room who know about the Medicaid program, know that people need the money in order to live a decent life. And I just think this attack on poor people and on families that says that they have to get less money is just unbelievable to me in the United States of America. You think we don't have poor people that can't get what they need to live? You better look around in your own districts and see who's there. And I say we must give people and help them get the care that they need, not let them decide about suicide. And I yield back.
Gentlelady yields. The gentlelady from Colorado is recognized. The gentlelady from Florida is recognized.
Thank you very much, Mr. Chairman. I want to thank Dr. Schreier for bringing this very important amendment, and I think she's done a good job, along with Ranking Member Pallone and Rep. Schakowsky here, of highlighting what's going on, this betrayal of American families to fund tax cuts for billionaires and the wealthy and the well-connected. I hear the rhetoric from my Republican colleagues that they're concerned about reform in Medicaid, but that's belied by the fact, again, that you've allowed the illegal firing of the Inspector General, who makes nonpartisan recommendations to root out waste, fraud, and abuse. It's also belied by the fact that what's going on here in the Capitol today is a push for a budget resolution to give major tax benefits to billionaires like Elon Musk and the wealthy and the well-connected. It's not just, oh, Medicare reform, this is a topic of conversation. It's not. This is why they have to go to find a place to fund their big tax cuts. And where do they go? They go to the people who are probably have the least political power in the country, right? We're talking about people with disabilities, children with complex medical conditions, our grandparents and older neighbors who rely on skilled nursing care, or home and community-based services to keep them out of nursing homes. But don't just take it from me. I wanted to ask to submit for the record nearly 40 letters representing hundreds of stakeholders who oppose Medicaid cuts and the Republicans' budget resolution. These letters highlight just how devastating and cruel these cuts would be to our neighbors back home. And we've heard loudly and clearly from patient advocates, faith-based organizations, providers, community organizations, state and local communities about what the impact will be on the health of our neighbors, their pocketbooks, and their livelihoods. And I'll just read a couple of samples. Here's one from the American Academy of Pediatrics, the Children's Defense Fund, Children's Hospital Association, and the March of Dimes. They say, cuts to Medicaid and CHIP cannot be accomplished without harming children. Together, Medicaid and CHIP cover more than 37 million children in the United States. Medicaid covers 40% of all births in the country. Medicaid also covers 3 million children in military-connected care families, helping ensure highly specialized health care needs are covered that are not fully addressed by TRICARE. Medicaid and CHIP help ensure children have access to essential health care services such as doctor visits, hospital care, medications, vision and dental care, and early intervention therapies. Medicaid improves health outcomes by reducing child mortality, emergency care utilization, and hospitalizations while promoting preventative care and early treatment illnesses. Here's another letter. I'll just read part of it from the National Conference of State Legislators, the League of Cities, the Association of Counties. Medicaid accounts for over half of all federal funds to states and is the largest source of federal funding for state budgets, making it essential to states' ability to design and administer health care programs that meet the unique needs of their populations. Here's another one from Justice in Aging. These massive cuts threaten the health care of millions of older adults who rely on Medicare. Medicaid is not just a safety net. It is a lifeline for seniors. Without it, they could not afford home-based or nursing facility care and would struggle to meet high out-of-pocket costs associated with Medicare. The proposed cuts would starve Medicaid, forcing states to reduce spending by cutting access to these essential benefits, leaving older adults without health care and the support that they need. Here's one from the Mental Health Liaison Group. Limiting access to Medicaid threatens to undermine gains in reducing overdose mortality rates and could lead to increasing rates of incarceration and hospitalization. Medicaid is the single largest payer of mental health and substance use services, and cuts of this magnitude will undeniably have devastating consequences for our citizens, states, and healthcare providers. Here's one from hospitals, America's Essential Hospitals. Medicaid allows essential hospitals to keep their doors open and provide care for everyone in their community. I think you're getting the gist of this. And so I'll ask that these letters from 40 letters from these organizations be offered for the record, and please support this amendment.
Without objection, so ordered. The gentleman from California, Dr. Rose, is recognized.
Thank you very much, Mr. Chairman. I just really want to point out a couple of inconsistencies that I've been hearing here. First, I'm hearing that Republicans want to save Medicaid, that they want to make it last. And it's pretty simple common sense. You don't save Medicaid and its mission of providing important health insurance and access to critical health care for the people that need it by cutting and reducing the amount of people that are insured by Medicaid. It's not common sense. You see, when you say you want to save Medicaid, but then you want to remove Medicaid from people's lives is an inconsistency. Second, just a while ago, you all voted against an amendment that would look at the impacts of Trump's illegally firing of inspector generals who are responsible for rooting out fraud and corruption. But then I hear that you want to end Medicaid inappropriate payments, look at perhaps fraud or inefficiencies. So let me ask you, who's going to do the audits when the inspector generals are responsible to do the audits to find the proof if there indeed is fraud and any inappropriate payments? We agree that there should be no fraud. We do want to root out fraud. We want to work with you to find legal appropriate mechanisms to identify, to calculate, and to make transparent with the facts about fraud. But what this is, and we want to empower the inspector generals to do that. But again, what this is a dog whistle. You see, this is yelling out fraud, waste, abuse, like President Trump yelled out the electoral fraud to justify what he did regarding the big lie. And this is another dog whistle to justify and hide the real fact that you are ordered to cut over $880 billion or more in order to find the funds to give billionaires like Elon Musk more billions in tax giveaways. Now you say you want to save Medicaid. I'll give you an example of how you can save Medicaid. As a physician, I know that by reducing the burden and the impacts of illnesses that are preventable with access to care, but reducing the illnesses in the working poor families by helping them get affordable health care, by helping educate the communities that use Medicaid, by keeping them healthy, including the disabled, the elderly, children, then you will reduce the burden of cost due to Medicaid. But instead, you want to cut the actual programs that provide the care, that provide access to these to these medications, by providing the innovative programs to go into communities to keep them healthy. It's maybe easy to throw out fancy terms about saving Medicaid for the future, et cetera, when you all don't use Medicaid. It may be easy to talk about waste and inefficiency, so therefore we need to cut Medicaid when you all don't use Medicaid. I've taken care of the patients who use Medicaid. I've taken care of children. I've taken care of the elderly who are on Medi-Medi. And it is not easy for them to overcome their illness when they no longer have access to the health insurance that provides them a lifeline to a decent life with dignity and with health. So I want to ask you all, when you use this dog whistle about waste, because that's what you're going to continue to do. It's wasteful, it's wasteful. Which benefit is wasteful to you? Is it mental health services? Is it drug rehabilitation services? Which of those legitimate benefits are you determining a waste that you're looking to help cut in order to pay for billions in tax breaks for billionaires? I yield back.
The gentleman yields. The gentleman from Ohio is recognized.
Thank you, Mr. Chair. I move to strike the last word. So I'm not a physician. I've never run a hospital. I'm new to Congress, but I was a teacher, and I taught, among other things, remedial math. So for me, there's a math question here. I think you all got stuck with an $880 billion bill, right? This president and the majority wanted to not just keep, but indefinitely have these wasteful tax giveaways to the super wealthy, the Elon Musks of the world who don't need the money. And to pay for it, because it's so much money, two things had to happen. They had to convince a bunch of folks to take on trillions in new debt, and then to make sure it wasn't too much in new debt and deficit spending, they said to you all, find nearly $1 trillion in healthcare funding, which means that you're going to cut almost $1 trillion in healthcare, and it's not just for children or seniors. We were talking about doctors, we're talking about hospitals, hospitals that are on the edge already. Many of these hospitals have a few days of revenue. They will shutter their doors. The doctors will go. They will leave. Healthcare for folks who aren't on Medicaid will disappear. All to make this math work. The fact is, if we decided as a Congress to focus 100% of the tax relief on the people who need it, if we just said, look, we're just going to provide tax relief for working people, small businesses, farmers, and the middle class, you wouldn't have to cut $1 in healthcare. You could actually save Medicaid. That's it. Just give up on the wasteful spending on the uber wealthy. That's it. I yield back.
Gentleman yields. The gentlelady from New York is recognized. Thank you, Mr. Chair. I think to reiterate what my colleague just stated from Ohio, there's a fundamental math problem here. There is a constant reiteration of waste, fraud, and abuse. Sure, that's great. What is the identified amount of waste that this committee has identified? Because what the order that's been sent down here is find $880 billion, not there is $880 billion of waste, fraud, and abuse. It's find $880 billion. And so we have not heard a single concrete number of the amount of waste that's been identified. We have not heard a single concrete number on the amount of abuse that's been identified. And there's just kind of this vague magic wand around waste, to my colleague from California's point. And waste is being used as a very large word here, because what's being suggested is that long-term care is wasteful in America, that children's health insurance is wasteful in America, that poor people seeing the doctor is a waste, that all of these people are disposable, that the elderly are disposable. So I think the problem here is that the numbers don't add up. The numbers don't add up. $880 billion is a devastating cut to Medicaid, and given that 30% of Medicaid dollars also go to Medicare, it's also an attack on Medicare, to Medicare recipients. And so while I completely understand the idea that there should not be waste, that there should not be fraud, and that there should not be abuse, $880 billion is not that. This is an attack on Medicaid, and anyone who votes on this budget this week is voting to cut Medicaid in America and voting to gut health care for Medicare recipients in America. There's just no other way around it. And with that, I yield back.
Gentlelady yields. The gentleman from Georgia is recognized.
Thank you, Mr. Chairman. What we're voting on in budget reconciliation, there is not the word Medicaid in the resolution, period. There is no word. What we are attempting to do is to deal with a situation that frankly was put in our laps years ago. And just to give you some examples, we spend $4 trillion a year on health care. $1.6 trillion of that is taxpayer dollars. The nearest nation to us, which is about 12,000 per capita, the nearest nation to us spends about 6,000. We're running $2 trillion deficits we have under the Biden administration. You know, I think what we're trying to work toward is to get at what is our problem here. In other words, I was chairman of a hospital board. We looked at outcomes, and we said, hey, you know, we spend about 25 cents on every dollar on preventive, and we spend 75% of every dollar on critical care. Do you realize that critical care is, you know, much more expensive than preventive care? What are we doing now? Obviously, our Secretary of HHS has hit a nerve as far as, you know, nutrition, things that Americans need to be doing. I know in my district we have a epidemic of diabetes. We have, you know, obesity. We have food deserts. You know, I mean, you know, folks, we've got some problems here, and I'm willing to work with you to solve these problems. But to ignore the fact that we don't have, you know, we can just continue on down the road and do the same thing. You know, insanity is doing the same thing over and over again. And we must look for solutions for the American people. And here's the other thing. You know, go to an emergency room on a Friday or a Saturday night or talk to your local physician or anybody else. You know, here's the thing. We're spending this kind of money, and nobody in this country is happy with their health care. Nobody. The physicians, the providers aren't. Like the gentleman said, the hospitals are barely making it. Indigent care in my rural communities has not been helped by Medicaid. We're still running 40% indigent care costs. You know, are we just going to allow this to keep going? Or are we going to vote on budget reconciliation, get to work in these committees, find out what the issue is, and really help the American people? Rather than sit here and call each other, names, and, you know, this is what we're going to do, this is what we're going to do. Well, guess what? This is a big body. We have to get to a solution of this, folks. It's unsustainable. And I would like to hear the argument about we can keep going down this road. It's no problem. Let's just forget it. Let's just go down the road. What do you want taxes to be? I mean, do you want your model, 80% taxes? I don't know. You know, I don't think the American people want that. I can tell you on the tax deal, what's important in my district is my small business community. They're the ones that they're not permanent. We have to reinstate those tax benefits for small business. Or either you're going to have, large corporations running everything. And for that matter, here's the other problem on employer-based insurance. It's unaffordable. People, companies and people are paying, and it's going up every year, and it is going up substantially every year. So, I would urge my colleagues, let's get at the root of the problem here. Let's go down the road here on budget reconciliation, and let's do something for the American people, and I yield back.
Gentleman yields. The gentlelady from Virginia is recognized.
Thank you, Mr. Chair. I move to strike the last word. I sat on the board of a Medicaid provider. I sat on the board of a hospital. I sat on the Senate Finance Committee in Virginia, the subcommittee that handled health care and Medicaid. And the one thing that I know with certainty is that the reason the cost of Medicaid has gone up is not because of waste, fraud, and abuse. It is because people are living longer than they did in 1965. It is because they are living with more complex illnesses than they did in 1965. In part because the very communities that Medicaid was designed for were redlined into communities where pollution was emitted into those communities every single day, where their neighborhood was literally cut off from food, work, hospitals, by a highway. The cost of long-term care is going up. The cost of prescription drugs is going up. In every meeting I was in, on the Joint Commission on Health Care, on the Medicaid provider, the hospital, the Senate Finance Committee, we were concerned about the cost of prescription drugs going up to take care of these measures. And in the last administration, in the 117th Congress, you did something. I wasn't here. You did something to help reduce costs of prescription drugs. That's under attack. We have hospitals in rural areas that were closing until Medicaid expansion came. You have hospitals and providers that are struggling to stay open and struggling to recruit and retain the best and the brightest workforce because the reimbursement rates they get are so low they can't pay them. Cuts to Medicaid, which are going to be necessary to get to $880 billion, which you've already heard. Cuts to Medicaid is basically forcing states to raise taxes because Medicaid is a state-federal partnership, and states are already struggling to meet their portion. So you're going to make that problem worse. Medicaid expansion allowed people who never got preventative care to get preventative care. And we have heard from the other side of the aisle how it is more expensive to treat people when they come in the emergency room, where you have to treat them. And if the hospital, the provider doesn't get paid, that cost trickles to everybody else and makes our costs go up. That's all basic fundamental fact. If you sit in a state legislature and look at what they're looking at, if you sit in the hospital boardroom looking at the financials, what they're looking at, if you sit in the boardrooms of the Medicaid providers and what they're looking at, and putting your hand in the sand and saying, we've got to reduce the deficit when the President of the United States wants to add, $4 trillion for tax cuts for billionaires. Your budget, your oversight plan is a statement of your priorities. What I hear from my colleagues on the other side of the aisle is your priorities are billionaires and large corporations. When I talked to my constituents, when I had a record number of constituents show up for a teletown hall meeting, more than double than ever, they weren't saying they wanted tax cuts for billionaires or corporations. They were saying, please don't take my health care away. Don't close my rural hospital. Don't take away my veterans' benefits. And we better listen. Because in Virginia, we got to quote Thomas Jefferson. If you went to UVA, you got to quote Thomas Jefferson. In the Declaration of Independence, it says, we are all entitled to life, liberty, and the pursuit of happiness. Life is first. And the government is set up to help you achieve and maintain those rights. Healthcare is a fundamental right. I yield back.
Gentlelady yields. The gentlelady from California is recognized.
Thank you, Mr. Chairman. The last, my colleague across the aisle had said, just join us, just join us. Why I won't join is because this new House Republican budget is a betrayal on the American people, and I will not betray the American people by taking away health care from hardworking families while giving $4 trillion in tax cuts. So Mr. Allen mentioned Medicaid, and I'm curious on what the 176,000 constituents in Georgia's 12th district, how they feel about their Medicaid being at risk and being cut and getting less access to health care. That's what I'm curious about. That's 24% of his district relies on Medicaid. And you want to talk about children? Who's fighting for children and protecting children? 53% of children in Georgia's 12th district rely on Medicaid or have CHIP in the district. I may not represent that district, but I'm fighting for all Americans. For all Americans to have access to health care. And we're also told the word Medicaid doesn't even appear in the resolution. Oh, say it ain't so, it's not there. I think tax cuts isn't there either. But we know that's the plan. There is no way, there is zero way to do the cuts without impacting Medicaid. We know that. The other side wants to talk about the deficit. Let's talk about the deficit. It was Trump 1.0 tax cuts to the top 1% that drove up the deficit. Now they're looking to cut trillions of dollars to add $4 trillion in tax cuts. That math doesn't add up. It's adding more to the deficit. So don't come and say, well, it's not in there. And actually, there was a document that was accidentally leaked in the Budget Committee, a 50-page document on the resolution. And sentence after sentence says the Energy and Commerce Committee didn't provide details on how they were going to do this, but basically just trust them. This is no time to trust people who are silent. This is no time to trust people that are complicit in the federal funds being cut, people being laid off. They're not going to tell you out of their mouth they're going to cut Medicaid because they know there's hundreds of thousands of constituents that rely on it. Now, some people will, and we have heard some defend it. But for the most part, this is a bait and switch. Just because it's in it doesn't mean it's not being done. And with that, I yield back.
Gentlelady yields. The gentlelady from Washington, Dr. Schreier, is recognized.
Thank you, Mr. Chairman. First of all, I wanted to say I appreciate Ms. Barragan's comments, and I also wanted to respond to some of what we're hearing from our colleagues. One of the things we heard was that people don't like their health care. I can assure you that about a quarter of people in your districts definitely appreciate having Medicaid health care. I will tell you also, pregnant women who would otherwise not get care, appreciate that health care. Kids, I'm a pediatrician, certainly appreciate that care. Seniors in nursing homes who have no other options, as we've heard before, will appreciate it, and so will people with disabilities. And you know what else? If none of that even affected you, the rural hospitals in your districts will not survive without Medicaid. You know, the other thing I wanted to mention was that, again, you said it doesn't say any Medicaid anywhere in this bill, but you're not fooling anyone. Like, you can't get close to $1 trillion without cutting Medicaid, and I want to make sure that the public understands that. And based on my town hall with almost 15,000 people, they understand. We got a lot of calls from people saying, what's going to happen? I'm getting treated for cancer. Are they going to take away my Medicaid? We also heard about a complaint that adult reimbursement is higher than reimbursement, Medicaid reimbursement for taking care of kids. And the solution given was, well, we should cut the adult reimbursement. No, the answer is you should raise the reimbursement for taking care of kids. And by the way, I have a bill to do that called Kids Access to Primary Care, and I would welcome all of you to support that. You know, the other one I wanted to mention is that we heard that with inflation, numbers will balloon. You know, what that means is that with inflation, this already is a cut to Medicaid. And then I also wanted to just comment about work requirements. That just sort of like flows off the tongue as though people are scamming the system. I have two colleagues here from Georgia. It turns out right now Georgia's the only state in the country that has imposed these work requirements. It also turns out the vast majority of the people meet the requirements, but that people have fallen off the rolls because there is so much paperwork to do that the paperwork either doesn't get submitted on time or it's incomplete and they get thrown off of Medicaid illegitimately. In fact, it turns out also that the amount of money being spent in Georgia just on the paperwork to deal with these reapplications and proving that people are working costs more than the cost of taking care of these people's health. And so, in fact, they tried this in Arkansas and they canned the program exactly because it was so much paperwork, bureaucracy, waste, frankly, which is what you guys say you're going after, that they did away with the program. So I just wanted to set the record straight. Medicaid is a program that is critical to the lives of people in all of our districts and to our rural hospital systems. And I'm going to yield to my colleague, Lori Trahan.
Well, thank you, Congresswoman Schreier. I don't have much to add because I think you covered it so well. And I think we're all having a reaction to our colleague from Georgia's comments around putting the budget discussion and the cuts ahead of a policy discussion. Congressman Allen articulated the problems in his district: diabetes, food deserts, accessibility to care. That afflicts all of us. But those solutions are for us to come up with in a policy discussion. I doubt when you were chairman of your hospital, you said, we need to solve these problems. Let's start by cutting $880 billion from the budget so that we can get at solving those problems. No, it's in reverse. You talk about how we solve those problems, and then we figure out how much it's going to cost to accomplish that. So I'd like to just focus on, let's have the conversations around preventative care, screenings, healthy living. I don't think anyone would agree that saying let's cut almost $1 trillion from Medicaid so that we can help the 176,000 people in your district who rely on that program today.
Yield back and yield back.
If there is no further discussion, the vote will. Representative Tonko is recognized.
Thank you, Mr. Chair. I move to strike the last word. I will fight these Medicaid cuts with every fiber of my being because I did not get elected to take health care away from the 80 million Americans who rely upon Medicaid. In New York State alone, Medicaid provides coverage to nearly 7 million people, including 44% of all children and 49% of new moms and their newborns. And 64% of people living in nursing homes in my state rely on the program. Medicaid is also the single largest payer for behavioral health services, So any cuts would mean gutting access to health care for mental health and substance use disorders. Our constituents' lives are on the line, and they deserve better than being used as a pay-for President Trump and his richest supporters. Last week, I sat through a marathon all-day markup for the House Budget Committee, and Republicans are discussing cutting up to $1.5 trillion in federal Medicaid funding. Cuts of this magnitude would hurt community health centers, which serve as New York's primary care safety net, providing care to over 2.4 million patients. That's 1 in 8 New Yorkers. A staggering 47% of New York community health centers' funding comes from Medicaid, making Medicaid the largest share of revenue from one source for our community health centers. In many congressional districts across New York, including those represented by my Republican colleagues, almost 1/4 of the population are Medicaid beneficiaries. I'm left wondering, do you really want to be responsible for cutting health care benefits from 1/4 of your constituents? Do you want to be responsible for taking funding away from community health centers that are a lifeline to our region? Earlier I said we are been placed with a challenge by our districts, by the people across this country. We've seen it at town halls. They want answers. They want solutions. Where is the solution? Where does it rest? It lies right in this room, because we have the largest chunk of cuts that are assigned this table, and we know they're going to come from Medicaid. They don't want these decisions made by someone who was not subjected to a background check. They do not want it made by someone who was not approved and confirmed by the United States Senate. They do not want them operating these cuts through a shadow agency that was never sanctioned by Congress. They do not want a team not familiar with the culture of the agency doing these draconian cuts. So I say the public asks, and we must commit to end the congressional paralysis. Let us embrace the duties, the assignments, the opportunities, and the responsibilities assigned us by the Constitution. The power of the purse rests with the House of Representatives. Let's put that back into action. Let's not be silent about this effort. Let's take over the process as we are assigned to do, and let's go forward and do this in a smart, compassionate, professional outcome, not leaving it to hacks who are not aware of all of the issues. We hear about the stories from our constituents. We have the pulse of the people. We know what the struggle is. We are assigned this responsibility. Let's exercise that responsibility and have the best outcome. With that, I yield back.
The gentleman yields. The chair recognizes the chairman of the full committee.
Thank you. I did speak a few minutes ago, but on Mr. Palmer's time. So I just want to say that I represent rural hospitals. There are, believe me, people on this side of the podium that want people to be protected. We absolutely want them to be protected. But you look at just the growth in the budget. We've got a $1.8 trillion budget deficit. We're going to spend more on interest this year than we spent on the military. And if you take a program, you just think the score, it's all out there. People have seen it. And I don't believe there's going to be per capita allotments on all of Medicaid. But if you took that and you say, okay, we're going to let, so my friend from New York just mentioned New York. New York State gets every penny they got this year, less if people move away or people move in, you get more. With the growth factor for, which we can debate, it's a medical inflation, and you're saving $900 billion over, or about $800 billion, between $8 and $900 billion, depends on the score you look at. That's if all of Medicaid. And that, I'm just saying that we can make this sustainable, we can make it work in a way that is supposed to protect the people that it's supposed to protect. I've looked at different dials and different options and different movements, and I sat down with hospitals and people who deal with Medicaid and talk to them. And so we're only going to do this in a responsible way. I can tell you that. And we're not going to do it in a way that's going to threaten hospitals. But you can look at different reports of waste, fraud, and abuse. You can see that some of the rules we have allow people to stay on Medicaid up to even almost a year, even though they may not qualify. Say they don't qualify a week after or a month after they get on Medicaid, they're still on for 11 months. You know, I'm not, we still have the idea that a disabled child in Kentucky, the federal government will pay the state of Kentucky 72 cents out of $1, but a able-bodied working adult, the federal government pays 90 cents to the dollar. And we just think those are inequities, and those are things that can be looked at and can be addressed in a way that's responsible. I will tell you, there are people on my side of the aisle, just like people on your side of the aisle, talking to me quite often about, we've got to do this in a responsible way. It's got to be something that I can support. It's got to be, and I can only support it if I know my hospitals can work and can operate. And that's where we are, and that's what we're working on. And we'll have an opportunity to debate this hopefully in a month or so, whenever the opportunity comes. And I think you'll see that it's a responsible plan. And as we develop what that plan is, nothing's going to go forward, in my view, that's not responsible. And so we're going to make sure we take care of the least of us, and we're going to make sure that we take care of the working people that need help. So I will yield back.
The gentleman yields. The gentlelady from Ms. Fletcher is recognized.
Thank you very much, Mr. Chairman, and thank you, Chairman Guthrie, for those remarks. I think there is broad agreement that we want to see responsible government and that we want to see things being done responsibly. And what I am hearing from my constituents, and I did a telephone town hall with my constituents last night. I asked for questions in advance. I got more than 300 questions about Elon Musk and Doge because people don't see that proceeding in a responsible way. They see it as arbitrary and capricious and are deeply concerned about what is not happening in that agency. And so, not agency, it's not an agency, right? It's not a real department of government. It's not even really a thing. But we seem to have ceded all of this authority to an unelected billionaire who's being shielded, is totally not transparent, and is sending threatening emails to people who work in our districts in the middle of the night. And so I think there's just a deep concern, and I really hope that we can, as a Congress, insist through this oversight plan that we proceed responsibly. That is not what is happening with this administration, and that is a deep concern. And with that, I'm going to yield my time to my colleague from New York. Thank you. Yes, since New York was mentioned, and again, I think one area where there is common ground here is where there is legitimate waste, where there is legitimate fraud, there is a willingness to work on this. But there is zero evidence that has been provided that adds up to $880 billion. And, even mentioning New York, the inflation costs on healthcare or the rises in healthcare costs, as was mentioned previously, because one of the largest generations in the United States, baby boomers, are aging. They're aging and require healthcare. I understand there's disagreement here, but I personally believe that healthcare should be a right in this country. I believe that that people should be able to see a doctor without going bankrupt. But the idea that this is just some kind of inflationary indicator, people are getting older. Baby boomers are aging, and they need health care. And so, once again, if in doing the math, the majority and Republicans decide that there will be service cuts to long-term care, cuts to what is covered in Medicare, cuts to what is covered to children and to seniors, I just want us to be honest about that. Let's just be honest. Let's just say it. $880 billion. That math is a cut. And I know folks may want to say, the resolution doesn't say Medicaid. The resolution doesn't say a cut. It says a lot of things that mean that. A rose by any other name smells just as sweet. And this is a cut. This is a cut. $880 billion, doing the math is a cut. Thank you, and I yield back.
Will the gentlelady yield? Gentlelady
Yes,
Texas? It's her time.
Yes.
So here's the other thing. I want to agree with everything that my colleagues have said about, you can try to sugarcoat it. You can say, well, in my state, some people get reimbursed this and others reimburse that. But in most states, including my state of Colorado, because of our laws, the states are not going to be able to make up that difference. And so as a result, the patients are going to be the ones that suffer the cuts, not some nebulous state agency. And I think the thing that strikes us as so unjust is, as my colleague from New York just said, healthcare is getting more expensive, and we all agree we should address waste, fraud, and abuse. Every single one of us agrees we should root it out. But just doing that, it's not going to save $880 billion, and B, this $880 billion that this committee has been asked to cut, it's being asked to cut it in order to be able to offset tax cuts that are going to billionaires and corporations. And so from my perspective, what you're saying is, okay, in Kentucky or Colorado or in other state, you're going to have to take real cuts for health care for many working Americans, for senior citizens and kids, in order to be able to give tax cuts for billionaires. And that just seems like a poor result. And I'm sorry to say, you're going to hear all of us saying this every day from now until the end of this, until this stops. Thank you, and I yield back.
Thank you, and I yield back.
Gentlelady yields. Is there any further discussion on the amendment? The vote, request for roll call has been submitted by the ranking member. The request for a recorded vote, and the clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Carter of Georgia? Mr. Palmer? Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber?
Negatory.
Mr. Weber votes no. Mr. Allen? Mr. Allen votes no. Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes no. Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Ruley? Mr. Ruley votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Strakowski? Ms. Strakowski votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko? Mr. Tonko votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Vesey? Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Mr. Strahan? Ms. Strahan votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mr. Carter of Georgia is not recorded. Mr. Carter votes no.
How is Mr. Pfluger reported?
Mr. Pfluger is not recorded. Mr. Pfluger votes no.
How is Mr. Hudson reported?
Mr. Hudson is not recorded. Mr. Hudson votes no.
I voted. Has Mr. Guthrie recorded?
Mr. Guthrie is recorded as no.
The clerk will report the result.
Chairman Joyce, on that vote, there were 22 ayes and 27 noes.
The amendment is not agreed to. Are there any further amendments?
Mr. Chairman? I have an amendment at the desk.
For what purpose does the gentlelady seek recognition?
I have an amendment at the desk, ENG-13.
The clerk will report the amendment.
An amendment to draft oversight plan, ENG 13. On page 6, under the heading, quote, "Management of the Department of Energy and its national laboratories," after the second sentence, insert the following.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. Colleagues, out of all of the outrageous, damaging, and illegal firings and shutdowns, whether we're talking about the inspectors general or the top military JAG officers or the folks in charge of the Department of the Oversight Ethics Office, I mean, the list goes on and on. I think we can all agree that one of the most troubling was the firings at the National Nuclear Security Administration. Their professional workforce was targeted by Elon Musk and Donald Trump's reckless gutting of the federal workforce and the illegal layoffs. But I really hope this is an area that can garner bipartisan support because we desperately need oversight here. You all, and for the new members of this committee, this is a little bit unique. The National Nuclear Security Administration is an agency within the Department of Energy, and it is tasked with securing dangerous nuclear materials and the proliferation of weapons of mass destruction. Their work is so sensitive that even inadvertent inquiries into how the NSA spends money abroad could compromise sensitive information about cooperation between the United States and other governments to keep highly enriched uranium secure. I mean, this is the kind of data that our adversaries would love to get their hands on. These are the kind of professionals that we desperately need to retain and keep on the job. Even the new Energy Secretary, Chris Wright, said on February 7th publicly that Elon Musk's staffers did not have access to secretive information about U.S. nuclear weapons stockpile at NNSA. But despite that, 2 weeks ago, Elon Musk and his associates kept at it. They went in and they fired 300 professional staffers at NNSA. This includes the employees, the professionals who write requirements and guidelines for contractors who build nuclear weapons. And that's what we've seen. That's what has happened. Silence from the other side. It's just completely outrageous. This included the professional staffers working on the ground at facilities where nuclear weapons are built. They're overseeing contractors and inspecting these weapons. Let me tell you a few of these places. In Tennessee, the Y-12 National Security Complex, where they deal with uranium, lithium capability, material and process research. The Savannah River site in South Carolina. They are doing important work in tritium recycling, extraction, the Savannah Nuclear Solutions Group. They have private contractors there. Panex plant in Texas, where they are doing weapons assembly and disassembly, surveillance, high explosives. I mean, how dare this guy who's a tech billionaire come in and target our national security? Who gave him the authority to go after our nuclear experts and fire them? Don't you think this is an area for oversight? I think so. In fact, Mr. Chairman, are there any hearings planned right now, or have any letters been written under your signature that have demanded answers here on this topic? No oversight hearings currently planned about the arbitrary firing of our nuclear experts. It is scary. It's also wasteful. It's a waste of time and money that Elon Musk and Donald Trump allowed these experts to be fired, put them all through this turmoil. Who knows where that data has gone? I think this is a topic, a very important topic for oversight and investigation of the Energy and Commerce Committee.
Will the gentleman
They didn't even yes, I'll yield.
I just want to clarify. Maybe I heard it wrong. Are you alleging that the administration has broken the law when it comes to security
They
clearances?
certainly have broken the law when
but
it comes
will
to the firing of the inspectors.
No, I'm talking security clearances. Are you alleging that they have somehow broken the law?
Thank you, Mr. Pfluger. Yeah, I think this is so arbitrary and outlandish to go in and fire people who are responsible for our nuclear enterprise, working at our labs, making sure our nuclear weapons are safe and secure. Yes, I think it is outrageous, and I think the lawsuits are ongoing right now. Since I'm a little bit over my time, I'll yield back, but I'm not done.
Gentlelady yields back. The chair recognizes the gentleman from Ohio for 5 minutes.
Thank you, Mr. Chairman. Strike the last word.
Gentleman's recognized.
Thank you, Mr. Chairman. The committee and its oversight plan will examine the impact of government policies and actions on the supply and delivery of energy, and this includes all agencies that impact the supply and delivery of energy. Its oversight and related policy inquiries will examine the management, governance, and operations of the Department of Energy, which also will include the nuclear weapons enterprise. DOE, under orders from the Office of Personnel Management 2 weeks ago, laid off fewer than 700 probationary employees. Fewer than 50 were at NNSA, the National Nuclear Security Administration. National security and mission-critical positions were exempt. To the extent that any unintended dismissals occurred, the agency leadership is correcting this. Let us not forget the speed at which the agency has been expanded under the Biden administration, with no effort by the minority to assess the waste and bloat of these actions. DOE's budget requests increased 45% since 2021, and roughly $35 billion to over $50 billion. Add this to the $100 billion in additional IRA and Infrastructure Act spending, and a 20% increase in workforce, or 3,000 employees, and there is certainly room to reduce and streamline. In the last year alone, the Biden administration added 1,000 employees at DOE, bringing the total federal employees there to 17,500. The contractor workforce of the national labs, nuclear security, and weapons sites and other sites expanded from 120,000 to 135,000 personnel. The oversight plan is sufficient to monitor personnel developments at DOE and NSA, and I urge my colleagues to oppose the amendment, and
Will the gentleman yield?
I yield to my friend, the gentleman from Texas.
I thank the gentleman. It's interesting that the Congresswoman from Florida makes the statement, and then she pauses and she says, she waits about 5 or 10 seconds, and then she says, silence from the other side. I would remind my friends across the aisle that when you're listening to a fairy tale, you normally let them get all the way to the end. And so we listen to the fairy tale, let you get all the way to the end. To our chairman's point,
In the last year alone, the Biden-Harris administration added 1,000 employees at DOE, which would bring the total federal employees there to 17,500. And nothing has been done about improving permitting. Nothing has been done about making sure that we have the energy we need. And with that, I yield back.
Mr. Chair, I yield back the balance of my time.
Gentleman yields back. The chair recognizes the gentlelady from Colorado for 5
To
minutes.
strike the last word. Thank you, Mr. Chairman. Well, actually, this amendment is not about all those other things. This amendment is about the firing of these nuclear inspectors. And I just want to clarify for Mr. Pfluger, yes, we do think that the firing of these inspectors was illegal because DOJ
will the gentlelady yield?
Excuse me, let me finish my statement. DOJ is an illegal agency, and Elon Musk was not appointed by anybody, and that's what we're talking about here. I'm now going to yield my time to Ms. Castor to finish her statement.
Well, thank you, Rep. DeGette. Boy, I wish this was a fairy tale. I wish, it is so outlandish that if someone swooped in to say, is this really happening, they would really be scratching their heads. It's like we're living in the upside down, where you have an unelected billionaire swooping in and illegally firing public servants across the country, sending arbitrary emails. But I think what we're doing here is trying to highlight how serious this is when Elon Musk and his associates swoop into our nuclear security professionals and try to clean house, and do so without even getting to know what does this agency do. It's irresponsible, it's reckless, it's dangerous, it's something that China, Russia, our adversaries across the world are cheering on. You better believe they are. And who knows? This is one reason it's important to have oversight. What data did they extract from this agency? I think that's a fair question. Who were the people? Who were the experts that they coerced and put on leave or fired? What connections do they have, if any, to our adversaries? Even the new Energy Secretary, Chris Wright, said he tried to play off these firings as him just having moved a little too quickly there. As he said in an interview, he said, the problem is you can't move a little too quickly when the consequences can harm our national security. So our committee is responsible for oversight. We should take it seriously. This isn't a game. You can't just tweet about imaginary job cuts or illegally withholding contractually obligated funds like Musk is doing. The DOE's oversight of our nuclear weapons stockpile is one of its most important functions. More money goes to the NNSA than all of DOE's energy programs combined. It absolutely must be a priority for this committee's oversight efforts as Congress. This should have been a hearing as soon as this happened, because it is that serious. We've got to get to the truth amidst all of this corruption and chaos, so I'll urge my colleagues to vote yes on this amendment and yield back my time.
And I'll yield to Mr. Pfluger.
Yeah, thank you. I just want to state for the record that that was a complete mischaracterization of my question. My question was not what you said. It was actually, is Ms. Castor alleging that the administration has broken the law with regards to security clearances, which is what I thought I heard. It had nothing to do with anything else that was said. So,
Well, I get, reclaiming my time, I suppose that if we could have the hearing, then we'd find out the answer to that question. And I yield back.
Gentlelady yields back. Is there anyone seeking recognition on the Republican side? Seeing none. Well, the gentlelady from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I wasn't going to say anything, but the fairy tale comment. This is indicative of what's going on across the aisle. It's our colleagues, they laugh, they think it's funny. They think it's funny that thousands of people across this country are being laid off and let go. Not in a specific surgical review of their jobs and what they're doing, but it's getting a sledgehammer and saying, let's just fire all these people without knowing what they do, what the impact will be of not having this work anymore. That is the reality. That is not a fairy tale. That is the reality. The reality also is that there is no disputing, zero disputing, that this administration, along with DOGE, tried to just fire 350 employees at the National Nuclear Security Administration, just abruptly, without knowing what they even do. They were fired. Now, one of the hardest hit offices was in Texas, which saw 30% of the cuts. The employees there work mostly on reassembling warheads, one of the most sensitive jobs across the nuclear weapons enterprise with the highest levels of clearance. Yet, as was stated by Darrell Kimball, Executive Director of the Arms Control Association, referencing Elon Musk's Department of Government Efficiency team, the DOGE people, and I'm quoting, are coming in with absolutely no knowledge of what these departments are responsible for. This is what is happening. This is no fairy tale. This is serious nuclear business. And make no mistake, this administration and the silence of my Republican colleagues to stand up and try to protect some kind of a system to actually do this in an efficient way, to actually be more strategic and surgical about how to do this, they're totally silent. So they're saying it's okay. So if you're one of the federal employees and workers that has been fired, who's been let go, why don't you call and make sure your voice is heard to those people who are not standing up for you, who are totally silent on this issue? And my last point I want to make is, this administration and my House Republicans are making this country less safe. Let me say that again. They are making this country less safe. Just think about it. They're laying off workers in charge of the most sensitive information without knowing anything. The smoke and the mirrors of fairy tale language and so on and so forth is very disingenuous. And with that, I yield back.
Gentlelady yields back. Is there any further discussion? Since we do have further discussion, we're going to probably have to recess for votes, and then we'll come back and we'll begin with you, Dr. Schreier. All right, so the committee will be in recess until 15 minutes after the last vote. You're, okay, Diana seizing control. The committee will come back to order.
So we're on,
Mrs. Dr. Schreier was next to speak, right? So to come back to order, I believe when we recessed to go vote, Dr. Schreier was in the queue to speak. So Dr. Schreier, you're recognized for 5 minutes.
Thank you, Mr. Chairman. We were talking about protecting our nuclear experts, and I moved to strike the last word.
Gentlelady's recognized.
So, thank you, Mr. Chairman. Well, this amendment is about mainly the critical staff that were laid off from jobs safeguarding our nuclear arsenal. Similar layoffs at the Department of Energy targeted another really critical group of workers in nuclear safety. In fact, just 16 miles down the Columbia River from my district is one of the largest and most expensive environmental cleanup projects worldwide, the Hanford cleanup site. Hanford, those who don't know, manufactured nuclear weapons during the 1940s. The Hanford site has been undergoing cleanup and remediation now for over 30 years. Underground tanks meant to be permanent were first built in the 1950s and 60s, but they are now leaking, adding to the more than 1 million gallons of hazardous waste that the Washington Ecology estimates is already in the soil across the Hanford site, which is then heading toward the Columbia River. Under current standards, the cleanup and remediation is not expected to be completed until the 2070s. And that is why, one reason why, it is unconscionable that this administration indiscriminately fired over a dozen workers, including safety engineers, environmental scientists, and safety inspectors who are absolutely critical to this cleanup effort. It cannot move quickly enough. Delays in funding and cleanup put the Columbia River and the entire region, and certainly surrounding communities, at risk. And by the way, that public safety exemption under the administration's executive order did not save their jobs. And I would just challenge anyone to try to explain to the constituents of Central Washington, to these residents, or frankly to the rest of the country, how this improves efficiency without compromising their personal or our public safety. And with that, I want to thank you, and I will yield back.
Gentlelady yields back. Is there any discussion on the Republican side? Seeing none, any further discussion on the Democrat side? The committee will suspend. We could do a voice vote. We could do a voice vote. You gonna do a voice? Okay. Okay, if there's no further discussion, the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, no? No. The noes have it, and the amendment is not agreed to. Are there any other amendments at the desk? For what purpose does a gentlewoman from Massachusetts seek recognition?
I have an amendment at the desk.
The clerk will report. Do you have the amendment number? Clerk?
Yes, I just need my glasses. It's titled HE11. Thank you.
Thank you. The clerk will report the amendment.
Amendment to Draft Oversight Plan HE 11. At the end of the second
Without
paragraph.
objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. My amendment would ensure this committee examines the full impact of proposed cuts to the National Institutes of Health, cuts that would devastate medical innovation in this country and set us back decades in the fight against life-threatening diseases. Alzheimer's disease currently affects over 6 million Americans and imposes an estimated annual cost of $321 billion on our healthcare system, a figure projected to nearly triple by 2050. Recent advancements, such as the development of anti-amyloid antibodies, have shown promise in slowing the progression of Alzheimer's. These therapies, emerging after decades of rigorous research, represent significant strides toward effective treatment. However, proposed cuts to NIH funding threaten to halt this momentum, undermining the critical discoveries that patients and families desperately await. Federal investment in NIH research has been instrumental in achieving these breakthroughs, and reducing support now would jeopardize the potential for future life-changing treatments. Congress took a bold step forward by establishing ARPA-H to accelerate cutting-edge medical breakthroughs, but slashing NIH funding now would turn back the clock, undermining the very progress this committee has fought so hard to achieve, progress that has the power to transform and save American lives. And while we consider turning our backs on the world's best scientists, let's be clear, our global competitors are watching. Nations like China are investing heavily in biomedical research. They see what's happening here, and they will gladly take our place as the leader in medical innovation if we let them. This isn't just about research funding. It's about national security, economic competitiveness, and maintaining our place as the global standard for medical excellence. If we are going to fundamentally change the way we fund medical research in this country, it should happen through the appropriate legislative process, not at the whims of billionaires who have zero understanding of how scientific funding works. We don't leave our defense budget up to Twitter polls. We don't let venture capitalists rewrite the rules for how we educate our children. So why would we gamble with the future of medical research in the same way? Because let's be clear about what's at stake. These cuts don't just mean fewer grants and less lab equipment. They mean fewer clinical trials for patients fighting rare disease, fewer young scientists entering the field because research careers become unsustainable, and slower drug development for conditions affecting millions of Americans. We cannot afford to turn our backs on the next life-saving treatment, the next revolutionary breakthrough, the next cure, all because some think we should leave it up to private industry to decide which diseases are worth attention. This committee has a duty to examine the full impact of these proposed cuts before we make a mistake that we cannot undo. Patients, scientists, and families across this country are counting on us to protect the NIH and ensure America remains the world leader in medical innovation. And when families reach the worst-case scenario for a loved one, when they look their doctor in the eye and ask, "What more can you do?" the NIH is the institution that works to get them an answer in the form of a medical miracle. It's the engine behind the breakthroughs that turn despair into hope, and we cannot afford to let it falter. I urge my colleagues to support this amendment, and I yield back.
Gentlelady yields back. For our purpose, the gentleman from Georgia seek recognition.
Asked to strike the last word.
Gentleman's recognized.
Mr. Chairman, I'd like to speak in opposition to the amendment. As I read the memo released by the NIH, there are no cuts to available funding. Yes, I did use the word cuts, but please note that I modified it before and said no cuts. It's a cap on where funds can be spent, and it has since been paused by a federal judge. In other words, if the policy continues, depending on what happens in the courts, the total amount of funding available for research projects would not change. But NIH grant recipients would need to use more of the funding on research and not facilities and administration cost, known as indirect cost. Energy and Commerce and other committees have been talking about indirect costs for some time now. Both sides of the aisle have been talking about indirect costs for some time now. Some universities, take for instance Harvard, have a $50 billion endowment. $50 billion endowment, yet uses nearly 70% of taxpayer money, taxpayer-funded grants for overhead and administrative costs. It amounts to limited taxpayer dollars being used to subsidize incredibly well-off universities. President Trump was elected to reign in government, and he's made it clear that his administration will scrutinize every taxpayer dollar to make sure it's being spent effectively. Additionally, the oversight plan indicates that the committee will conduct oversight of the NIH, including how federal agencies approve and monitor grants to ensure the safe, appropriate, and efficient use of federal tax dollars. This is certainly broad enough to capture research on Alzheimer's disease, pediatric cancer, rare diseases, and other public health research, as specifically noted in the amendment. This amendment does not improve the committee's oversight plan and is simply a political talking point. I urge a no vote on the amendment, and I yield back.
Gentleman yields back. The gentlelady from California is recognized for 5 minutes.
Thank you very much, Mr. Chairman. Mr. Chairman, I move to strike the last word. First, I'd like to thank Representative Trahan for an amendment asking for oversight into the firings and freezes at NIH. I'd like to associate myself with their amendment, and all the remarks made will be made in support of that amendment. My amendment focuses on a specific impact of NIH policy freezes, which has historically enjoyed great bipartisan support: rare diseases. This week is Rare Disease Week. Thousands of patients and families are here in D.C. for a week of community engagement and productive conversations with governor partners. Yet yesterday, I received word that the NIH and FDA has canceled 2 days of Rare Disease Day events at the last minute because many of the employees working on the program were fired over the weekend. Now, this is greatly disappointing to those families, many of whom were already in D.C. when the events were canceled. But that disappointment pales in comparison to what's to come if these careless attacks on our scientific agencies continue. We are in an unprecedented moment of attacks on science. Whether it's arbitrarily cutting NIH research grants, replacing scientists' judgment about how and what they can research, or injecting uncertainty and fear into researchers' lives, these attacks threaten the entire research and development ecosystem. The impacts are not abstract. NIH-funded research impacts all of us, bringing solutions to our most pressing problems. But for the 1 in 10 Americans with a rare disease, it is often the only hope for a breakthrough cure. These scientific breakthroughs often lead to drugs that are taken up by pharma companies, but companies don't want to invest in the long haul of basic research into the diseases. That's why NIH funding is absolutely vital. For example, decades of NIH-funded research helped uncover insights about a certain protein that is altered in patients with cystic fibrosis. That research made it possible for a pharmaceutical company to develop the first medicines to treat the underlying cause of cystic fibrosis. But even if private companies could take on the role of primary research and development funder, without NIH funds, they won't have any trained scientists to conduct the research. NIH dollars train the next generation of scientists. In response to the Trump administration's wanton cuts, grad schools are pausing or closing their admissions because they don't know if they can support more trainees in a chaotic funding environment. The attacks are already chasing bright minds away from these positions, reducing U.S. competitiveness. This committee has a responsibility to oversee our federal biomedical research enterprise. Standing idly by while an unelected billionaire dismantles that carefully constructed research ecosystem is unacceptable. So I urge my colleagues to support my amendment, especially support Representative Trahan's amendment, especially given the impacts on the futures and hopes of rare disease patients. With that, I yield the balance of my time.
I thank the gentlelady for yielding. Yields back. Is there anyone on the Republican side? Seeing none, Mr. Tonko of New York, you're recognized for 5 minutes.
Thank you, Mr. Chair. I move to strike the last word. Thank you. I really do believe that America's intellectual capacity is her greatest asset. And to deny that asset and not work it for the betterment of not only Americans, but people around the world is a sense of falling far short. The Trump administration's decision to block key federal funding mechanisms for biomedical research is doing real and lasting damage, halting progress on life-saving treatments for diseases like cancer, Alzheimer's, and the #1 killer in our nation, cardiovascular disease. Every 33 seconds, someone in the U.S. dies from cardiovascular disease. One of my constituents, Dr. Michelle Lenartz, is working to change that. Her research could help us better understand heart disease, but thanks to this reckless funding pause, her work is in jeopardy. NIH grants go through a rigorous multi-step review process, with final approval resting on advisory committee meetings. Dr. Lenart's grant was on the agenda for the January 27th meeting of that committee, one that never happened. Now, the future of her lab, her students, and her career hangs in the balance. This isn't just bureaucratic red tape. It's a direct attack on scientific progress. Delays like this don't just stall research. They stall hope for patients and families counting on breakthroughs. We need this funding restored. Lives depend on it. And again, we can make a difference by ending the congressional paralysis and doing our job and assuming the responsibilities and opportunities that the Constitution grants us. With that, I yield back.
Thank you. Thank the gentleman for yielding back. The gentleman from California is recognized for, the gentleman from California, Mr. Obernolte. We got a lot of
thank you, Mr.
Californians, so I'll clarify that. Mr. Obernolte is recognized for 5 minutes.
Mr. Chairman, I move to strike the last word. Mr. Chairman, I oppose this amendment. I share my colleagues' support for the good research that NIH is doing. I've been a member of the Science, Space, and Technology Committee for over 4 years. I currently am the chairman of the Research and Technology Subcommittee on SST, and we have jurisdiction over the NIH's research budget. So I've been fighting for over 4 years now to get more funding for the NIH. So I support my colleagues' good words in that respect, but no discussion about this, about all the good work the NIH is doing, can be had without discussing some of the wasteful spending that was recently discovered at the NIH. And I'll give you a couple of examples. $2.3 million on a program for injecting beagles with cocaine, $611,000 on a study entitled Evaluating Microaggressions Among Latinx Individuals with Obesity, $87,000 to study the role of the estrus cycle on oxycodone cravings in female rats, $19 million to study why lesbian women of color prefer menthol cigarettes, and my personal favorite, $710,000 to study the correlation between binge drinking on Super Bowl Sunday and the birth of babies 9 months later, which I could probably shed some light on, and it wouldn't cost $700,000. So if those projects went through a rigorous multi-step review process, I would really like to see what's wrong with the reviews that we're doing. And folks, the problem here is that every dollar that we spend, I mean, these might be worthy topics of discussion and research for someone's PhD thesis, but this is taxpayer money we're talking about. And every money that we spend on one of these projects and programs is a dollar that we're not able to spend on the good work that my colleagues have mentioned, curing cancer, finding cures for some of these diseases. So that's why I'm glad that we're taking a look at the work that NIH is doing, and I'm glad that we're doing some review on that. So for that reason, I would oppose this amendment and urge my colleagues to vote no. I yield back.
Gentleman yields back. So let's go down the gentlelady from Michigan. We'll keep working down the aisle. Gentlelady from Michigan, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlelady's recognized.
I wish to align myself with Ms. Trahan's amendment because I'm very concerned about the Trump administration's recent announcement of what they're doing to NIH grants. And while the titles that you just read are certainly something we should be looking into, I don't think a meat axe is the way that we need to be approaching it. And by the way, when I made a comment innocently saying, why are we doing that? I learned about a life-saving breakthrough that ended up in saving a lot of people in cancer. So we need to get more information on these. We need to, but we don't cut and stop everything. And on top of these indirect cost rates that have happened, NIH has stopped considering the new grant applications because they are blocking the NIH from posting any new notices on the Federal Register, which means that new grants aren't being looked at, advisory committees can't meet. They're obfuscating the fact that a lot of research that was making a difference in many people's lives. I had a mother that's being treated at the University of Michigan call me sobbing. Her child has leukemia. She's been like, they say they can't do anything. She's just frozen in the trial. I don't think that's what we mean to happen either. I've heard from countless researchers who are terrified about what this means for the future of biomedical research. One wrote me, if the block on the Federal Register isn't removed in the next few months, I fear a majority of labs will close within a year. This small procedural wrench has the power to kill U.S. science indefinitely, losing an entire generation of discovery and innovation. So these funding cuts and the disruptions threaten to undo a lot of progress that we all care about. This is impacting life-saving cures, treatments, devices, and therapies for some of our nation's most pressing needs, from pancreatic cancer to addiction to children's health. One of the studies that was stopped last week when they fired a researcher at the VA, it was joint NIH-VA, was looking at burn pits. I don't think we don't want to learn more about our veterans exposed to burn pits. Let's be clear, most of the life-saving medications that are taken today wouldn't be possible without NIH funding. So I hope all my colleagues will join me in being very worried about this misguided decision that is going to undoubtedly endanger our country's health. I urge you to support Ms. Trahan's amendment, and I yield.
Gentlelady yields back. Any member of the Republican side? Seeing none. Next would be Ms. Fletcher from Texas. You're recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. Thank you, Mr. Chairman. Recent advances in biomedical and health sciences, from immunotherapy as a cancer treatment to the highly effective COVID-19 vaccines, demonstrate the strengths and successes of the U.S. biomedical enterprise. And Houston, which I'm so proud to represent, is home to multiple world-leading medical care and research institutions, including the world's largest medical complex at the Texas Medical Center, which employs more than 100,000 people, has 10 million patient encounters a year, and GDP of $25 billion just at the Texas Medical Center alone. The Trump administration's announcement that it would not honor the individually negotiated contracts with institutions across the country and would instead impose blanket cuts across the board to indirect costs threatens to devastate medical health research in our community, certainly, but across the country, as many of my colleagues have already noted. And I think one thing that's important for us to think about here and to understand is to think a little bit about the history. I listened to a really interesting news story the other day where the editor-in-chief of the journal Science explained that about 70 years ago, after World War II, the United States decided that instead of building its own research buildings and hiring its own scientists, that it would carry out national research efforts at universities. And the idea behind that was that it was mainly that professors would be carrying out the research, they would be more independent, they would be more creative if they were doing it this way rather than being directed by the government. Obviously, that's expensive, and so the institutions and the government decided they would split the costs roughly. And the federal government's contribution to that comes in the form of these indirect cost portions of the grant. And that's a fraction of the direct costs they're contributing. And I think it's just really important to say, we have built up this enterprise over the last 70 years that has been roughly splitting the costs 50-50 between the government and these institutions. And one of the things that really struck me when I first got to Congress, I, like Mr. Obernolte, served on the Science, Space, and Technology Committee, and I was always struck at every single hearing by the witnesses' testimony about the collaboration between the research institutions, the government, and the private sector at every single hearing. That is by design, and we see it working incredibly successfully time and again in that committee and in the work that they came to testify about. These arbitrary, across-the-board cuts undermine our entire research system.
In Texas alone, the NIH funds 4,400 active projects that total $2.5 billion. And I think it's important also for us to remember that they're not just damaging for the long-term success of the enterprise, they are prohibited by law. And since 2018, the Congress, us, we have said in our appropriations bills, most recently the last appropriations bill, that we banned NIH from making changes to how indirect costs are determined. That's the direction of Congress. And so once again, I ask my colleagues, why are we ceding our authority? Why are we allowing Elon Musk to replace his judgment for ours? Why are we not exercising our oversight capacity now and ensuring that what is happening, we can look into the kinds of things that we've heard about today. We should be looking and performing our oversight function. But instead, we seem to be ceding all of our authority to an unelected person and his team. And my constituents, as I said earlier, have a lot of questions about this. But I think it's really important that we remember that we are here for a reason, and we all got elected too, and people expect us to do this work that we were sent here to do. And I've got a lot of constituents asking me, where's Congress? Why isn't Congress doing this? Why aren't we asserting our committee's jurisdiction here? Why aren't we asserting our authority here as Congress? And I think it's really important that we vote in favor of this amendment, that we exercise our jurisdiction, that we assert our authority, and that we do the work that we were sent here to do. Thank you, Mr. Chairman. I yield back.
Thank you. The gentlelady yields back. Anyone on the Republican side? Seeing none, the gentlelady from California, Ms. Barragan, is recognized for 5 minutes.
Thank you, Mr. Chairman. My colleague cited some Harvard amount of money, but let's look to Georgia. Are you willing to go and get your sledgehammer and go after the Emory University or the University of Georgia's Augusta? Or how about we look at University of Georgia Tech? What about Morehouse School of Medicine? Those are all academic institutions in your state. Would you want to do that? Nobody wants to do that. We don't want to do that. But it's very disingenuous to pick out one institution and not to name an institution maybe that's in your district or your state. As a matter of fact, the number of academic institutions that get funding from NIH are very heavily Republican. Let's look at Texas, the University of Texas Southwestern Medical Center. In Alabama, the University of Alabama at Birmingham. In Florida, the University of Florida. The disagreement is not where their programs should be looked at and that we should see where things should be cut. The disagreement is that you all, our Republican colleagues, are saying, that's okay, we don't need to have a role in this. Just, we'll let you, Mr. Billionaire that was not elected, we'll let you just decide where we're just going to make all these cuts without even looking at the programs. Now, some of the cuts that were made by this administration and Elon Musk, which my Republican colleagues have been totally silent on, totally silent, which is complicity, is the cuts and the devastation to the Center for Alzheimer's and Related Dementias, CARD. They fired 1/10 of its critical workforce is out of jobs. CARD is the forefront of groundbreaking research, not only for Alzheimer's, but for Parkinson's disease. Its scientists across the nation depend on CARD's research. So if you got CARD, you're gutting critical research nationwide, setting us back years, if not decades. This isn't just policy. These are personal, these are people's lives. We've heard from people on this dais of their family members who have this. Why would you take a sledgehammer and just cut without looking and assessing programs? And that is what we're talking about here today. It's looking at the jobs that have been cut. It's looking at the impact that it's going to have and the negative impact it also will have for health outcomes. Millions of Americans and families who live with Alzheimer's fight every single day. Do we have their back or do we not have their back? My colleagues across the aisle are saying, it's okay, we're not going to look at it, we're going to let somebody else come in and decide. that we're just going to fire people indiscriminately. Because make no mistake, that is exactly what is happening over and over again. So let's have the conversation about actually looking at programs instead of just being silent and letting somebody else do this in such an irresponsible manner. And I heard we want to be responsible. Are you kidding me? There's so much irresponsibility happening now and nobody's speaking out. And that is what we are trying to do today, is to include this in the oversight plan. As Republicans remain silent, Elon Musk and Donald Trump will continue to dismantle our scientific workforce and sabotage life-saving research. House Democrats are standing up to say, not on our watch, and today are making that effort to put that into the oversight plan. So when my colleagues across the aisle say they're for the NIH, if you were let go as part of NIH, remember who it was who stood up and call your person that represents you and ask them why they let this happen without any real review of the process, any real oversight, and why they said, we're not going to do the oversight, we're leaving it to somebody else. I yield back.
Gentlelady yields back. Anyone on the Republican side? Seeing none. The gentleman from Massachusetts, Mr. Auchincloss, recognized for 5 minutes.
Thank you, Chair. I move to strike the last word. I want to respond first to the gentleman from California, and I believe him when he says that he supports NIH funding, but I'm disappointed in the tactic employed of laying out some silly examples as an excuse to throw the baby out with the bathwater. The thing about curiosity-driven, peer-reviewed basic research is that you're going to have investigators pursue their curiosity, and it's going to end up taking them sometimes to silly places, and that's okay. Other times, you know, two amateur ornithologists who are also bicycle mechanics pursue their curiosity and they invent an airplane. Or sometimes some engineers ask, what happens if computers could talk to each other and you get the internet? Or sometimes people ask, I wonder what would happen if you could edit DNA and you get CRISPR. Curiosity-driven, peer-reviewed basic research is not meant to pass the politician's test. It's meant to pass peer review. It's meant to be scientifically rigorous. And when politicians point out failures, it inhibits the spirit of American curiosity and enterprise that makes us an innovation hub. I want to also respond to the gentleman from Georgia. And he had indicated that, thankfully, a federal judge stopped the NIH policy of 15% indirect cost recapture rate, as though that somehow excuses Republicans' inaction on the matter. The reason a judge stopped it is that it was illegal in 2018, in 2018, in 2019, 2020, 2021, 22, 23, 24. In bipartisan majorities, Congress said to the NIH, you are not allowed to do this. Now, the NIH, I'm sure, is telling the Republicans on the side, no, we're allowed to do it because we're setting a different law that says actually, on a case-by-case basis with documented exceptions, we're allowed to lower the IDC rate. There was no documentation, and this was not case-by-case. This was a chainsaw taken across the board, dropping an average 60% IDC all the way to 15%. You all think that somehow this is the administration taking it to the blue states and that they're mocking the blue states. Folks, the administration is mocking you. You're the ones who voted for this, and the administration is ignoring you. And you're right, Harvard has a $50 billion endowment, MIT is a $30 billion endowment, they are in my home state. You know, I could point out that their endowments are largely restricted giving, but you're probably right. The big ones are gonna be okay. I challenge all of you, go back to your districts, talk to your academic medical centers, your universities, ask them how they're gonna be. Because what they're gonna tell you is young investigators, early stage scientists are giving up. And as they're losing, do you know who's winning? China. China is becoming a biotechnology powerhouse. You know, there used to be a synthetic biology competition, there still is, I should say, called iGEM. And for the first 15 years, US teams of students were dominating. Haven't won in 10 years. Now, half of all 400 teams come from China. China is doing 60% of synthetic biology publications. China is investing in dozens of Kendall Squares all across the country. And from that biotechnology power comes economic competitiveness and comes military prowess. So as we cut research infrastructure through this NIH 15% indirect capture policy, ultimately, it's going to be every American scientist, red states and blue, who suffers, and it's going to be China who eats our lunch because of it. I yield back.
Gentleman yields back. Seeing none on the Republican side, the gentlelady from Washington.
Thank you, Mr. Chairman. First of all, I just want to associate myself with so many of the remarks from my esteemed colleagues about the NIH and what it means to arbitrarily say you can only spend a certain amount on indirect costs. And I thought the first thing I should do is just remind people that the United States is the gold standard for research for a reason. We've, in a bipartisan way, decided to fund the National Institutes of Health in order to supply the resources to our most brilliant scientists at universities across the country to do the research that would allow the entire world to take leaps forward. And I think we are all so proud of this record of accomplishment in our country. In my state, across the water from where I live, we have the University of Washington, which you would call big, but is not going to be okay with these cuts. I assure you. We have Seattle Children's Hospital, another leader in research, Fred Hutchinson Cancer Research Center, Harborview, researching brain trauma and other trauma, Washington State University. They all get NIH funding, and I have been getting panicked calls and texts from researchers saying, this is going to shut down medical schools, this is going to shut down our institutions, and I will just tell you, because much of what I was going to say has already been said, that when it comes to children, and I'm a pediatrician, during my residency when I worked on the cancer wards, all those kids, they were being treated on trial protocols, on experimental protocols funded by the National Institutes of Health. This is how they got access to the groundbreaking new treatments that had the best chance of giving them a cure. And by taking away this funding, we are putting those kids' lives at risk. I want to point out a couple other things. Just the word indirect gets thrown out there as though it's a slush fund or something like that. The reality is direct funding is what you think of. It's the laboratories, it's the salaries for the scientists, it's the bench, the place where they work. Indirect means that it may not be used for a single research project, but it could be used for the entire university. It could be the building, the equipment, the lab, the infusion center, the MRI machine. It could be the grant writers. It's keeping the lights on. These are not insignificant needs, and many, as we've heard, of our universities get about 50% indirect costs. And I also just want to clarify some math on that. 50% does not mean that half the money is spent on indirect. It means that for every dollar spent on research, 50 cents is added for some of these equipment and upkeep and the like. We've also heard about not just the kids with cancer that I talked about, but I'm hearing stories about people who are in the middle of a trial right now. They're getting their chemotherapy through NIH-funded research, and now all of a sudden that's stopped. That is a very personal experience, not of the researcher, but of the patient who is depending on this. And I want to just emphasize that this is gutting U.S. excellence, U.S. research and innovation, and it is gutting people's lives. It is also for those students who are thinking of going into biomedical research. Now they're thinking twice. They're thinking, well, why would I go into a field where I'm being kneecapped already, where there might not be funding for my work, where I can't let my imagination go wild to treat, to find the cures for tomorrow's diseases. And I just cannot emphasize enough the damage that this does. So I would encourage my colleagues to support this amendment. Yield.
Thank you. The gentlelady yields back. The gentlelady from New York is recognized for 5 minutes.
Thank you. I think it's important for us to remind what this amendment is all about. It's not about defunding studies that are deemed as wasteful. It's about just assessing the impacts of these cuts on the NIH, on the current research that's happening right now. When I was 16 years old, my dad was diagnosed with a very rare form of lung cancer, stage 3. And it was very aggressive, and I was in high school. And we're at Memorial Sloan Kettering at the time. And his prognosis was not good. And as a sophomore, junior in high school, my mom, she cleaned houses to make ends meet. I was on CHIP as a kid growing up. And we looked towards the doctors at Sloan Kettering, the researchers at Sloan Kettering, and we said, is there anything you can do to save my dad's life? And they said, with the current treatments that we have right now, our options are very limited. But there is an experimental trial that we can try to get him access to. And for millions of people across this country whose child has a rare disease, whose parent is on death's door, who they themselves have no recourse for treatment, research, clinical trials are one of the only options they have to extend their life. My dad was admitted to that trial, and his cancer went into remission for a brief period. We got 2 to 3 more years with my dad before he eventually passed away. And I can tell you that 2 more years with my dad, 3 more years that a person has with their child, or a lifetime for some people whose lives are saved by the NIH's work, do not think that this is wasteful. They do not think that what is happening right now is acceptable. And this amendment simply seeks to assess if any of this life-saving research is at risk due to these indiscriminate cuts. If you don't believe that central nervous stimulants should be explored, the impacts of that should be explored on certain mammalian species, fine. If you don't think certain research on bedside manner regarding racial groups in this country rises to the level of merit, fine. But this isn't about that. This is about whether this research is being affected. And shouldn't we want to know that? And if not, why don't we want to know that? That's what this is about. These are things that are pretty basic that I would think on a bipartisan basis we would be able to agree on. Just an assessment on what is happening and what is being cut. Not in approval or disapproval, but an understanding and proper oversight of what is actually going on. With that, I yield back.
The gentlelady yields. The gentleman from Ohio is recognized. I'm sorry, the gentleman from, Mr. Guthrie is recognized.
That'd be Griffith from Virginia.
Mr. Griffith.
I appreciate it.
Sorry.
That's what happens mid-afternoon, Mr. Chairman. I appreciate the gentlelady's comments, and I'm sorry about her father's situation. That said, as many of my colleagues have said, this document that we're going over is inclusive. I too want to have answers to the questions about whether or not the 15% is appropriate in biomedical research. I don't know the answer, and I think that the committee will do that, but we don't need the amendment to do that. There are people on both sides of the aisle who agree we need to figure out what the right number is. I'm not sure it's 50%. I'm not sure it's 15%, but it is something that I think that we as a committee are going to have to dig into. And with that, Mr. Chairman, I yield back.
Gentleman yields. The gentleman from Ohio is recognized.
Thank you, Mr. Chair. I move to strike the last word. The question here is whether or not we're going to update our oversight rule to give folks who are deeply concerned about the loss of NIH funding some reason to believe that they may not lose the tens of millions of dollars that they desperately need to provide the care that they're providing. And if there was a bipartisan vote here today on this amendment that said, yeah, no, we're going to ask questions. We're going to push and prod. We're going to hold people accountable. We're going to get to the bottom of this so that our universities and hospitals, research institutions aren't punished. That's the question. So whether it's a cut or a cap, it's still stealing money from hospitals and universities. And we have this table where we can bring people in and ask them questions, hold them accountable. We can ask about the Eagles and the other things that maybe folks don't want to spend money on, and then we can say, hey, don't do that, but don't cut tens of millions of dollars from these local hospitals, these local universities. I have a hospital that could lose up to $50 million. A university that is likely going to lose up to $30 million. That's what they're worried about. They're worried about tens of millions of dollars. So if you add all my hospitals and universities together, we could lose hundreds of millions of dollars in NIH funding. Now, to put people, their minds at ease and say, no, there is going to be a bipartisan effort to ensure that doesn't happen, the least we can do is add 10 words to say that we're going to hold a hearing or hearings to ensure that these indirect costs aren't done in a way that hurts our universities and colleges and research institutions, period. I yield back.
The gentleman yields. The gentleman from California, Mr. Peters, is recognized.
Thank you, Mr. Chair. This is about oversight. Americans from all over, including in my district, want real oversight. It's not about arguing the merits of a spending level at this point. It's about how these spending decisions we've already made were changed unilaterally by the president. And one of the most important institutions we're responsible for overseeing is the National Institutes of Health, which drives our country's scientific research enterprise and makes it the world leader. It's a playbook that other countries want to copy. Funding from public research institutions like NIH and the National Science Foundation helps us access life-saving medicine, strengthen our healthcare system, and support small businesses in districts across the country. In my district in San Diego, in 2023, we drew in about $2.2 billion in funding from the NIH and NSF. The regional economy, which sustains a strong public-private life sciences ecosystem, turned that $2.2 billion into $56.6 billion in total economic output. That's more than the entire NIH budget during the fiscal year. And that doesn't just boost areas like San Francisco, Boston, and San Diego. It supports scientists, families, and small businesses in every state, including red states like North Carolina, Florida, and Alabama. We should have those debates, but what we shouldn't be doing is watch the White House on January 27th issue a memo freezing federal funding for all federal agencies, including NIH. Almost immediately, families with sick children and those enrolled in clinical trials struggle to access the medicines they need to survive, including one trial at Moore's Cancer Center at UC San Diego, which I visited this week. And this is what you're talking about when you talk about waste. If they don't get paid, they have to shut down their clinical trial, and all the benefit of the work they've done so far will be lost. They'll have to either not have that research or have to do it again. That's waste. That's waste. We don't want that. And by the way, it's not the president's decision to make when we've approved this already. So that's why a federal judge put a temporary restraining order preventing the freeze while these legal arguments unfold in court. On the 7th of February, the Trump administration announced it would illegally slash grants that help university research programs keep up with increasing overhead costs like rent, lab equipment, utilities, safety, cybersecurity, and more. And as a lawyer, I don't throw a word around illegally lightly. Because Mr. Pfluger raised this, and I respect him. But the law prevents any administration, Republican or Democrat, from unilaterally changing existing contracts. Every member of this committee should want to investigate potential violations of federal contract laws and should hold on to the right of the power of the purse for this Congress. I have not seen one member of the opposite party, from the Speaker of the House down, stand up for Article 1 for the Congress of the United States as an independent, co-equal branch of government. And until that happens, this place is not going to work. And I'm not asking you to agree with the funding level at this point. Let's have that discussion. We should have that discussion. Maybe you want more, maybe you want less, but that's our decision to make. It's not to be done unilaterally by any executive. A few days after the Trump administration's announcement, a federal judge temporarily blocked the NIH cut from going into effect. But that kind of change has to come from Congress. So contrary to what some people would have you believe, NIH workers are not deep state leftist bureaucrats sitting around and twiddling their thumbs. They're some of America's brightest and best scientists working to cure Alzheimer's, which if we don't get ahead of that is going to break the budget of this country, cancer, rare diseases. I'll argue vociferously against cuts. But what I'll say today is this is about oversight. And you would not let any Democratic president go run this mischief on the federal government. So let's stick together as an institution. Let's do the right thing. And let's add this specific thing to our oversight plan and get ahead of it. Price tags are only going to go up with time. And obviously, the more we let this get away from us and let this executive overreach go unchecked, the less power we have as an institution, and less ability we are able to have to do what our constituents sent us to do here when they elected us on the same day as they elected Donald Trump. We have jobs here that are independent. Let's do them. I yield back.
The gentleman yields. The chair recognizes the gentlelady from Florida, Ms. Castor.
Thank you, Mr. Chairman. I want to thank Representative Tran for bringing this important amendment. And Rep. Fletcher, your history lesson was very illuminating. Thank you. And all of the members, I think, have offered thoughtful comments. And Representative Peters is right. This is too important for our Republican colleagues to abdicate their responsibility, to put your head in the sand to the fact that Elon Musk and this administration now have made this illegal shutdown of NIH grants. Thankfully, the courts have stepped in and said that it looks like it's illegal. There's just too much at stake here, and we need to work together to continue to keep medical research, biomedical research, the top in the world. We cannot cede that to China. I'm not willing to do that, but I just urge you to join us. And Mr. Chairman, I've asked on a few of these, has the majority sent any letter or at all to the administration on this topic of the NIH shutdown and grants? Or on this issue?
We will
of the
check with
direct
staff.
costs? Okay. It's just too important. And it's one of the reasons I know we all want to serve on this committee, the Energy and Commerce Committee, because we want our neighbors back home to be healthy and well. And I've really learned a lot leading the Children's Healthcare Caucus, the Children's Pediatric Cancer Caucus, and I've learned so much from the patients, my neighbors, the doctors and researchers back home at the Moffitt Cancer Centers, the lead cancer research institute in the Southeast, or the University of South Florida, where they do extraordinary research on diabetes and traumatic brain injury, and they've been out front on the cure and prevention of Alzheimer's. I will never forget the young woman who met me at USF at the Alzheimer's Institute, who said, with the University of South Florida, with what they're able to do, my mother is more engaged. Her Alzheimer's, they're able to delay the total onset so that they know each other and can enjoy life. The patients that talk about the therapies for breast cancer treatment, the advances that we've seen, because thankfully America is the lead in the world in doing this. And right now, Rep. Peters is right, you throw a wrench into it, clinical trials are delayed, treatments and cures are delayed. I think about the researchers, how they, at Moffitt Cancer Center, or the University of Florida, which is probably the lead institution in Florida for NIH dollars, or Florida State University, my alma mater, they are doing extraordinary work, and this isn't wasteful stuff. This is multiple myeloma, how you treat leukemia. They're attracting postdoc researchers from across the world. I can't tell you how many I've met from overseas who come here to America to learn and to find these treatments and cures. There is something sinister going on here, because this is a page out of the Project 2025 playbook. If you Google it, if you look it up, this is what they said they would do. And despite the fact that the president said, we're not doing that, They're doing it. Project 2025 said, okay, maybe this NIH money, maybe instead of going to our research institutions and finding treatments and cures, we'll do a block grant to the states. Is that what's happening next? Are Republicans going to continue to be silent when that happens? You're going to continue to put your head in the sand, turn your back on our neighbors back home who rely on medical research to stay healthy and well and to survive diseases? Let's do this oversight. It's our responsibility together. I don't care if you're a Democrat or Republican, it's our responsibility to our neighbors. We owe them that. So vote yes on this amendment and let's get to work. Yield back.
Gentleman lady yields. The chair recognizes the gentleman from Texas, Mr. Pfluger.
Thank you, Mr. Chairman. I just, throughout the early portion of this debate, and I think it will go probably far into the night as well, is really exciting, actually. And I think this committee stands to the vigorous debate that we're having. We really stand to continue this throughout the year, because this particular committee is going to address many of the issues that we're facing in our country. So I am personally glad to see a call for oversight from our colleagues, because for the last 4 years, we haven't had that. And we've had a lot of people testify in front of this committee and other committees. And I'll just draw your attention, speaking of the NIH, remember how we got here. Remember about the lack of trust that our country formed in people like Dr. Anthony Fauci. And I'll just read you, David Morins was a Fauci aide, a career NIH scientist. And by the way, NIH does amazing things. The competitive advantage is our innovation. The science that we do leads the world. We need to continue this. We're going to continue this. But my constituents want to look under the hood and understand that are there things that we can do more efficiently? They're asking me that. So as much as we're hearing from the other side, you're not hearing it, but I'll tell you and speak from this side that we want to know that we're doing this correctly. This was just one example that Morins, the former aide, said. He said, I can either send, when sending emails on a personal email instead of government email, but it was government business. He said, I can either send stuff to Tony on his private Gmail or hand it to him at work. He is too smart to let colleagues send him stuff that could cause trouble, Morins wrote in a 2021 email released by the committee. And then he says, I quote, I learned from our FOIA lady here how to make emails disappear after I am FOIA'd, but before the search starts. So I think we are all safe, Morins wrote in a separate email. That's just one example, guys. Now, throwing the baby out with the bathwater, no, but we do have a responsibility to do oversight. So, Mr. Chairman, thank you for holding an oversight structural conversation. And it sounds like both Republicans and Democrats are all on board to do oversight in the government and to make sure that our agencies are actually operating efficiently. I'll yield back.
Gentleman yields. The chair recognizes Mr. Carter from Louisiana.
Thank you, Mr. Chairman. Strike the last word, please. Move to strike the last word. Listen, you know, I heard earlier one of my colleagues say that preventive versus curative, that preventive care cost far less but reap greater benefits. Well, what is research? Research gives us the ability to identify and prevent dreaded diseases. I know in my district in Louisiana, we have some of the best research hospitals in anywhere. And I know that they tell me that their return on investment is, for every dollar that's spent, there's some $3 in return on the investment. Preventive care versus curative care. We also know that if there's one area where there has been nearly, if not zero, cases of fraud or abuse, it's been in National Institute Health funding. So when we know that we have this return on investment that comes back to the federal government and back to the American people in multiple ways, why would we endeavor to impact NIH? When we look at the dreaded diseases that we end up spending billions of dollars on in curative care that are fixed with preventive care through research. If there's something that should never be viewed as
political or partisan. Research, medical research. Our young, best and brightest who are preparing themselves are having to leave our country because they don't believe that we believe in research. We talk about a brain drain. We talk about losing our best and our brightest to China or to other places who are, in fact, investing in research. Yet, because of this willy-nilly effect of let's just crash and burn, cut and ask questions later, cut and let's see what impact it has, cut and then let's uncut because, oops, we cut too fast. Oops, we didn't mean to cut that. We need that. How about looking and seeing what these things do before you cut? How about a little bit of preventive care on watching what you're doing? One thing I know that Mr. Trump and Mr. Musk understand, return on investment. This is a return on investment that is unimpeachable. The data is empirical. I implore you to get your hands off NIH. Get your hands off research dollars. Get your hands off our doctors and our research scientists who are saving lives every day. This is not political. This is not partisan. This is the right thing to do for all the right reasons. I yield.
Will the gentleman yield?
Yes.
So I just want to briefly say, Mr. Peters gave the whole litany of what happened with Doge and everybody trying to freeze all of this biomedical spending, and then the court ordered them to start it up again. But he didn't mention that what happened, and this is why Mr. Chairman, this is why we have to have a hearing into what they're doing to NIH. Because what the Trump administration did after they were ordered by the court to restore the funding is they simply stopped having the Federal Register notice these review meetings. So in other words, what they said is, you can't have a grant review meeting, and that has frozen any approval of new grants in the entire United States. Hundreds of studies are at a standstill, including pancreatic cancer, brain injuries, and child health. Last week, the NIH canceled 42 out of 47 scheduled meetings to assess new grants, including grants on drug users and HIV, including a review panel for a grant application on staph infections in people with diabetes, and on and on. Universities, because of this technicality that nobody has paid any attention to, have stopped all this funding coming to institutions and have stopped the grants. And so this is why we need to have a hearing to figure out what the heck the Trump administration is doing and how this is impacting our research institutions. And I would ask unanimous consent to put this article where I got this information from, Paying for Science, from the New York Times, in this morning's New York Times, into the record. I'd ask unanimous consent.
We will review the article. The gentlelady yields. The chair recognizes the gentlelady from Virginia, Ms. McClellan.
Thank you, Mr. Chair. I'm glad to hear my colleague from Virginia say that he wants to look into and possibly have a hearing on these cuts, and they are cuts, because when you put a cap on indirect costs, that causes a university research center to lose $26 million, as VCU in my district has estimated they will, or $13 million as Virginia Tech in the gentleman's district will, or $39 million that UVA in Virginia will, or additional cuts that James Madison, University of Richmond, Virginia State University, to the total for Virginia losing around $78 million in funding if a 15% across the board cap goes in place. I hope this hearing looks into the damaging effects that taking a chainsaw to something that needs a scalpel will have. Because a 15% across the board cut hits VCU very differently from Harvard. Because this cut's not in a vacuum. VCU doesn't have a Harvard-like or even a UVA-like endowment. VCU is one of the largest safety net hospitals in Virginia. Relies very heavily on Medicaid funding, which is going to be cut, as we've discussed earlier. Their student base relies very heavily on financial aid or scholarships. Many of them are first-generation, non-traditional students who typically work while going. And so this cut, combined with the cuts to Medicaid, combined with the stress that are going to be on the Commonwealth of Virginia as they try to help fill this hole, to keep the research done with these grants from stopping. And what is it? I asked, go talk to your institutions that are doing this research. I did. And I asked, give me an example of something that you were worried is going to stop. And we talked about brain cancer. But not all brain tumors come from brain cancer. All cancers, when they metastasize, eventually result in brain tumors. That's what happened with my father when he had kidney cancer. And when you have radiation or chemotherapy, it is a broad, very debilitating treatment for sometimes a tumor that is as big as the tip of my pen. What killed my father was not the brain tumor. What killed my father ultimately was the effects of the treatment. But one of our institutions in Virginia has a clinical trial for targeted injection-based metastatic brain tumor treatment. And they don't know if they can continue it. And they don't have an endowment that they can go to. They don't have a rich alumni base that they can go to. They're already underfunded by the Commonwealth of Virginia, which has to balance its budget and can't print money. So when you think about all of these cuts, and when we look at the impact in our oversight role of all of these cuts, remember, they're not in a vacuum. And an across-the-board, one-size-fits-all cut is going to hit each of our constituents and each of our economies very differently, because in Virginia alone, NIH funding sustains over 7,000 jobs and adds nearly $1.73 billion of economic activity to our Commonwealth. That's just in Virginia alone. So I look forward to an oversight hearing with my colleague from Virginia on these cuts and how they intersect with the Medicaid cuts we're expected when we find $880 billion to fund tax cuts for billionaires. I yield back.
Is there any further discussion on the amendment? Seeing none, the vote occurs on the amendment. The ranking member has asked for a recorded vote. The roll will call the vote. The clerk will call the roll.
Mr. Latta. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Allen. Mr. Weber votes no. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Miller-Meeks votes no. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mr. Fry. Ms. Lee. Mr. Langworthy. Mr. Kane. Mr. Kane votes no. Mr. Rulli. Mr. Rulli votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Ms. Clark. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
How is Mr. Latta recorded?
Mr. Latta is not recorded. Mr. Latta votes no.
The clerk will report the result.
Chairman Joyce, on that vote, there were 21 ayes and 24 noes.
The amendment is not agreed to. Are there any further amendments? For what purpose does the gentlelady seek recognition?
Mr. Chairman, I have an amendment at the desk labeled HE 19.
The clerk will report the amendment.
Amendment to Draft Oversight Plan, HE 19. On page 3, after quote, making sure tax...
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. As all of us know, long-term care is a crisis in this country. This amendment would require the committee to study the impact of cutting federal Medicaid coverage and access to long-term care for seniors and people with disabilities. Medicaid is a lifeline for millions of seniors and older Americans on fixed incomes. I think we all talk about it intellectually, but until you've navigated the system, which unfortunately many of us have here, we do not realize how broken the system is or how deeply fractured it is. And quite frankly, all of us here are a lot luckier than most Americans across this country. Medicaid is the single largest payer of long-term health care services, and it currently covers long-term care for millions of seniors and individuals with disabilities. It covers institutional care and almost 62% of institutional care in this country is paid for by Medicare right now, and individual states can seek waivers to provide home and community-based services, or HCB, home CBS, which, by the way, we should be looking at doing more because most seniors want to stay in their own home in the community that they are in, and this actually saves federal dollars, and there are more than almost 1 million people on the waiting list for that. I've introduced several pieces of legislation to strengthen access to HCBS and bolster the caregiving workforce who provide these critical services. And while I remain entirely focused on continuing to support these efforts, I'm deeply, deeply concerned about what will happen to seniors in this country if Medicaid is cut and we are cutting support for seniors and with that need and are desperate for long-term care services. When faced with these funding cuts, states will have to limit the level of a service they provide, forcing many to forego the care or to pay out-of-pocket expenses they don't have. It'll place a tremendous financial burden on the seniors and individuals living with disabilities who depend on long-term care services to lead healthy and dignified lives. Many seniors and older Americans survive off of low incomes or have chronic health conditions that prohibit them from working. Medicaid allows these individuals living on fixed incomes and often have chronic diseases to continue getting the care they need by filling in the gaps that their Medicare coverage doesn't have without having to worry about choosing between food and housing and their health. Medicaid has long been considered one of the most effective anti-poverty programs in the nation, and its expansion has significantly improved health outcomes for seniors and older adults. They've worked hard their whole life. They've earned the right to live with dignity and respect and not be desperate about how they can even afford their medicine and the food on their table. In a nation where out-of-pocket health care spending forced more than 10 million Americans into poverty in 2016 alone, Medicaid serves as a lifeline, not only for health care, but for economic stability as Americans age. A slash in funding will result in a reduction of long-term care services that too many people rely on. This study is important because there are too many families where the spouse doesn't know what they're going to do or how to take care of someone they love. And if they can't find the caregiver, they've got to give up their job, and they're in a more vicious circle of what happens. We need to be discussing much-needed investments in our long-term care infrastructure and our caregiving workforce to ensure that we're doing this right, that we're giving people the support that they need. And families aren't left destitute, living on the street, or the worst, dying because they have no options. So I urge this committee to take a very serious look and study and oversight long-term care in this country and how we can make it easier, more affordable, reduce costs because we can, some very simple ways, and meet a moral commitment we should have to our seniors. Thank you very much, and I yield back.
The gentlelady yields. The chair recognizes the gentleman from Florida, Dr. Dunn.
Thank you. Move to strike the last word.
You've been recognized.
Thank you, Mr. Chairman. We share a bipartisan interest in making sure that Medicaid can provide care for our nation's most vulnerable, including ensuring that it continue to provide long-term care for our nation's seniors and people with disabilities. What this amendment fails to acknowledge is the devastating impacts that the Biden administration did to the long-term care access in just 4 years. The nursing home staffing ratio rule is the single biggest threat to our nation's long-term care system. Over 80% of nursing homes cannot comply with the rule and are at risk of closing. The access rule would require sizable pass-through payments for long-term care providers that are in theory good, but are untenable for the states to pay out. States like California and New York, as well as disability Rights groups like ARC wrote strong opposition against this rule out of fear that it would gut home and community-based long-term care. What's more is that the Biden administration saddled the states with hundreds of billions of dollars in new Medicaid regulations that will threaten access to home and community-based services as well as long-term care. To me, this amendment is redundant because the oversight plan already calls out the waste and abuse of the last 4 years and the harm that it is bringing to the Medicaid program. Real cuts to long-term care are already happening as we speak because of the Biden administration, and our first goal needs to be to reverse that course. And Mr. Chair, I yield back.
The gentleman yields. The chair now recognizes the ranking member of the entire committee, Mr. Pallone.
Thank you, Mr. Chairman. And I would like to, well, first of all, let me thank Debbie Dingell, because I know that she has been working on long-term care for so many years and has introduced legislation. And of course, when she talked about home-based as an alternative to institutional, it's certainly something that we all desire. But I do want to talk about nursing home care right now. And I heard what Dr. Dunn said. Whether or not you agree with what the Biden administration did with nurse staffing ratios or with other regulations, and of course I do support what they did. The bottom line is that if you cut funding for Medicaid that pays for nursing home care, you're only going to make the situation worse. I mean, what you're hearing from states is that, you know, the expense, I suppose, or, you know, trying to get adequate number of nurses or nurses' aides or whatever. But you're only going to aggravate that situation even more if you make cuts in the level of funding. It's not waste. It's the fact that they maybe have a harder time finding people that will actually perform the care. It's not an issue of waste, fraud, and abuse. It's an issue of having enough money to pay the salaries, having the people educated, the cost of the education for the nurses' aides and for the nurses. But I want to tell you this, these nursing homes, and you probably agree with me, they operate on such a minimal level of funding now that if you start making cuts in their funding, you are definitely going to see nursing homes close. You're going to see them sending those individuals back to the caregivers, if there is one. Those caregivers are going to have to, you know, they won't even know what to do. They lose their job because they can't take care of the loved one. But the main thing you're going to see is the quality of care in these nursing homes going down. You know, I've been here a long time. I guess I've been here longer than anybody else, to be honest. I remember even before I came to Congress, when I was in the state's legislature, we had in New Jersey fires at nursing homes. The situation at nursing homes, because of the lack of funding, was so bad that we had people killed in fires in nursing homes all over the state, but even particularly I remember in my district, in my state legislative district. These places are operating on a very minimal level of funding. You'll see them not having enough nurses. You'll see them cutting back on everything, application of medication. You'll see fire and safety codes go down the drain. I can't emphasize enough how the quality of nursing homes will go downhill. It's not just a question of closing. A lot of them will close, but a lot of them will try to continue to provide services and won't have the funding to do so. So when you talk about Medicaid cuts to nursing homes, you will literally see people die. They will not have someone to turn them over. They'll have more bed sores. They'll end up in the emergency room more often because they can't be cared for at the nursing home. I mean, I've seen it myself. I've been to these places many times. A lot of people don't like, I'm not saying anybody here because I know you care, but you know, a lot of people don't understand that they don't even want to go to a nursing home. They don't think about a nursing home. They put it out of their mind because they don't want to think about what goes on. But the quality of nursing home care has significantly increased, believe it or not, over the last 20, 30, 40, 50 years. But if you start making major cuts to Medicaid that are going to impact these nursing homes, you're going to go back to where we were 40, 50 years ago. Fires, safety, unhealthy conditions like you've never seen. And I know I may sound like I'm exaggerating, but I'm not, because I've seen it. I've seen it happen. And so that's why it's so important to have some oversight about what's going on here, and that's why I support the gentleman from Michigan's amendment. I yield back, Mr. Chairman.
The gentleman yields. The chair recognizes the gentleman from California, Dr. Ruiz.
Thank you. The question here is whether or not this committee will provide oversight on the effects cutting federal funding on coverage and access to long-term care for seniors and people with disabilities. We know that the drastic changes to Medicaid will result in cuts to the program. We know that it's going to affect the American people in drastic ways. So what's the opposition? Why will you vote no? And why not look into the eyes of people whose lives will be hurt due to these cuts to Medicaid? So I took the opportunity and asked around, and let me tell you a couple stories. One is a text I received from a dear friend of mine who also is my staffer, who says that my 30-year-old brother has developmental disorders and is currently in the care of a state hospital in Wisconsin. He is on Medicaid. He no longer needs the level of institutional care at the hospital, but they can't release him without a place to go. He was supposed to be put in an assisted apartment situation soon, an apartment where there would be 24/7 assistance, someone to come by and make sure he takes his pills and cleans him, etc. However, because of the threats of Medicaid cuts, the state is pulling back Medicaid home and community-based services already. So my brother just lost that housing care opportunity. Now he will have to stay institutionalized, which costs the state more money than the HCBS programs until they can find some other alternative. Here's another email from John in Bermuda Dunes who said, I'm an HIV patient on the medication Victory. It is paid for by copay relief, which is federally funded. I cannot afford it and will not survive without it. It is in the thousands of dollars a year. And my parents are in assisted living in New York, which is paid for by Medicaid. Without it, they literally have nowhere to go. And I'll read this just because it's pertinent in the general scheme of what Trump is doing to our workforce. He continues saying that my niece and her husband are federal employees who have recently received resignation letters. One is employed by the Homeland Security. The other is a patent attorney, and they will be left without a source of income. They have been federally employed since graduate school, for which they still have student loans. They have 4 children. These are real impacts by these actions that are being done with complete disregard to the human story behind them. There are people who are suffering and will suffer with these Medicaid cuts. The face of these failed policies or these attempts to rip away healthcare insurance, and the patients are not smiling. They are unhappy and they are concerned. With that, I yield back.
The gentleman yields. The chair recognizes the gentleman from Georgia, Mr. Carter.
Thank you, Mr. Chairman. Move to strike the last word. To my friends on the other side of the aisle, we share a bipartisan interest. We share a bipartisan interest in making sure that Medicaid can provide care for our nation's most vulnerable, including ensuring that it can continue to provide long-term care for our nation's seniors and people with disabilities. I hate to be redundant, but as I told you, I was a consultant pharmacist in nursing homes, so I hung out in nursing homes all week long and on weekends, saw it firsthand. What this amendment fails to acknowledge, however, is the devastating impacts that the Biden administration did to long-term care access in just 4 years. In just 4 years. The nursing home staffing ratio rule is the single biggest threat to our nation's long-term care system. Over 80% of nursing homes cannot comply with the rule and are at risk of closing. Now, you want to talk about quality of care? What about no care whatsoever? If 80% of the nursing homes close, then we have no care whatsoever. The access rule would require sizable pass-through payments for long-term care providers that are in theory good but are untenable for states to pay out. States like California and New York, as well as disability rights groups like the ARC wrote, strong opposition against this rule out of fear that it would gut home and community-based long-term care. New York and California, blue states, both of them, they wrote letters in strong opposition against this rule out of fear that it would gut home and community-based long-term care. What's more is that the Biden administration saddled the states with hundreds of billions of dollars in new Medicaid regulations that will threaten access to home and community-based services in long-term care. To me, this amendment is redundant. It's redundant because the oversight plan already calls out the waste and abuse of the last 4 years and the harm that it is bringing to the Medicaid program. Real cuts to long-term care are already happening as we speak. Because of the Biden administration, and our first goal needs to be to reverse that course. Mr. Chairman, I yield back.
The gentleman yields. Is there any additional discussion on the amendment? Ms. Barragan from California.
Thank you, Mr. Chairman. My colleagues want to talk about what the last administration did. Yeah, my colleagues today, in a few hours, House Republicans are going to vote on a budget that's going to betray the American people by taking away health care from hardworking families while giving more than $4 trillion in tax breaks to billionaire donors and corporations. What does that mean? That means that there needs to be at least $880 billion in cuts to Medicaid. What does that mean? That means long-term care is at risk. Nursing homes is at risk. That is the vote that my colleagues are going to take tonight. And when they vote yes for the budget on the resolution, they're voting to cut Medicaid, and they are voting to cut long-term care and investments in nursing homes. This amendment is merely a study to say, let's look at what the effects are of cutting federal Medicaid funding. And what is it going to do to long-term care for seniors and people with disabilities? That's what this is. And my colleagues across the aisle say, we don't even want to look at this. We don't want to know about this. Let me shed some light on why that might be. I don't know. Let's see. Representative Bilirakis in Florida's 12th district, 16% of his district are seniors with Medicaid who may rely on just this, long-term nursing care, in-home care. Representative Carter, 13% of his district are just seniors with Medicaid. This is not even talking about children or people with disabilities. Representative Kamek, hers is higher. It's at 16% in Florida's 3rd district. Representative Evans in Colorado, 7% of his district is seniors with Medicaid. 49% are children with Medicaid. They have CHIP and rely on CHIP. So I tell the American people, look to see what your representatives are doing. Are they fighting to invest in nursing home care? Are they fighting to keep and fight back against the cuts to in-home care and long-term care? So I implore people watching today, especially those percentages, to see the vote, not just on this amendment, on whether they stand for or against even looking what Medicaid cuts will do to long-term care, but that vote they're going to take this evening. Whether they're voting to cut Medicaid, which is cutting investments in long-term care and nursing care. What you hear otherwise is all smoke and mirrors. What you hear otherwise is all smoke and mirrors. With that, I yield back.
With the gentleman.
I will yield to Ms. Dingle.
Thank you. I would just like to take this last minute to, with respect for my colleagues, object to the fact that improving quality care in nursing homes is the worst thing that ever happened to nursing homes. Long-term care is in crisis in this country, but it's in crisis because, one, we can't find caregivers. We don't invest in caregivers. We don't pay them a decent wage or give them benefits, so these homes can't find caregivers. And two, many of these long-term care homes are owned by billionaires who are trying to make money and don't want to invest in quality health care for those that are in these institutions. And I find it offensive to say investing in quality long-term care for our seniors, making sure that they're getting the kind of attention that they need, is one of the worst things that ever happened. I think our seniors deserve quality health care with enough caregivers to make sure they're getting the kind of care they need. And if we were to look at home-based community care, which we've been trying to do in this committee for a while, we would be able to lessen the cost and improve the care of our seniors. And quality care and investing in caregivers is not the worst thing we can do for our seniors. Providing them quality care and not making the billionaires money is what I think we should be investing in and looking at. And I yield back.
Thank you, Debbie Dingle. I just want to say, I think we should all stand with seniors and investments in care, not with the billionaires and the corporations. I yield back.
Gentlelady yields. The chair recognizes the gentlelady from New York.
Thank you, Mr. Chairman. I heard the point made earlier that the concern here is around the sustainability of Medicaid, that Medicaid is getting too expensive. We cannot sustain this level of output. And so therefore, we are going to not, what is the term? They're not trying to say cuts, so they're saying lower caps on spending. But that's the argument, right? But if that were true, then one would think that the so-called cost savings from certain wasteful cuts would be reinvested in Medicaid. However, that is not what the committee is proposing. They are proposing that we have cuts to these essential programs in order to pay for Elon Musk's tax breaks. The order has come down to this committee. Find $880 billion. Find it for what? To pay for a tax cut bill that benefits tax cuts on yachts and private jets and billionaires and mega corporations, while secretaries and working class people pay higher effective tax rates than Facebook does. Undocumented immigrants in this country pay more in taxes than many large corporations do. And so the argument here that these cuts need to be for the sustainability of Medicaid doesn't really make sense when you realize that these cuts are being just moved to justify expenditures and deficit spending in another area. This is about how we funnel money away from the working class and towards the rich. And if we genuinely care about the sustainability of Medicaid, my question would be, what is the plan to do that? Where are the reinvestments in these quote-unquote cost savings going to? Because it's certainly not going into reinvestments in care. With that, I yield back.
The gentlelady yields. The chair recognizes the gentlelady from Virginia, Ms. McClellan.
Thank you. I move to strike the last word. I've heard twice now my colleagues on the other side of the aisle say that part of the reason for increases in costs for long-term care are the staffing ratio requirements. Let's talk about why the staffing ratio requirements were put in place. It was to improve the quality of life of residents in long-term care, to provide necessary assistance with their daily living activities, their medical needs, and overall well-being. What does that mean? Have you ever had a parent in long-term care and you come to visit them and they're lying in their own feces because no one has come to help them go to the bathroom, because the facility that they're in doesn't have enough providers or workforce? Have you ever had a parent, you come to visit them, and their hip is broken because they fell out of bed and they laid on the floor because no one was able to pick them up? Have you had a parent in long-term care who you watch their mental health decline because of how agitated they get when they need help brushing their teeth? They can't get somebody to come in? I have. I was really proud to be on the Science, Space, and Technology Committee because every day in a hearing I would see a portrait of Eddie Bernice Johnson, a hero to me. Eddie Bernice Johnson died of an infection from complications from back surgery when she was left to lay in her own feces. So part of the point of a healthcare system that cares for our seniors is not just making sure they get the basic care they need, but that it's quality care. And when we get to the point where we can't take care of our own family members anymore, in some cases, family members who took care of other family members or other people, or in my mother's and sister's case, cared for other people long-term for Jim Crow wages, or their grandparents who did it for free under the institution of slavery. Let's talk about the real reasons for the increase in cost of care, because we recognize care workers deserve higher wages, including those that are funded through Medicaid, because we recognize we need more of them to care for the boomers who are not aging, they're aged. I'm 52, I'm Gen X. Let's talk about the real reasons for the cost and not just sit back and say we're going to have this blanket demonization of something we disagree with without actually going in and talking to the patients and their family members that benefit from the new rules. I yield back.
Gentlelady yields. Is there any additional discussion on the amendment? Seeing none, there's a call for a roll call vote. The clerk will call the roll.
Mr. Latta? Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? No. Mr. Griffith votes no. Mr. Bilirakis? No. Mr. Bilirakis votes no. Mr. Hudson?
No.
Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Allen votes no. Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller Meeks. Mrs. Miller Meeks votes no. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mr. Fry. Ms. Lee. Mr. Langworthy. Mr. Kane. Mr. Rulli. Mr. Rulli votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Strakowski. Ms. Strakowski votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Chairman Joyce, on that vote, there were 22 ayes and 23 noes.
The amendment is not agreed to. Are there any further amendments?
Yes, I have an amendment at the desk.
The clerk will report the amendment.
Mr.
The
Chairman,
amendment is CDT-6. Oh, CMT, okay.
amendment to draft oversight plan CMT 6, including the Consumer Financial Protection Bureau in the committee's
Without
oversight.
objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Well, thank you, Mr. Chairman, and I will get to the Consumer Product Safety Commission, but I want to start with a mention was made of our former president, and I wanted to make a comment about the present president. So Donald Trump promised to all people in the United States that there was going to be this almost magical decrease in costs. We were going to have more people who were going to enjoy all the things of good life because of his leadership. And nothing could have been further from the truth. And as the month now has gone on, I think we see even further what the damages are being done. And we're talking about some of them right now. I talked about 2 women who thought about committing suicide because they thought their Medicaid was going to be gone. And so they wouldn't be able to live the life they have, and they wanted to just give it up. And now we're in a situation where we want to make sure that the basics in life are, and that we shouldn't have competition with the wealthiest people on earth right now, with the people who are among the poorer people in our country who need basic health care. I also just want to point out, we have never talked about health care as in other countries around the world, in domestic countries that have their own health care systems. But we, and along with private equity, has gotten very involved in the money version of making sure we have the health care that we need. But we also talked a lot about the Consumer Financial Protection Agency, and I wanted to just say this. We have an agency that is looking out for our safety, to make sure that we're not being ripped off, that senior citizens are going to be able to get the money that they need and deserve, that our veterans are going to have the money and benefits that they should have. We had someone on the lookout to make sure that we are protected. And guess what? Now, no one is working at the Consumer Financial Agency. Why? Because they were told not to go to work again. So nobody is watching out for all the people who need some protection and have been provided by a wonderful organization that has helped make sure that the money, all the evidence that people should have has come, because we had this agency that was assigned to that, to make sure that we're safe. And so now we don't have that kind of protection anymore, and I would suggest, since it has not been made totally official, that we need to continue to fight all the way to make sure that this agency is going to be back, making sure that Americans are not going to get stiffed, they're not going to get cheated, that our seniors are going to be able to be protected. And with that, I yield.
Gentlelady yields. Any Republican? Recognize the gentleman from Florida, Mr. Bilirakis.
Mr. Chairman, I move to strike the last word.
Oh, you're recognized.
Mr. Chairman, I don't believe the Consumer Financial Protection Bureau falls within the committee's jurisdiction, and therefore I do not believe it is appropriate to include this in the oversight plan. I'll be happy to discuss this particular issue because we want to protect our seniors, most of all, with the gentlelady, but it should not be in this oversight plan, as I said, for the purposes I said before. It is not part of our committee's jurisdiction. Thank you. I yield back.
Gentleman yields back. Now recognize the gentleman from New Jersey, Mr. Pallone, ranking member of the full committee, for his 5 minutes.
Thank you, Mr. Chairman. And I do want to assure Mr. Bilirakis that the Consumer Financial Protection Bureau is within our jurisdiction. Many aspects of what they do directly relates to the Energy and Commerce Committee. And I mention that in particular because I wanted to thank Ms. Schakowsky. Earlier this month, the author of Project 2025 sent an email to everyone who works at the CFPB headquarters, which is directly across from the White House, across from the executive mansion. And that email told the people that work there not to come into the office and to stop working. Now, for that reason, myself and Ms. Schakowsky went down. There was a protest. A lot of the people that worked there, you know, because they were essentially closed out of their offices, they closed the building, stepped outside and organized a protest against the fact that the building was closed and that they were told to go home. And so Jan and I specifically went down there because we were essentially representing the Energy and Commerce Committee and saying that we strongly oppose the closure and the stop work order. And, we were also happy because we felt there were so many people there that it was clear that, whoever was in the Oval Office that day or was in the Executive Mansion clearly heard us because we were screaming very loudly, and I have no doubt that they heard our protests. Now, I'm not, everything that Jan said is true, and I just want to run through this because it does show you what our jurisdiction was and how it encompasses this agency. The Consumer Financial Protection Bureau was established in the wake of the 2008 financial crisis to put an end to the predatory behaviors that led to the recession and resulted in millions of people losing their homes in the wave of mass foreclosures. So it stands up against predatory lenders like payday lenders that exploit Americans and often force them into financial debt. It has returned more than $21 billion to American consumers since the agency was established. In my home state of New Jersey, more than 100,000 New Jerseyans filed a complaint with the CFPB last year. Consumers save an estimated $5 billion per year thanks to the CFPB's bank overdraft rule, which the Trump administration could prevent from taking effect. The CFPB is working to remove medical debt from millions of Americans' credit reports, which could be reversed if the Trump administration gets its way. Essentially, what the Trump administration is doing here is taking the cop off the beat when it comes to the work that this organization does for American consumers. It's directly under our Consumer Affairs, our Consumer Protection Committee, which, as you know, Ms. Schakowsky is the ranking member of the subcommittee. So without the CFPB, banks and bad actors can return to these practices that destroyed our economy, eliminating thousands of jobs, ruining people's lives. I mean, it's really outrageous. And the reason we need to have this amendment is because we don't know what's going on down there. I don't believe they ever reopened the office. My understanding is that they may have some people working at regional offices. They may not. More than anything else and I'm not trying to take away from the other amendments today, but the fact of the matter is, the reason we need this hearing and oversight is because I think that more than any other agency that we've discussed today, no one knows what's going on down there. We don't know whether they're open, whether they're closed, how many people work there, whether whether they're able to do anything anymore. So this is directly something that should be in our oversight plan, particularly since there's so much secrecy about what the administration is doing with this very important agency. I yield back, Mr. Chairman.
Gentleman yields back. Do I have anyone who wishes recognition on this side? Going to this side. Anybody wish to be recognized? Seeing none, we'll move to the vote. Okay, the roll call vote has been requested. Oh, sorry, I did not see you. I apologize. Mr. Menendez of New Jersey.
Thank you, and
Ask for
I
5 minutes.
appreciate my colleague for bringing this amendment up for discussion and the critical importance that the CFPB has played since the 2008 financial crisis to ensure that we are protecting the folks in our districts across the country, making sure that those who are predatory lenders are not taking advantage of good Americans. And we had a great American who led this, Rohit Chopra, for so many years, a great New Jerseyan, until he was let go by this administration. And the president has said in the Oval Office that his intention is to shutter this department. So, we need to continue to be mindful of how Americans are being impacted by the decisions of this administration, making sure that if we truly are looking as a general matter to have oversight over fraud, waste, and abuse, we had an agency like CFPB that was set up to do this exact thing, and we should ensure that we do whatever we can to advance this mission and push back against the administration's attempt to shutter it. With that, I yield back.
Janet yields back. Anyone else seeking recognition? Going. Seeing none, a roll call vote has been requested. Would ask the clerk to call the roll.
Mr. Latta? Mr. Latta? Mr. Griffith?
No.
Mr. Griffith votes no. Mr. Bilirakis?
No.
Mr. Bilirakis votes no. Mr. Hudson?
No.
Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Crenshaw? Mr. Joyce? Mr. Joyce? Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Allen votes no. Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller Meeks? Mrs. Miller Meeks votes no. Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte? Mr. James? Mr. James? Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin? Mr. Fry? Ms. Lee? Mr. Langworthy? Mr. Kane? Mr. Rulli? Mr. Rulli votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Strakowski? Ms. Strakowski votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko? Mr. Tonko votes aye. Ms. Clark? Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Dingle? Mrs. Dingle votes aye. Mr. Vesey? Mr. Vesey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Bedegan? Ms. Bedegan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Mr. Han? Mr. Han votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no. Mr. Latta is not recorded. Mr. Latta votes no. Mr. Joyce is not recorded. Mr. Joyce votes no. Mr. Obernolte votes no. Chairman Guthrie, on that vote, there were 22 ayes and 23 noes.
I have an amendment at the desk, Mr. Chair.
What number of the amendment?
012.
Without,
Mr.
clerk
Chairman,
or report? Oh,
could the gentleman from New York please specify his amendment?
you want again, once again, say your amendment?
012.
Amendment to draft oversight plan, OI2.
Without objection, the reading of the amendment is dispensed with, and the gentleman from New York is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chair. Today, the need for scientific integrity has never been more urgent, especially in public health and environmental protection. For generations, federal science has driven progress in medicine, in climate research, and in pollution reduction. Agencies like the CDC, the NIH, and EPA rely on independent research to safeguard public health and ensure environmental safety. But that integrity is under attack. The Trump administration and now Elon Musk and his band of muskrats pose a direct threat to America's scientific leadership. They are censoring research, scrubbing critical data, and undermining career scientists who dedicate their lives to protecting public health and national security. Congress cannot sit idly by while these violations go unchecked. We have a duty to defend our nation's research institutions and provide rigorous oversight. This administration has made its position clear. They do not care about scientific integrity. They do not care about saving American lives from the escalating climate crisis. They do not care about public health and protecting families from deadly viruses like COVID-19 or the emerging bird flu threat. The knowledge we carry forward is essential to our survival, yet its validity is being questioned on a scale unprecedented in modern history. Now, research projects vital to public health, economic prosperity, and national security are being evaluated not for their scientific merit, but whether they contain words like diversity, women, or underrepresented. The United States has long been a beacon of research excellence because we uphold principles that transcend politics. But those principles are now under attack. In my district alone, institutions like SUNY Albany, Albany Medical College, RPI, the Wadsworth Center, and Albany Molecular are leading groundbreaking biomedical research work that relies on consistent support from agencies like the NIH. I've heard directly from researchers at these institutions, from infectious disease experts to national security professionals who are grappling with stalled program reviews, frozen funding, and an uncertain future for their critical work. These challenges are not abstract. They are direct threats to our nation's scientific enterprise and to the progress, the security, and the well-being of the American people. Scientists should be focused on their next breakthrough, not scrambling for funding or fighting to defend their right to pursue knowledge free from political interference. Instead, confusion, delays, and outright fear are gripping our research institutions. We cannot allow political ideology to dictate which discoveries are pursued and which are suppressed. We cannot allow critical research on climate change, public health, or national security to be derailed by short-sighted political mandates. And we cannot allow the United States to fall behind while our competitors capitalize on our self-inflicted setbacks. The next great discovery, the next cure, the next technological revolution could come from any lab, any researcher, any corner of this country, but only if we let science be science. I urge my colleagues to support this amendment, to uphold scientific integrity and ensure that facts, not politics, shape our future. And with that, Mr. Chair, I yield back.
The gentleman yields back. What purpose does the gentleman from West Virginia seek?
Speaking in
recognition?
opposition to the amendment, Mr.
Gentleman
Chairman.
is recognized.
Thank you, Mr. Chairman. This amendment is woefully unnecessary as the oversight plan contains oversight of the federal agencies within the committee's jurisdictions that are responsible for public health, environmental protection, energy security, technology, and consumer protection. It is already an expectation of scientific integrity existing within these agencies, and the oversight conducted by this committee, as outlined in this oversight plan, is sufficient to ensure this. Furthermore, there is no factual basis to claim that there is political interference at this time stopping scientists and researchers in federal agencies or grantee institutions from conducting their important work. The amendment is unnecessary, and some of the predicate for it lacks a factual basis, and I urge my colleagues to vote no on the amendment. Now, you may have noticed that I emphasized "at this time," because I got to tell you, Mr. Chairman, I was flabbergasted at the fact that in the last administration, it did appear that there was political chicanery going on with some of our scientific institutions. Now, I'm not saying the president knew about it, but the administration either knew or should have known what was going on. I mean, all I got to do is tell you I spent a lot of time investigating with the Oversight and Investigation Subcommittee the workings at the NIH in relationship to their lack of oversight and their perhaps actual meddling in determining the origins of the COVID-19 virus. And that continued. It started in one administration and in the Republican administration and continued over into the Biden administration. So I feel very strongly that we will do this whether we adopt this amendment or not, because that's within the jurisdiction. And I'm going to point out something now, Mr. Chairman, that has vexed me all day. And that is that we keep doing these amendments to specific points of concern for individual members. That's not the purpose of an oversight general plan. What you've drawn up, Mr. Chairman, is very similar to what we've done in the past. And it's saying that we're going to look into these areas, we're going to take care of these areas. And here's the problem, I think, from a legalistic standpoint. And yeah, I'm a recovering attorney, and so maybe I'm the only one in the room that's feeling this way. If you cite A out of an alphabet of 26 letters in a specific vote and you say this is what we're going to do, you are implying that the other 25 letters don't matter. There is no way we're going to get to everything today or tomorrow. We could spend 6 weeks in this room going over every little thing that this committee might want to investigate and arguing about whether or not that should be on the list. If that's where we want to go, then we can forget getting any work done, because we'll spend the next month and a half working on exactly what each subcommittee is going to research and look into and have oversight over.
Will the gentleman yield?
I'm not going to yield. I'm on a rant, and I want to finish it. And it just bothers me that we're wasting a lot of time that we could be working on other things, getting ourselves prepared for the hearings. We got hearings tomorrow. We got hearings coming up next week. We could be getting prepared for that to do the very things that some of the members on the other side of the aisle want us to do and taking a look at it. And I'm surprised because I'm looking at all the environment, and I've got 2 more to read. I haven't seen anything on neonicotinoids. Well, I'm concerned about that. Maybe I should be doing an amendment, because we need to talk about every single thing tonight instead of moving forward and getting our work done with a very good, solid product, which is our plan that the chairman has put together. So now that I've finished my rant, I will yield back.
Gentleman yields back. The chair recognizes the ranking member for 5 minutes for the amendment.
I don't mind your being on your rant, but I just want to say this, and I'll be brief. It wouldn't be necessary to do these amendments if there was some reason to believe that the majority was willing to stand up and do any real investigation, whether it be by hearing or by letter or by subpoena or whatever, of what's happening with the chaos of the Trump administration and Elon Musk. You know, if you noticed, over and over again, members on the Democratic side have said, you guys have been silent. And many times you've admitted that you've been silent on a lot of these issues. So really, that's the problem here. You have an oversight plan that's almost exactly what it was 2 years ago. 2 years ago is a totally different situation. In the last month, we've seen across-the-board cuts, firing of thousands of people. I just mentioned the Consumer Finance Agency, which literally the door was closed and everybody was sent home. I mean, none of these things make any sense from a rational point of view. And I'm not saying that the president doesn't know what he's doing, but sometimes I do wonder, and I certainly don't think that Musk knows what he's doing. And all we're asking is that there be some indication somewhere by somebody on the Republican side that you understand that all these firings and freezes, and half of them have been turned around in the courts. But even then, you know, I have to tell you, in my home state of New Jersey, because Jen McClellan mentioned this, you know, they had, when the freeze was on, they were told, the portal was closed for my community health centers to get paid for Medicaid or anything, right? Next day, the freeze is lifted by the courts, but some of them are still not able to get the funding because the portal's closed. Now, somebody's gonna say, oh, that's because the portal's broken. Well, I don't believe that. They're definitely getting around a lot of these things, even when the courts have ordered them to do the right thing. So we're just asking, we have no reason to believe that whether it's a cuts to nursing home and freeze, or it's consumer finance aid, or whatever it is, that any hearings ever going to be held, or any letters ever going to be sent saying, Doge, Musk, what are you doing? Are you going to continue with this chaos, across-the-board cuts that have no rationale? We've sent letters to these various agencies and to Musk and the president. They don't respond to us in any way. They don't give any reason. Oh, waste, fraud, and abuse. That's all they keep saying over and over again. Well, show us where the waste, fraud, and abuse is. They don't respond to anything. So you have to understand, and you have to understand that the reason that we're going through this list is because you have an oversight plan that doesn't seem to recognize in any way what's been going on the last month with this administration. And it's unprecedented. Now, some of you may say, oh, well, that's great, they're wrecking everything and changing everything, and, everybody stinks in the federal government, so let's just get rid of them all. But I mean, you're not going to say that because you don't believe that. But all we're saying is, give us some indication here that you're going to address some of this behavior that seems to us to make no sense whatsoever. And it's killing the economy. You can't keep freezing all the funding, having tariffs, firing everybody, creating all this chaos. The stock market, not that I'm not going to favor the stock market, but the market goes up and down every day. There's all this instability out there that I think is going to lead to an economic downturn. And so we're just saying, with this oversight plan, we've got to address these issues. We've got to bring them to your attention. We're not getting any response at all. So that's it. I don't know what else to tell you. I yield back, Mr. Chairman.
Ranking member yields back. Anyone seeking recognition? Gentlelady from Washington. You're recognized for 5 minutes.
Thank you, Mr. Chairman. Well, I moved to strike the last word, and thank you, Mr. Chairman. I want to support this amendment. The idea has been tossed around by my Republican colleagues that there's no need for this amendment to make sure that we protect scientific integrity. You better believe there's a need. I mean, look at what we have seen over the past several years. We've seen anti-mask information. We've just seen a confirmation of vaccine denier and skeptic RFK Jr. put in charge of Health and Human Services. He's also questioning FDA decisions and just pulling ideas out of his pocket and throwing them out there, even though he's in charge of Health and Human Services. We've seen firings at the NIH, cutting funding to the NIH, attacks on universities as being elitist, even though that is where our scientists, the best in the world, are trained. We're even seeing cuts to the Department of Education. Where do you think our kids are going to get educated in terms of science? And it feels like there's this, like a purposeful attempt to dumb down our population by attacking science, undermining science, misinterpreting studies, throwing conspiracy theories out there. And so I just want to emphasize that we do need this amendment, that it is important, that there seems to be an attack on science and a misunderstanding of science, and definitely a politicization of science, especially when you see the anti-vax sentiment aligning very much along partisan lines. And so I'd like to encourage my colleagues to support this very necessary, unfortunately very necessary amendment. Thank you. I yield back.
Gentlelady yields back. Mr. Obernolte from California, you're recognized for 5 minutes.
Thank you very much, Mr. Chairman. And I have to admit a little bit of frustration here. Scientific integrity is something that I deeply value, I've served on the Science, Space, and Technology the last 4 years. It's something we always strive for. We don't want research to be tainted by political interference. I don't think anybody does on either side of the aisle. One of the things that I like best about serving on SST is that we are largely a bipartisan committee, and we work on things that are mutually important to everybody on the dais. And it's very seldom that we have partisanism rise to the level where it's actually interrupting the committee business. And I've really enjoyed serving on Energy and Commerce, and I felt the same way about this committee until just recently. And so it's frustrating to be having this discussion. And I want to remind people, because I have a feeling that people think the sky is falling here. And, we have been here before, and we're going to get through it. In terms of the cuts that have been made recently, let me remind everyone that the last time we had a balanced budget was under a Democratic president and a Republican Congress. It was under President Clinton. And when he first came into office, his first week in office, he issued an executive order that said he was going to cut 4% of the federal workforce. And he did it. He did more than that. He cut hundreds of thousands of federal workers. It was very controversial, and people didn't like it. But folks, that's what was required to balance the federal budget. And we have had presidents in the past who pushed the limits of constitutional law. In fact, the most recent one we had was Barack Obama, who got frustrated with the fact that Congress wasn't doing what he wanted them to do. And he said, literally, "So sue me." Those were his exact words. And people did, and the courts did what the courts are supposed to do and sorted out what was legal and what was extra legal, and brought the administration to heel. And we're seeing that play out in the courts right now. So we will get through this. But folks, I'm concerned that we are losing our ability to have a civil discussion with each other. I really value the opinions of my colleagues on both sides of the aisle. I think we're here for the same reasons. I think we all play for not Team Republican or Team Democrat, but Team United States. And, it really hurts my heart to see this kind of partisanism, because remind you, this is what should have been a procedural vote to approve our oversight plan. That's it. And it was largely the plan as it has been under both Republican and Democrat control for years here in this committee. So the fact that we have all chosen to spend our time here all day on this procedural vote, not accomplishing the business, the important business that this committee has to accomplish, I think is really nonsensical. So I hope that we can, at the end of the day here, remember that we're supposed to play for the same team. So I apologize for, my rant, but it's really been painful to watch. I yield back, Mr. Chairman.
The gentleman from California yields back. The chair recognizes the gentleman from Ohio. And
Thank you, Mr. Chair. I just want to respond, because this is the vote. The last time we had a balanced budget was 1993. The budget was the 1993 omnibus budget bill. And it was President Clinton. He just got elected. And instead of ransacking the federal government, getting one of his donors to take a chainsaw to the federal bureaucracy, indiscriminately laying off public employees, accessing public data, breaching the Treasury payment system, he went to the United States Congress, and it was a Democratic Congress. They lost in 1994, but it was a Democratic Congress. So the last time we had a balanced budget, it was a Democratic president and a Democratic Congress that passed a budget bill. And so instead of doing all the crazy things that have happened over the last 5 or 6 weeks, truly problematic behavior, he went and did the hard work by negotiating with the United States Congress, which is what you're supposed to do. That budget led not only to a balanced budget, but to several surpluses and the largest economic expansion in American history. So why doesn't the president do that? Why doesn't the president come to the United States Congress and work with us to pass a budget that doesn't increase our deficit, that doesn't cut nearly $1 trillion in health care from people? And if there's waste, fraud, and abuse, bring it to the United States Congress. That's not what they're doing. And the reason why we're here offering these amendments is because people are frustrated and angry and scared And they are looking at a Republican-controlled Congress doing absolutely nothing to stop the mayhem that's going on. And the show of good faith could have been just support the amendments. These are pretty simple amendments that say we are going to start asking questions. We are going to push and prod and hold people accountable. But that's not what we're doing. So I wanted to be on this committee for the same reasons that you talked about, which is this bipartisan problem-solving aspect of this committee. We are living in a different moment. And the sooner that my colleagues on the other side of the aisle get that and stand up to at least Musk, then we can go back to something resembling normalcy. But until then, this is going to be problematic because we have to do something. With that, I yield back.
Gentleman yields back. Is anyone from the Republican side? Seeing none. Gentleman from New Jersey is recognized for 5 minutes.
Thank you, Chairman. I appreciate my colleague, Congressman Tonko, for introducing this amendment. And we hear across the aisle that our Republican colleagues keep saying, we've been here before, right? That this is just a procedural committee hearing with regard to what we've done in the past. But if you don't realize we're in very different times right now, then I don't know what to tell you, and you're clearly not talking to your constituents. We have a secretary of HHS who openly engages in public health conspiracy theories. The second most important scientific mind in the administration or outside the administration is Joe Rogan, right? Like, these are not normal times, and for you all to sit there and pretend like it is, and this should just be a procedural day, you're missing the moment. We really need to ensure scientific integrity throughout our departments and agencies, because that is what this moment calls for. We need to protect scientific integrity at federal agencies that are responsible for our public health, because the president is entrusting people who have worms in their head, right? That is not a place that we should be going. That is not someone that we should trust. And if that's who the president chooses to trust, then we need to ensure that we do our oversight obligation here to ensure that all of our departments, all of our agencies can engage in their business with the utmost scientific integrity. And with that, I yield back.
The gentleman yields back. Dr. Joyce is recognized for 5 minutes. Gentleman from Pennsylvania is recognized for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. For years, Democrats sat silently as, quote, the science was weaponized against Americans. So many of us in this room are trained in science, but it should have never been used as a weapon. We were told that a vaccine would prevent individuals from ever getting COVID. We were sold a bill of goods. Dr. Fauci and Dr. Collins, then both government employees, orchestrated a brutal takedown of theory. A theory that, I'll note, is widely accepted as likely, that the COVID-19 pandemic originated from a lab leak in Wuhan, China. Subsequently, a congressional investigation into this topic turned up documents of NIH employees discussing, laughing about stonewalling and obstructing this very committee. This investigation also uncovered efforts to delete government records. Remember the FOIA lady? This committee has fought for years to restore accountability in our scientific agencies. This is not a time that we would ever want to turn a blind eye, and yet a blind eye was turned. So let's spare the crocodile tears. Let's talk about what truly is scientific integrity. This oversight plan, as written, already provides us the broad discretion to conduct oversight into our health agency. And this amendment is unnecessary. Thank you, Mr. Chairman, and I yield.
Gentleman yields
Mr.
back.
Joyce, will you yield for a minute?
Would gentleman yield to the lady from California?
I just have a quick question, and this is a genuine question. Do you believe that the COVID vaccine had any benefit to it?
Benefit.
I feel that the information that was presented to us fractured the trust that my patients have in government, because we were told that the COVID vaccine allowed individuals not to get COVID. And so many of us locked into that. And it was a mistruth. It was not what we saw, because individuals who did get the COVID vaccine went on to develop COVID. And that fractured the doctor-patient relationship. And that fractured the ability for us who serve on energy and commerce to take
that gentleman
information
yield?
back to our district.
Do you think that it saved any lives or no? I'm just
sorry?
curious. So do you think it saved any lives? Because I know you got the jab. Do you think it saved any lives?
I think that a mandate for any vaccine.
That's not what I'm
Ms.
asking.
Merrigan,
I'm just
I feel that
asking if
any
you think it
mandate
saves
for
any
any
lives.
vaccine is unnecessary. I think that's a decision that should be made between the patient and the doctor with truths from science.
I don't
And if you
disagree
don't
with
have
you on
that truth
that.
from science, this is my time. I'm reclaiming my time. If you don't have that truth in science, if you don't have that ability to know that what is coming out of the NIH is true, then you don't provide physicians the ability to give that information to their patients. And as I travel into my district, which I do all the time, every weekend in every district work period, I've heard from constituents that they don't trust science, that they don't trust the NIH, and we now have adequate oversight to, again, to do the necessary intelligent investigations in our health agency. And this specific amendment is unnecessary. Thank you, Mr. Chairman, and I yield.
Gentleman yields back. Anyone on the, that's right, we just a Republican, so Ms. Barragan, you want, the gentlelady from California is recognized for 5 minutes.
Yeah, I wasn't going to speak, but I'm just going to expand on the conversation because, you know, the comment that was made was almost to insinuate that the vaccine was this terrible thing, when in reality, it saved lives. Now, whether it prevented people from getting COVID again is an argument we could have, but it did save lives. And God knows it's much better than the advice the president gave was to go inject bleach into yourself. So you talk about the trust and the mistrust? Excuse me? You got the president who is supposed to be a leader, who's a clown, asking people, telling people to inject bleach, putting people into harm's way. I will strike the clown comment. We know we've seen the memes, okay? We don't even have to say it. The fact that nobody calls it out, the fact that people don't recognize the circus that we're in, they don't want to admit it in the room, is pretty hilarious. It's pretty comical. And I will also say that my colleagues across the aisle have called the former president worse things. Okay? So all of a sudden, you got decorum. Oh my gosh. You've seen the light. But you know, this is really hypocritical because you come in here and you want to go attack the COVID vaccine when it saved lives, and you yourself got it too, by the way. Nobody's suggesting that it's not a decision a doctor could make with their patients. For God's sakes, we talk about that with women's right to choose. And you won't see it the same way when it comes to that. So with that said, I'm going to yield time to my colleague, Mr. Ruiz.
Yeah, I think what we just witnessed here is a clear example of how the manufacturing of distrust happens, where you have a physician who talks about something erroneously that occurred, takes it out of context, misrepresents those words, and then determines it's as facts and goes around the constituents and to the American people and distilling that misinformation as fact. So for example, at that time, and I know what you're referring to when President Biden said that if you get it, you won't get sick. At that time, the studies showed that it was very protective against COVID-19. That virus evolved and changed. Now, you know, I know as physicians that a vaccine helps boost your immune response to a virus. And that once you reach a threshold of that viral load into a body, you become symptomatic, and for some, very symptomatic in the ICU, and some people die. You also know that if you boost your immune system enough, then you will prevent from getting sick. You will not get symptoms. You will defeat the virus that's in your body before it manifests as a symptom. And yes, it will prevent, in some cases, getting sick. But the point of the vaccine, and it still is to help you not die, to help you not go to the ICU, and for many to help prevent getting sick, period. Now, that is the logical, reasonable explanation that you and others can clearly give to the public, but instead you focus on this misinterpretation under the false premise and the context of what was said at that one time, but you are hoping, and it has been explained over and over again, but they refuse to acknowledge that and go back and focus on the words that were being said. So as a physician, I want to clear the record and say that this vaccine helps you, and some people prevents them from getting sick, period. And for many people who get sick, even though they're on the vaccine, prevents them from having been more sick or even dying, period. The vaccine is the reason why we're here without wearing masks. That's the reason. But when you continue to sow doubt, then you're manufacturing distrust into our public health leaders and the best tools that we have to protect the public's health. And that's dangerous. That is sowing mistrust into our agencies and our scientists. I yield back to Representative Barragan.
I'll yield back.
The gentlelady yields back. The chair wants to emphasize the gentlelady struck her words and just want to the clown, right? There's a clown. That's what I mean. That's what I mean. And so, so we appreciate you striking your words. I just want to remind the committee of the decorum that we need to abide by in the committee rules. So the chair will now recognize the gentleman from North Carolina.
Thank you, Mr. Chair. I'd like to yield to my colleague from Virginia, Mr. Griffith.
Yeah, I told y'all this might take us 6 weeks at this rate, but here's the problem we have, and that the good doctor was touching on. It's a slightly different point, but we were told, and in fact, our federal government spent millions of dollars, and this committee investigated it without a specific requirement to do so. This committee investigated it, and what we found was they spent millions of dollars telling people that if you got the jab, it would stop the spread. Advertisements to our young people and others that you can go back to school if you get the shot. Advertisements that you can suddenly go back to parties if you get the shot. None of that had any scientific basis in it at the time. There wasn't any evidence then. There isn't any evidence now that it stops the spread. And they suddenly discovered that they made the claim without scientific basis, and then discovered it when there was a big party somewhere in New England. I want to say it was New York, but I might be mistaken. It's been a while since I read the report that our committee and our committee staff came up with. But the bottom line was, we need scientific integrity. We don't need an amendment to tell us to do it. We did it in the last term without a specific amendment to say, let's have scientific scrutiny. We got stonewalled by the past administration. I hope that you all can get your documents. May not be exactly when you want them, but we never got a lot of the documents that we wanted when we were asking for it, trying to do exactly what this amendment says it wants us to do. We already have authority to do that in this broad statement of what we're trying to do. It's a good statement, and we need to quit going into the little nuances and saying, well, you can't do it you might not do it. We've done it in the past and we'll do it again. I don't care who the administration is. If they're spreading things that are not scientifically accurate, we need to put a stop to it because we want scientific accuracy. But don't come in here and say we're misleading people. That's the facts. It never stopped the spread, and there was never any evidence it would stop the spread, but the past administration spent millions of taxpayer dollars telling people you got to get the shot because it's going to stop the spread and you can go back to having parties. And it wasn't ever true. And people got sick because of it, because they went to parties thinking they'd had the shot and they were safe from getting the disease. And I think that's the point that the good gentleman from Pennsylvania previously was trying to make. And I yield back.
I yield back.
Gentleman yields back. Is anyone gentleman from Florida, Mr. Soto, you're recognized for 5 minutes.
Thank you, Chairman, and I appreciate this amazing debate. You know, I was reading a headline today that I never thought I'd see in 2025, Texas measles outbreak. Here's why it's not going away anytime soon. It's also affecting New Mexico. 124 kids getting a disease that hasn't really affected folks for quite a while, mostly unvaccinated. And when we're talking about vaccines like the COVID vaccine, I think the key thing to understand is that it was supposed to prevent substantial injury and death, and that's what it did, right? It didn't stop it in its tracks, but when we think about the death rates between those who got the vaccine and who didn't, they're vastly different. And long COVID is predominantly among folks who didn't get the vaccine. I'm going to need a little help here, Dr. Ruiz. You know, what are some of the symptoms of measles, and do you think that would be worse than getting the vaccine? What's really at risk for these kids and across America who, because of political gain, because people are questioning science at every aspect, what are the consequences for measles?
Thanks, Representative Soto, for the opportunity. But first, let me say that yes, the standard of public health professionals and physicians will say that the COVID-19 vaccines helps reduce the spread of COVID-19. No vaccine is 100%, and this is, again, the manufacturing of distrust, saying that they said it was 100%, it's not 100%, but the big picture here is that, yes, indeed, it reduced the spread of COVID-19. Measles, as we're seeing in the population that are not vaccinated, have a higher rate of getting sick with the illness than those who are vaccinated in getting the side effects. The symptoms could include these small red spots with blue-white centers inside the mouth, hoarseness, swollen lymph nodes, diarrhea, vomiting, and abdominal pain. Can last 7 to 14 days. It starts 7 to 14 days after exposure. And the fever and rash slowly go away after a few days. Now, the seriousness of this, the diarrhea could lead to dehydration. It could lead to a brain infection, infection that causes brain swelling and potential brain damage, and severe breathing problems, including pneumonia.
Thank you, Dr. Ruiz. And I also want to talk to Dr. Schreier. Did you see a lot of measles cases over the last couple of years before an attack on science?
You know, it's really interesting. In the year 2000, measles was declared eradicated from the United States. And then in about 2019, we had really big outbreaks. And I put this really at the feet of RFK Jr. and people like him for spreading doubt, sowing doubt. There have been meta-studies showing its safety. And let me just tell you, I've seen one child with measles, and it at the time, this was in around the year 2001, it took a 75-year-old doctor to diagnose it because none of us really saw it. So just keep in mind, 20% of kids end up in the hospital, and many get brain swelling and die from this incredibly contagious disease.
These are the types of deaths that shouldn't be happening right now in the United States, and the types of conditions that shouldn't be happening anymore in the United States. Yet it's happening because there's political gain to be made when you attack science, which is so hard to do, to get a vaccine together, to get something that works. And it's very easy to attack it for political gain because people are afraid. But what have we seen over many years? A lot of these conditions have been reduced or ended, and now we're seeing them come back. And this is a consequence of the lack of the attacks on scientific integrity that we need to protect here today. And yield back.
Gentleman yields back. Is there anyone on the Republican side, any more on the Democrat side? Seeing none, seeing no further discussion, the vote occurs on the amendment. The gentleman from New Jersey has requested a roll call, a recorded vote, and the clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? No. Mr. Griffith votes no. Mr. Bilirakis? No. Mr. Bilirakis votes no. Mr. Hudson?
No.
Mr. Hudson votes no. Mr. Carter of Georgia? No. Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller Meeks. Mrs. Miller Meeks votes no. Mrs. Kamick. Mrs. Kamick votes no. Mr. Obernolte. Mr. James. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mr. Fry. Mr. Fry. Ms. Lee. Ms. Lee. Mr. Langworthy. Mr. Langworthy. Mr. Kane. Mr. Kane. Mr. Rulli. Mr. Rulli votes no. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mr. Obernolte votes no.
Is anyone seeking to enter the roll? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 23 ayes and 23 noes.
The amendment is not agreed to. Are there further amendments? The gentleman from New Jersey, what purpose do you seek recognition?
23. To offer an amendment, Cat 12.
The clerk will report.
Amendment to draft oversight plan, Cat 12.
Without objection, the reading of the amendment is dispensed with, and the gentleman from New Jersey is recognized for 5 minutes in support of the amendment.
Thank you, Chairman. My amendment would require this committee to conduct oversight of conflicts of interest that involve a government or quasi-government official that has an ownership interest in an FCC licensee. I want to be clear, the situation with Elon Musk is completely unprecedented. Through his role as a special government employee leading Trump's crusade against the federal government, Musk has the authority to oversee government agencies that are supposed to be regulating his businesses and influence FCC decisions that directly impact the profitability of the companies he runs, to the detriment of the American people. Starlink, a subsidiary of SpaceX, has applied for various contracts and licenses through the FCC. It previously applied for almost $900 million through the Rural Digital Opportunity Fund, and in November, the FCC approved SpaceX's request to deploy mobile signal connectivity from space. And it doesn't stop with the FCC. Musk companies routinely engage with the federal government on defense contracts, energy policies, and other matters. SpaceX and Starlink have received approximately $1.7 billion from NASA, $1.3 billion from the Air Force, and $199 million from the Defense Information Systems Agency. Over $3.3 billion in just the past 12 months. Prior to 2019, Tesla benefited from a clean vehicle tax credit that Musk is now calling for an end to, which will reduce competition for his own company. Most recently, Starlink was awarded a contract to upgrade information systems used to manage our airspace. That's not going well. And as companies are not passive participants in government processes, X, formerly known as Twitter, has faced SEC litigation, and SpaceX is suing an independent government agency. The American taxpayers, those who are funding these investments, deserve clarity on where their money is going and who is benefiting. So when it comes to Musk's conflicts of interest related to the FCC, this committee has a duty to conduct oversight on behalf of the American people. I urge my colleagues to support this incredible amendment, and I yield back.
The gentleman yields back. The gentleman from North Carolina, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I thank my colleague for his interest in public integrity. The plan, though, already includes oversight over the FCC. We also maintain jurisdiction over spectrum management as well as wireline and wireless communications. All commissioners and public officials are responsible for upholding the Constitution and following all appropriate laws. Any instances of violation of the law will be subject to our committee's oversight, as well as any appropriate legal remedies. This amendment is unnecessary, and I urge my colleagues to oppose it. With that, I yield back.
Gentleman yields back. Is anyone on the Democrat side? Anyone on the Republican side seeking recognition? I'll recognize myself. I appreciate the opportunity for everybody to be here, and we're talking about the issue before us today, and we've had several people talk about, is Doge lawful? Is Elon Musk properly appointed to be where he is? The Doge comes from the U.S. Digital Group, which was founded an executive order by President Obama. If you remember, right after the rollout of the Affordable Care Act, they had the marketplace, the health.gov, and the health.gov was not successful when it first came out, so they put in a executive order to create a group called the U.S. Digital Group that brought tech people into the Department of Health and Human Services. I don't know how they were lawfully appointed or whatever, but they came in and had obviously access to data to get health.gov running. And so they got health.gov running, and they were able to accomplish things, and so the administration decided to keep them permanent and send them out into other different agencies to make sure that technology was spreading and being, as iPhones were kind of new back then, the other things are new at that time. So when President Trump came back into office, it is the U.S. Digital that has remained on the executive order. They did change the name to the Department of Government Efficiency, and so that is the legal status that the Doge operates from. It goes from the line from the Obama administration to a straight line all the way to with the changing of the name but that's where it's moved for. So the rename USDS relies upon the same authority that the digital services had in the Obama, the Trump 45, and the Biden administration. So I want to make sure that is on the record. Is anyone seeking time? Dr. Joyce? Well, I'll yield back, and then is anyone on the Democrat side? Gentlelady from New York?
Thank you. I appreciate the recounting of the fact that the U.S. Digital Service is the original purpose of this agency. This is to help agencies with their websites. That's what the U.S. Digital Service does. It helps agencies with their public-facing websites. The actual renaming of this gives the whole game away. The renaming of a digital service to quote-unquote government efficiency really tells the whole story of what is going on here. The United States Digital Service has never, in its history, been a participant in one of the largest data breaches in American history. The U.S. Digital Service has never been responsible for firing the Park Service officials en masse and then scrambling to reverse it. The United States Digital Service has never compromised the security of our nuclear supply. So I do want to know where the authority is, because there was never any standing authority for the United States Digital Service to be raiding every sensitive government official. Did they have access to some system? Sure, maybe, I don't know, a Squarespace. Not the nuclear supply of the United States of America. And so I don't think that answers the core question here of what the legal standing is and where this authority comes from to take from President Trump, to be honest. And with that, I would like to yield to the gentlelady from Texas to finish her point.
Thank you so much to my colleague from New York. Mr. Chairman, I just have an article from the Associated Press. Actually, this article is from Politico that I would like to submit for the record. Happy to give it to you to look at. But I hope that everyone on this committee knows that the career employees at the United States Digital Service, more than 20 of them resigned on Tuesday. That's today. They resigned, and they said that they were refusing to use their technical expertise to, quote, dismantle critical public services. Quote, we swore to serve the American people and uphold our oath to the Constitution across presidential administrations, the 21 staffers wrote in a joint resignation letter, a copy of which was obtained by the Associated Press. However, it has become clear that we can no longer honor those commitments. I think it's important for everyone on this committee to know and understand that the people who were working in that agency prior to President Trump reassigning it to Elon Musk have resigned en masse today. Thank you, and I yield back to my colleague.
Thank you, and I yield back to the chair.
So the consent is without objection, so ordered and entered into the record. So the chair will now recognize the gentlelady from Florida.
Thank you, Mr. Chairman, and thank you to all my colleagues for all of your patience. It has been a long day. But in talking about the authorities under which DOGE has been created, I thought it would be fun to just do it a little history lesson, you know? And I know we have a literacy crisis in this country, so I'm just going to read this out loud because I'm afraid that people might not read it. So I dug back into the National Archives, pulled up that President Obama executive order, which was Executive Order 13576, delivering an efficient, effective, and accountable government. By the authority invested in me as president by the Constitution and the laws of the United States of America, and in order to cut waste, streamline government operations, and reinforce the performance and management reform gains my administration has achieved, it is hereby ordered as follows. Now, I'm not going to read the whole thing, but you can absolutely Google this, and you will find that the absolute premise of President Obama's executive order is in fact what DOGE has done. And if you look at the US code that President Trump has cited, and I'll give it to you, it's US Code 3161 under Title V, he has absolute presidential authority for hiring. Now, you would remember, going back, that President Obama actually, when the healthcare.gov Affordable Care Act, aka Obamacare, website crashed in a horrific, just dumpster fire rollout, they had to bring in private sector techies. And I don't recall anyone on the Democrat side of the aisle raising Cain about 19, 20, and 21-year-old programmers showing up and fixing all of these inefficiencies. And I will also address this so-called data breach. These individuals have been hired well under the authority of President Trump to act in an official capacity to streamline and execute the agenda of this agency, of DOGE. I don't see anything on the other side of the aisle addressing the 443 federal data breaches that occurred under President Biden's tenure. Where were you then? Nowhere to be found, clearly. I find it exceptionally hypocritical that we're talking about so-called oversight today, when for the last 4 years, the silence has been deafening. It is absolutely incredible that you guys are attacking the very same executive order that President Obama stood up, but heaven forbid that we are actually taking stock of the taxpayers' money, using it efficiently, identifying areas of waste, fraud, and abuse, but you want to fight it every step of the way. So I would like to enter into the record Executive Order 13576, dated June 13th, 2011, which was President Obama's executive order, so that...
Without
not just-
objection.
Thank you, Mr.
so
Chairman.
ordered.
I just think it's important that we clear the air and recognize that this is all political theater from our friends on the other side of the aisle. It's time that we actually get work done for the American taxpayers. They are sick and tired of the waste, fraud, and abuse. They're sick and tired of the theatrics. We've been sitting here for hours, and not a single thing has been accomplished because of the obstruction of our friends on the other side of the aisle. So with that, I yield, Mr. Chairman.
Gentlelady yields back. Is there any gentlelady from California recognized for 5 minutes?
I'm not going to apologize to the American people for wanting to be here on my committee and doing the job that my constituents elected me to do. Some people are clearly, this is a long time for them to be in committee, and it's too hard to be here, and they want to go somewhere else. But I was elected to be here to fight for the American people against the betrayal by the Republicans against the American people for the betrayal on cutting access to health care and Medicaid. Now, you just heard this whole smoke and mirrors about Dodge and this executive order by another president. But those folks were not coming in with a chainsaw and a sledgehammer and just firing all these people indiscriminately. They were hired to look at websites. They were not then given access to the American people's privacy information, their bank account numbers, their home addresses, their birthdays, their social security numbers. They didn't go do that. But my Republican colleagues think that's perfectly fine. As a matter of fact, House Democrats came up with a bill after that to say, let's provide protection for the American people. Let's put a bill and pass a bill. We just need 3 Republicans to join us to provide protections on privacy for the American people. But you know what? It didn't happen. You know why? They're all so deathly afraid of the president. Don't be mistaken. That's part of what's going on here. So spare me the speeches about hypocrisy. And please recognize that what is happening here today is that Democrats believe there should be specifics in the oversight plan in response to what is happening in this country right now. Our Republican colleagues don't want to talk about it. Why? Because they don't want to even comment about the thousands of federal workers, some are even in their districts. They're being just cut, let go, fired, disrespected, working on critical information, like making sure there's prevention to things like diabetes. So I will be here as long as is necessary. I don't have a schedule where I need to go somewhere else because the American people elected me to be here. If a member of Congress doesn't want to be here, they can leave. They can leave and they don't need to vote. But this is my job and this is what I will do. And I will remind the American people that within the next hour, we're supposed to go vote on a budget. And my colleagues across the aisle will vote. Just watch it. Will vote to take health care away from the most needy people and cut Medicaid. I yield back.
Gentlelady yields.
Gentlelady yield.
I'll yield to my colleague, Mr. Menendez.
Thank you, my colleague, Congresswoman Barragan. I just want to, if we're going to do history lessons, the one quick one, especially before this vote, is that President Obama worked tirelessly with House Democrats to expand health care in this country through the Affordable Care Act. And tonight, Republicans will have the opportunity to make a decision whether they want to strip health care away from children, from pregnant women, and from our seniors if they're going to look to cut Medicaid. So as we go into this evening's vote, an important history reminder that Democrats seek to expand health care while Republicans try to strip it away from Americans. Thank you, and I yield back.
Does the gentlelady yield back? The gentlelady yields. Is there any additional discussion on the amendment? If there's no further discussion, the vote will occur on the amendment. The ranking member has asked for a roll call vote. I will ask the clerk to call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no.
Slow down, slow down.
Mr. Bilirakis?
No.
Mr. Bilirakis votes no. Mr. Hudson?
No.
Mr. Hudson votes no. Mr. Carter of Georgia?
No.
Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Crenshaw? Mr. Joyce?
No.
Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Allen votes no. Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller Meeks? Mrs. Miller Meeks? Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte? Mr. James? Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin? Mr. Fry? Mr. Fry? Ms. Lee? Ms. Lee? Mr. Langworthy? Mr. Langworthy? Mr. Kane? Mr. Kane? Mr. Rulli? Mr. Rulli votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mr. Peters votes aye. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
How is Mr. Obernolte recorded?
Mr. Obernolte is not recorded. Mr. Obernolte votes no.
How is Dr. Miller Meeks recorded?
Mrs. Miller Meeks is not recorded. Mrs. Miller Meeks votes no.
The clerk will report the result.
Chairman Joyce, on that vote, there were 22 ayes and 23 noes.
The amendment is not agreed to. Are there further amendments? Mr. Okencloak is recognized.
Chair, I have an amendment at the desk, HE 13.
The clerk will report the amendment. Could you please clarify which amendment?
HE 13, vaccines.
Amendment to Draft Oversight Plan, HE 13, on page 4, under the section Food and Drug Administration.
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Chair. Recently, the gentleman from Virginia, Mr. Griffith, stated that to the extent that this administration was espousing content that did not have scientific integrity or that was undermining confidence in science, that Republican or Democrat, there would be oversight over that. And I genuinely appreciate that. That is the role that we have on this Committee of Oversight. And given who our Secretary of Health and Human Services is, we're going to have our hands full. Let's meet Secretary Kennedy, who specializes now for 2 decades in conspiracy and quackery. This man does not believe that Al-Qaeda attacked America on 9/11. This man thinks that Wi-Fi causes leaky brain syndrome. This man does not think that AIDS is caused by a virus. This man believes that COVID was ethnically engineered to spare Jews and the Chinese. This man believes that the government engineers pandemics every few years and that there are, quote, cemeteries with a bunch of child coffins, end quote, from government experiments. And I've got receipts for all of these comments. Of course, most notoriously, Secretary Kennedy believes that, quote, no vaccine is safe and effective, end quote. This document, this oversight document proposed by congressional Republicans, has zero mention of the word vaccine. The word vaccine does not appear in the document. This despite the fact that the Secretary of Health and Human Services is a notorious anti-vaxxer and that vaccines have been the most safe and effective medical intervention of the last century, that 146 million kids' lives have been saved in the last 50 years because of vaccines for things like measles and polio and pertussis and rubella. It's not academic that we have a secretary who does not believe in the safety and efficacy of vaccines. In 2019, he took his anti-vax roadshow to Samoa. And Samoa was doing a measles vaccination drive because there had been an incident where nurses had mixed a vial incorrectly and a child had tragically died. And so they were trying to rebuild public confidence in the measles vaccine, the MMR. Now, Kennedy ran what he called, quote, a natural experiment. He was excited about this. And he pumped disinformation and propaganda into the Samoan public health and social media ecosystem. And 83 people died. The majority of them were children. They died in pain. Their lungs filled with liquid, and they choked to death. Now, RFK doesn't seem to think that that's anything related to the MMR vaccine. He says that when he was young, his 11 brothers and sisters got measles, and it was, quote, a great week. They just had chicken soup and vitamin A, and it was no issue. The challenge is, I don't think chicken soup and vitamin A is going to cut it in Texas and Georgia, where we now have measles outbreaks. And the secretary is intent on running this same, quote, natural experiment that he ran in Samoa here in the United States. We've got 4 members of the Texas delegation who are Republicans on this committee. We've got 2 members of the Georgia delegation on this committee who are Republicans. And I would certainly hope that they would stand up through oversight against Secretary Kennedy and declare that Texas and Georgia are not laboratories for his natural experiments, that the measles vaccine works, that every parent should have their kids take the MMR vaccine, because RFK, when he was asked directly, would he recommend parents take the vaccine, refused to say that they should. Now, Senator Cassidy, during the oversight hearings, tried to assuage public concern about this by getting a series of commitments from Secretary Kennedy about vaccines. Here's what he didn't get a commitment on, though. He did not get a commitment on the Vaccine Injury Compensation Program, which is a little-known government program over which the Secretary of Health and Human Services has tremendous power, and that provides an alternative to civil claims litigation for people who claim to be injured by vaccines. If he demolishes that program, it's going to undermine the distribution and development of vaccines, and you will see further outbreaks. Now, Chairman Guthrie, I understand that you're going to whip no on this vote, but I want to yield my last 30 seconds to you and just ask you, if he's here, is Palmer here, Mr. Palmer of Oversight? I would ask you, sir, in your role as the chair of Oversight, will you strenuously enforce oversight of the Vaccine Injury Compensation Program to prevent Secretary Kennedy from dismantling it and thereby making it impossible to develop and distribute vaccines and leading to further measles outbreaks?
In response to the gentleman, we will exercise vigorous oversight over the entire federal government, including past actions of the federal government in the previous administration, which should be satisfactory to the gentleman.
Sir, will you protect the Vaccine Injury Compensation Program from Secretary Kennedy? He made no such commitment to Senator Cassidy, so I just want to make sure that at least the House is on the record if he's not on the record in the Senate.
We will exercise due diligence and oversight on every aspect of the federal government.
Well, I certainly hope the members from Texas and Georgia will take a firmer stance on their side of the aisle than that.
Is there additional discussion on the amendment? Dr. Dunn from Florida is recognized.
Thank you, Mr. Chairman. I'd like to speak in opposition to the amendment. The oversight plan before us already covers this topic in 3 different places. First, the plan notes that the committee will conduct oversight of the federal government's policies and procedures relating to pandemic prediction, prevention, preparedness, and response. Second, in the plan's discussion related to CDC oversight, the committee will be examine issues including CDC's role in preparing and responding to emerging biological threats and infectious diseases. And third, In the plan's discussion related to the FDA, it notes that the committee will work to ensure that the FDA is fulfilling its mission to ensure that regulated drugs and medical devices are safe, effective, and available to American patients in an expeditious fashion. Even taken separately, each of these instances are certainly broad enough to encompass the vaccine-related priorities included in the amendment, and taken together, this amendment is wholly unnecessary. Therefore, I urge my colleagues to vote no on the amendment.
The gentleman yields. Is there any additional discussion on the amendment? Dr. Schreier from Washington is recognized.
Well, first, I want to thank my colleague for the amendment and want to clarify that this program is a program that makes it so that families can be compensated and in that way does not subject manufacturers of vaccines to lawsuits that would discourage them from manufacturing life-saving vaccines. And so as a pediatrician, I want to emphasize how important that program is and how grateful I am to the manufacturers of vaccines that have saved millions of lives. I have a question for Mr. Palmer. I would ask, and I would love to have a commitment from you, that we've been talking about measles, but I would say if there are outbreaks of more than 3 cases of any vaccine-preventable disease, so let me just name a few. We can talk about measles, mumps, pertussis. We could talk about polio. We can talk about chickenpox, all preventable by vaccines. There is no reason for any child to get these. Will you subpoena, will you call in RFK Jr., Secretary of Health and Human Services, to come in and answer for this?
I will exercise due diligence and oversight of the entire federal government.
I would like more of a commitment from you.
Well, you just got the commitment you're going to get.
My colleagues are laughing, and I just want to be really clear again, as a pediatrician, we should not have to wait for kids to get sick and kids to die because you think this is some sort of joke. When there are experts representing public health in this country who sow doubt about proven science, about vaccines, cause parents to hesitate, and some of them then to not vaccinate their children, and their children get sick, potentially die, or their children bring diseases to school, to the child in that classroom with leukemia. This is not a laughing matter. I think you ought to be.
And oversight. I had town halls last week. I know plenty of you had town halls last week. This is, in many areas, the #1 issue that the American people at town halls are raising. And it is very important that we take action to explicitly conduct investigations into access to systems here at CMS. This is some of the most sensitive personal data that exists for some of the most vulnerable medical populations that exist. And I genuinely believe this should be a straightforward vote. We should be ensuring that the laws on the books are upheld, and given the massive activities that we've been seeing around CMS, we should have an explicit, I think we should have explicitly hold a hearing to ensure that that access to CMS systems are transparent and reported. And with that, I yield back to the chair.
The gentlelady yields. Dr. Dunn from Florida is recognized.
Thank you very much, Mr. Chairman. The oversight plan makes it clear that the committee is focused on rooting out fraud, waste, and abuse in the Medicare and Medicaid programs. In fact, the Government Accountability Office examined the very serious and growing risk posed to the Medicare and Medicaid programs resulting from exactly fraud, waste, abuse. In 2023 alone, GAO found improper payments in Medicaid totaling $50 billion. In Virginia, investigators uncovered over $22 million in payments to deceased Medicaid beneficiaries. This committee worked to combat waste, fraud, and abuse in Medicare and Medicaid programs over the past year and on a bipartisan basis. We intend to continue these efforts that focus on ensuring providers are eligible to bill Medicaid and ensuring we know exactly who is eligible to receive Medicaid benefits. More to the point, CMS authorized DOJ to have read-only access to CMS's payment system without compromising any personal medical information. I would hope and think that my friends on the other side of the aisle would welcome efforts to help us uncover any unnecessary spending that is diverting resources away from the most vulnerable patient populations. And I urge a no vote on the amendment. Mr. Chairman, I yield back.
Anyone else wish to be heard on this amendment? Recognize Mr. Soto for 5 minutes.
Thanks so much. I think it's a great time to have a DOGE check-in right now. Just over the last 2 weeks, we've seen, these are kind of the top 5 most ridiculous things that at least I felt DOGE did. First of all, we saw the president claim millions of people getting Social Security fraudulently, which obviously right afterwards he had to say didn't happen. Then we saw just today, DOGE quietly deletes the 5 biggest spending cuts it announced with joy last week because they were false. They'd announced $55 billion in cuts, only to come back to say it's $7.2 billion. We saw the firing of, number 4, the firing of critical nuclear engineers, FAA, DOD, all these folks that are the only ones who know how to do this. And then today, we just saw a bunch of folks who work for DOGE quit. So if this is the start of this great efficiency effort, it isn't an auspicious one. And I yield.
Thank you. Thank you, Mr. Soto. And once again, this amendment has nothing to do with any accusations of waste or abuse. It's not here to litigate that. It is, once again, to ensure that the committee will conduct oversight to ensure that this data is only granted to people who are authorized government officials. That's all that this amendment does. Ensuring that this committee is conducting proper oversight so that authorized government officials have access to these systems. That's all this amendment does. It's not litigating waste, it's not litigating abuse. The reason this is important is because DOGE just posted classified information on its website, sharing budget and staffing information of the National Reconnaissance Office. Within the White House complex, Wi-Fi permissions that are meant to bolster security by prompting that users are logging in frequently were just recently changed to allow guests to remain logged in at the White House complex Wi-Fi for a year, up from just 7 days, because so many new personal devices are being used to access the White House Wi-Fi network. This isn't even about intent. These permissions, you have one device that remains logged in and gets lost in the back of a cab, and you have a data breach on our hands. We have to ensure that we are using our proper oversight and investigatory capacities to make sure that these systems are properly secured. That's all this amendment does. That genuinely, it's all it does. I have the amendment at the desk. I'm happy to circulate it to all of my colleagues. This is just about ensuring that the folks who are authorized to have this information are the ones that are getting it and no one else. Because we're already starting to see some cracks in our systems. We're starting to see some cracks in the security of these systems, whether they are intentional or not. But it is very clear that there are liberties being taken here that are creating a leaky data flow. And if we don't take care of it now, if something big happens, it's going to be on this committee's hands. And I don't want that to be the case. Thank you, and I yield back.
And I thank the gentlelady. We can include this as number 6 in the DOGE disaster of things that we've seen so far, and I yield back.
Gentleman yields back. You have anyone interested on this side? Anyone else interested in speaking on the other side? Ms. Matsui, recognized for 5 minutes.
I move to strike the last word, and I've been listening very intently with what was being said. With this last amendment, particularly Ms. Ocasio-Cortez and others, we're talking about the duties and the responsibilities of our committee. And I'm looking at this and realizing that what we're saying is that under the guise of looking for government efficiency, and I say inefficiency, this is just a guise. Musk and his 20-year-olds have strong-armed their way into our most personal information that most of us, when you think about hacking our healthcare, hacking our Social Security, hacking our tax records, we would be alarmed. But we're letting this happen. And DOGE is not equipped. These young 20-year-olds are not equipped. Their lack of knowledge about these programs and unfamiliarity with the data, they don't know what they have. And they will let this data flow. And all of a sudden, we'll find out that people have our most personal information, security information about our country, and we will be caught flat-footed. And this is a warning. And we have to understand that something like this cannot happen at all. Every time we read about some sort of breach or hack, we get all worried about it. We get information from, like, say, the healthcare provider or something like this. This is happening in our government. And you look at this, any small change they can make is going to be significant in our lives. And we may not be able to go back and fix it. And that scares me. This is really a 5-alarm fire. This committee has to stand up, And I can't believe that you on the other side are going to continue to be silent about this, because it affects all of us. And if we don't realize this today, we're going to be paying for it in the days ahead. With that, I yield back the balance of my time.
Gentlelady yields back. Anyone desiring to speak on this side? Anyone else on the Democrat side of the aisle? Seeing none, we'll move to the vote. There is a request for a roll call vote. So we will now begin with a roll call vote on this amendment, HE number 3. And we'll start the roll call, please.
Mr. Latta. Mr. Latta votes no. Mr. Griffith.
Mr. Griffith votes no.
Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller Meeks? Mrs. Miller Meeks votes no. Mrs. Kamick? Mrs. Kamick votes no. Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James? Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin? Mr. Fry? Mr. Fry? Ms. Lee? Ms. Lee? Mr. Langworthy? Mr. Langworthy? Mr. Kane? Mr. Kane? Mr. Rulli? Mr. Rulli votes no. Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Tonko? Mr. Tonko votes aye. Ms. Clark? Ms. Clark votes aye. Mr. Ruiz? Mr. Ruiz votes aye. Mr. Peters? Mr. Peters votes aye. Mrs. Dingle? Mrs. Dingle votes aye. Mr. Vesey? Mr. Vesey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Trahan? Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Mullen? Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie? Chairman Guthrie votes no.
Has Mr. Hudson recorded?
Mr. Hudson is not recorded. Mr. Hudson votes no.
And the vote is?
Chairman Griffith, on that vote, there were 22 ayes and 23 noes.
So,
The amendment is not agreed to.
Mr. Chair.
Mr. Landsman.
Mr. Chair, I have an amendment at the desk.
Mr. Landsman has an amendment at the desk.
It is labeled HE 17_ trigger laws.
Clerk will report the amendment.
Amendment to Draft Oversight Plan, HE 17. On page 3, after quote, "The committee will continue to examine issues related to affordability of health care, including areas where federal government intervention has contributed to increased costs for patients and families," end quote, insert, quote, "The committee will examine the effects of cutting federal Medicaid funding for those made eligible by Medicaid expansion on rates of uninsurance, out-of-pocket costs, and medical debt for low-income Americans, particularly in states with laws that require the termination of medical assistance for people covered under Medicaid expansion if the matching rate is reduced below 90%, end quote.
Mr. Landsman, recognized for 5 minutes.
Thank you, Mr. Chair. As you heard, my amendment seeks to clarify that our oversight responsibilities include examining the effects of cutting Medicaid to states and how it will impact those who are covered by Medicaid expansion, particularly in states that have so-called trigger laws that terminate Medicaid expansion if federal Medicaid funding is reduced. And since we are expected to vote on a budget bill that may include nearly $1 trillion in cuts to Medicaid, cuts to health care that tens of millions of people rely on, it could be worse in states like Ohio, where the legislature is considering a measure to repeal Medicaid expansion funding if federal Medicare share falls below 90%. This would mean the elimination of health care for an additional 770,000 Ohioans. More hospitals, more doctors, more long-term care facilities. It will be devastating to children, to families, to seniors. In my district in Southwest Ohio alone, more than 160,000 people depend on health care through Medicaid. More than 40% of them are children. So instead of passing a $4.5 trillion dumpster fire of a budget that makes huge cuts to Medicaid that could trigger even additional cuts, will trigger additional cuts to Medicaid, health care for folks, we could, because it was raised, what is the alternative? The alternative is so simple. 100% of all tax relief goes to working people. 100% goes to working people, the middle class, small businesses, and farmers. Paid for with zero cuts to health care. Zero. Zero in new deficit spending. The pay for is just asking the folks at the top to pay all their taxes. If you give up on the tax giveaways to the top 2%, you save $2.4 trillion. $2.4 trillion, just if you give up on the top 2%. That allows you to avoid cutting health care for tens of millions of people, hundreds of thousands in Ohio, tens of thousands in my district. For all of these reasons, this is an important amendment, and I urge my colleagues to support it. I would hope that at the very least, they recognize that these trigger laws are very serious. It will hurt hundreds of thousands of people in our state alone, and is just one more reason to walk away from these disastrous cuts to health care. I yield back.
Gentleman yields back. The chair recognizes the gentleman from Georgia for 5 minutes.
Move to strike last word. Mr. Chairman, this oversight plan already makes it clear that the committee will continue to examine issues around the affordability of health care for the American people, including for Medicaid beneficiaries. We spent all of last Congress working on a bipartisan effort to lower the cost of care through the Lower Cost, More Transparency Act, which I might add passed this committee unanimously, passed the Ways and Means Committee, went through the House. I would say that both the past actions of this committee, and listen to me carefully if you will, I pay close attention to what you say. I would say that both the past actions of this committee and the oversight plan in particular affirm our goal to lower health care costs for Americans while also bringing accountability to federal spending. Because with that said, we know that Medicaid spending continues to grow at an unchecked rate. We know that. And we need to do more to make sure that it can remain sustainable to care for future generations. These people need us. They need Medicaid. We need to be able to provide it for them. The answer from the Biden administration over the past 4 years was always that more spending is the only way to lower cost. Throw more money at it. And oh, by the way, the more money you throw away, the more money you throw at it, the more you care. No, that's not always the case. Not only has more government spending increased costs, but it's set our entitlement programs on a course for insolvency. We all know that. If you're a member of Congress, you know that. You know that we are headed for insolvency if we don't do something. In 2023 alone, the Medicaid program had more than $50 billion in improper payments. I don't think anybody in this room likes that. I think everybody in this room wants to do something about that. We can walk and we can talk at the same time, though, and we can prioritize right-sizing the Medicaid program while also ensuring that we lower health care costs for Americans. Mr. Chairman, I've said it. You've heard me say it. I continue to say it. We all want the same thing. We want accessible, affordable, quality health care. And we can do that. And this oversight plan that we have submitted does just that. It's going to give us the opportunity to do that, to achieve our common goal, accessible, affordable, quality health care. Thank you, Mr. Chairman, and I yield back.
Mr. Chair.
The gentleman yields back.
Mr. Chair.
Gentleman had time. Does somebody want to claim time and give you time? Gentleman from New Jersey, seek recognition.
Thank you, Chairman. I yield to my colleague from Ohio.
Thank you, Mr. Chairman. Thank you, Mr. Menendez. Two things, Mr. Carter. The PBM reforms are so critically important, and you've worked harder than anybody on these PBM reforms. And it passed out of this committee, I think 44-0, most of them. Unanimous, bipartisan support. It ends up in the final spending bill. Guess who kills it? Elon Musk. Why are we letting him do this? On the Medicaid question, we don't have to cut a single dollar in health care. All we have to do is say, for the top 2% of wage earners, the big corporations in this country, we are not going to continue to do these tax giveaways. We'll give tax cuts to everybody else. Saves you $2.4 trillion, 0 cuts to Medicaid, and you can invest those additional resources in reimbursement rates. I yield back.
Gentleman from New Jersey, yield back.
Thank you, Chairman. I yield.
Gentleman from Ohio, what purpose seek recognition? Mr. Rooley? We got a lot of Ohioans too, don't we? Mr. Rooley?
Thank you, Chairman. If you tell a big enough lie enough and keep repeating it, it will eventually become believed as the truth. I spent 7 years in the Ohio Senate. I was chairman of government. I had Medicaid in my committee every year. Let's get the facts straight about what goes on in Ohio. The General Assembly of Ohio operates on $93 billion. We're third in the country for Medicaid expansion of $44 billion. We work very diligently in the Ohio Senate and the Ohio House of Representatives to make that money put to good use. But the lies that have been spread in the last 8 hours about how there's this Medicaid and Medicare language in there which doesn't exist is unacceptable. It is a lie. It doesn't exist. It is not part of this, and I've entertained this for eight hours now. But Medicaid in Ohio is third in the country for expansion. And we do the best that we can. The answer is not throwing more money. The answer is being a better steward of due diligence of the money that the people already give them and applied in the proper procedure. With that, I yield back, Chairman.
The gentleman yields back. Anyone seeking recognition? Oh, I want to, the gentlelady from California recognized for 5 minutes.
How do I get my own chairman?
Thank you, Mr. Chairman. We know a little bit about lying because we hear it all the time from across the aisle, so it's kind of offensive to hear. He's the one who brought it up, Mr. Chairman. He brought it up that he's been hearing lies for the last 8 hours, so I don't want to hear a boo. I don't want to hear a boo, okay? Why don't you get your folks' decorum in order? And I'm serious,
The lady
Mr.
from California
Chairman.
has the time.
Thank you. I move to strike the last word.
Gentlelady's
This week,
recognized.
rather tonight, maybe, House Republicans will try to pass a budget that betrays the American people and American families. Their scheme will slash Medicaid by nearly $1 trillion, robbing health care for millions of seniors and children and hardworking families, all to fund massive tax breaks for billionaires and big corporations. That is the truth. Medicaid isn't just numbers, it's real people and real lives. And we know what people will go through because many lost Medicaid, even after the COVID pandemic happened. Justin Gibbs, a married father of 4 from Ohio, lost his Medicaid after he finally got his high blood pressure under control with a combination of 3 different medications. Mr. Chairman, there is not order in the room. Mr. Chairman, there is not order in the room.
Would you repeat your question? I'm sorry.
No, there's no order in the room, and I.
Yeah, I'm sorry, I was-
deserve the,
I'm sorry, there's a vote on the floor. We were discussing that. So yeah, the committee will come to order. The gentlelady may continue.
yes, I should get another 30 seconds back. Justin Gibbs, a married father of 4 from Ohio, lost his Medicaid after he finally gotten his high blood pressure under control with a combination of 3 different medications. But after he had his Medicaid coverage terminated in a nationwide eligibility review, he had to go without medication for a week and a second for several days. He was afraid that his progress could reverse. Justin is 53 and works multiple part-time jobs. Kristen Fortner from Arkansas suddenly received notice in the mail that she needed to prove that she and her husband still deserve Medicaid. These stories are about people, and it's about their health care, and it's about how they had such a difficult time, some of them coming off their Medicare, out of their meds because their Medicaid had been cut off. And suddenly, Kristen owed hundreds of dollars. She's 33 years old, she's a waitress and earns $3 an hour plus tips. These are real people, these are stories, these are constituents, and there are many constituents, not only in my district, where I have over 340,000 people on Medicaid, and those people are at risk of losing their health care, but many in this room. I have this poster board here today so the American people could see. We have Representative John James, who represents Michigan's 10th District and sits right here on the Energy and Commerce Committee. He has, in his jurisdiction, 24% of his constituents relied on Medicaid. That's over 184,000 people, 184,000 constituents. Do you go home and say, I voted to take away your Medicaid? Or do you stand up and say, I'm here to vote for you. I'm here to stand up for working families, not for the billionaires, not for the big corporations. That is the test that will happen. We also have Mr. Gabe Evans. 25% of his district relies on Medicaid. That's over 180,000 people. And let's take a look at how many children. How many children? This is about the children. 49% of children in his district rely on Medicaid. So is this representative going to stand up for his constituents and his children? We will know shortly. David Valadeo, one of my colleagues from California. Look at this, 62% of his constituents rely on Medicaid. Imagine going back to your district and saying, I voted to take away your health care. I voted that your children, vulnerable children, are not going to have access to health care, or those with disabilities. That's shameful, just shameful. I don't know how they do it, but I do hope that every one of these members is going to go back and hold a town hall so they can hear from their constituents how they betrayed American families. How they betrayed American families. And with that said, we need just 3 Republicans to stand up and say, I'm going to fight. I'm going to fight. I'm going to join you. I'm going to stop this madness. And we're going to help save health care for the American people. I yield back.
Gentlelady yields back. There's a vote on the floor, and this is what we'll do. We'll recess to take the vote on the floor. I will come immediately back, but we will not vote on it. We will do a roll call vote until 15 minutes after the last vote. But if you want to speak, come back and we'll get started. But we won't do a roll call until 15 minutes after the last vote. But we'll start 15 minutes after the last vote. Thank you. The committee is in recess. All right, the subcommittee will come back to order. As I said, after the last vote, we'd give people at least 15 minutes to get back before we vote. But next in the queue to speak on my friend from Ohio's amendment was gentleman from Florida, Mr. Dunn.
Thank you very much, Mr. Chairman. We were discussing trigger laws when we were so rudely interrupted. There is nothing in this oversight plan or budget resolution, for that matter, that addresses changing the expansion population FMAP settings, or it's anything to set off the trigger laws. All this oversight plan does is call into question the growing costs of entitlement programs like Medicaid and resolve to address ways to right-size the government and ensure long-term sustainability for the programs. Now, I know that outside groups have talked about these policies as ways to address the overall cost of the Medicaid program. And we know that Medicaid spending is going to grow from $550 billion this year to over $800 billion by the end of the decade. And that's unsustainable. It's unsustainable, and you know it's unsustainable, and I do too. But we shouldn't have to discuss and address some specific policy proposal that isn't even being discussed today in either the oversight plan or the budget resolution. With that, Mr. Chair, I yield back.
The gentleman yields back. Mr.
Chair?
Have you taken time? Somebody want
Oh, go ahead.
to, gentlelady from Virginia? You want to yield time to my friend from Ohio?
Thank you, Mr. Chair. Yes, I do.
Okay.
I apologize, Mr. Chair. I'm getting it. So the reason why the trigger laws are so important and why this is something that we're going to have to wrestle with is that moments ago, you all passed a budget resolution that includes $880 billion in cuts from here. And as the ranking member went through earlier, you don't get very far cutting anything else. And so the assumption, reasonably so, is that there's going to be drastic cuts to Medicaid. That's the only way to get to $880 billion. So right now in the state of Ohio, House Bill 96, they are set to pass a piece of legislation that includes the following language. If the federal medical assistance percentage for medical assistance provided to members of the expansion eligibility group is set below 90%, then the Department of Medicaid shall immediately discontinue all medical assistance for members of that group. That's 770 Ohioans. That's almost 800,000 Ohioans. That's why it's relevant. That's why we should take it up. I yield back.
Gentleman yields back to the gentlelady from Virginia. You want to yield back, or do you have time?
Thank you, Mr. Chair. I would just remind our colleagues that if the trigger laws are triggered by cuts to Medicaid, which I don't see how we get to $880 billion without, that's going to have an impact on our state budgets. That's going to close hospitals, particularly in rural areas. And hundreds of thousands of people in Virginia alone are going to lose their health care. And I was in the state legislature when we expanded Medicaid, and it was a bipartisan vote because Republicans in the state legislature understood that their constituents needed health care, that their constituents needed their hospitals to stay open, and that their constituents were counting on them to ensure they had health care coverage. And any action that this committee or any other committee takes that rips health care away from 80 million Americans, or even just the expansion states, we should have an oversight hearing to determine what's the ripple effect on those states and their populations and their access to care. And we shirk our responsibility as members of this body in a federal-state partnership if we don't do that. And so I think we need to include in our oversight plan something that shows we recognize our responsibility, not just to our constituents, but our state government partners, because we're about to blow a hole in their budget that they're gonna not be able to fill. With that, I yield back.
Could, would the gentlewoman yield to me for the last minute?
I do.
I just want to point out, you know, I heard what Mr. Landsman said in the context of this amendment, and I heard Mr. Ruley, I think, I hope I'm pronouncing it right, disagree and say that Ohio doesn't, I mean, the way I understood, he said that Ohio doesn't really have a trigger law that does this. So, I mean, again, I think there are 9 states that have trigger laws of some sort. So, I mean, I do think even in the case of Ohio, but the other ones, I mean, it makes sense to have this in the oversight plan because I don't think it's at all clear from this discussion here, you know, how many states have this, what the trigger laws say, when it's triggered. Again, I mean, we're talking about potential cuts of, you know, several $100 billion, and it certainly makes sense to include that in the oversight plan. Yield back to the gentlewoman.
Gentlelady from Virginia yields back.
I do, thank you.
Thank you. Gentlelady yields back. Seeing no discussion on the Republican side anymore, on the Democrat side? Yeah, I said that we're going to have 15 minutes after votes. I think we're right at it. By the time we do the roll call, certainly everybody would have plenty of time to have gotten back. So there's no further discussion on the amendment. The vote occurs on the amendment. All those the gentleman from New Jersey has requested a roll call vote, and the clerk will call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes no. Mrs. Kamick? Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Ruley? Mr. Evans? Mr. Evans votes no. Mr. Goldman? Mr. Goldman votes no. Mrs. Fedorchak? Mrs. Fedorchak votes no. Mr. Pallone? Mr. Pallone votes aye. Ms. DeGette? Ms. DeGette votes aye. Ms. Schakowsky? Ms. Schakowsky? Ms. Schakowsky votes aye. Ms. Matsui? Ms. Matsui votes aye. Ms. Castor? Mr. Tonko? Mr. Tonko votes aye. Ms. Castor votes aye. Ms. Clark? Mr. Ruiz? Mr. Peters? Mrs. Dingle? Mrs. Dingle votes aye. Mr. Vesey? Mr. Vesey votes aye. Ms. Kelly? Ms. Kelly votes aye. Ms. Barragan? Ms. Barragan votes aye. Mr. Soto? Mr. Soto votes aye. Ms. Schreier? Ms. Schreier votes aye. Ms. Trahan? Ms. Trahan votes aye. Ms. Fletcher? Ms. Fletcher votes aye. Ms. Ocasio-Cortez? Ms. Ocasio-Cortez votes aye. Mr. Auchincloss? Mr. Auchincloss votes aye. Mr. Carter of Louisiana? Mr. Carter of Louisiana votes aye. Mr. Menendez? Mr. Menendez votes aye. Mr. Mullen? Mr. Landsman? Mr. Landsman votes aye. Ms. McClellan? Ms. McClellan votes aye. Chairman Guthrie?
No.
Chairman Guthrie votes no.
Mr. Allen?
Mr. Allen is not recorded. Mr. Allen votes no.
Ms. Kamick?
Ms. Kamick is not recorded. Mrs. Kamick votes no.
Ms. Clark?
Ms. Clark is not recorded. Ms. Clark votes aye.
Is anyone else looking to enter the roll call. It has been more than 15 minutes, so everybody's had an opportunity to get back. I'll make sure everybody has an opportunity to vote. So the clerk will report.
Chairman Guthrie, on that vote, there were 21 ayes and 27 noes.
With 21 ayes and 27 noes, the amendment is not agreed to. Are there any other amendments? General, who wants to go with? Is it Ms. Kelly? Okay. Or is it Bettagon? Okay. For what purpose does the gentlelady from California seek recognition?
Mr. Chairman, I have an amendment at the desk.
The clerk, what amendment?
BV 18_18.
The clerk will report. Could you repeat? I'm sorry, would you repeat that again?
ENV_18.
The clerk will report.
Could the gentlelady from California read the first sentence of the environment amendment?
Okay.
ENG, did you say?
On page 9, after the section titled CERCLA and Brownfields and a new section titled Environmental Justice, insert, and I'm quoting, "The committee will review how the billions of dollars of EPA and DOE grants illegally frozen by the Trump administration are stymieing environmental justice, including low-income communities and rural communities' ability to fund initiatives addressing rural infrastructure, clean water, toxic contamination, and clean air. This oversight will include the targeting of civil servants designated to administer these programs." Do you want me to continue reading? Okay.
You have the amendment? The clerk will report.
Amendment to draft oversight plan.
Without objection, the reading of the amendment is dispensed with. We did have the reading from our friend from California. And the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. My amendment demands immediate oversight of how the Trump administration's illegal freeze of billions in environmental and clean energy grants have harmed environmental justice communities, including low-income and rural communities in districts represented by my colleagues across the aisle. These grants fund essential initiatives to support clean drinking water, toxic contamination cleanup, and improved air quality. In recent weeks, we have seen repeated stories of frozen funds causing chaos. A Missouri school district couldn't pay for electric school buses. A project to modernize the power grid in Georgia was put on hold. A grant to address drought in southwestern Colorado is in jeopardy. There are thousands of similar stories in all our districts. Well, where are House Republicans while the president continues to illegally withhold funds? Nowhere to be found. Silent as their own constituents and projects suffer. House Republicans are running a scheme to steal health care and environmental cleanup funds from the American people, all to reward billionaires with more tax cuts while their constituents suffer from pollution. This Republican betrayal does nothing to lower costs for everyday Americans. The administration has also slashed environmental justice staff and plans to shut down the EPA Office of Environmental Justice. This corporate polluter giveaway harms communities of color in my district and across the country that suffer from dangerous pollution. It also hurts rural and economically disadvantaged areas where a lot of Republicans are severely impacted by pollution. My amendment ensures that we fully understand the damage done by these Republican budget cuts and illegally frozen funds. I urge my colleagues to support this amendment and protect all our communities from pollution. I yield back.
Thank you. The gentlelady yields back. The chair will recognize the gentleman from Virginia for 5 minutes.
Thank you, Mr. Chairman. I oppose the amendment. This amendment is unnecessary as the oversight plan already includes oversight of the EPA, including the agency's funding decisions, resource allocation, and grants. The committee has already been engaged in the oversight of environmental justice programs, including use of resources and agency management of these programs. In fact, the Subcommittee on Oversight and Investigations is holding a hearing tomorrow to assess EPA's implementation of its grant programs. Now, it's my understanding the EPA is starting to unfreeze some of these funds, but a new administration came in. They froze funds so that they could get an idea as to what was being done properly or not properly, what was being done legally or illegally. But I want to draw the attention of the members to the wording of the amendment. Because if we're doing oversight, our job is to go in We may feel a certain way, but we shouldn't prejudge until we've heard all the evidence. This amendment purportedly calls on us to hold an investigation. But in the second line, first sentence, second line of the amendment, it says, illegally frozen by the Trump administration. Well, it's nothing but a kangaroo court if you've already made your mind up. So I urge everyone to vote no, and I yield back.
Gentleman yields back. Any discussion, further discussion? Seeing none, if there's no further discussion, the vote occurs on the amendment. The gentleman from New Jersey has requested a roll call vote, and the clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Balderson. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshberger. Mrs. Harshberger votes no. Mrs. Miller-Meeks. Mrs. Miller-Meeks votes no. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Strakowski. Ms. Strakowski votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Mrs. Barragan. Mrs. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Ms. Kamick is not recorded. Ms. Kamick votes no.
Anyone on the Democrat side? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 22 ayes and 27 noes.
7 noes, the amendment is not agreed to. Are there further amendments? Ms. Fletcher? For what purpose does the gentlelady from Texas have a?
Mr. Chairman, I have an amendment at the desk. It's HE 31.
Clerk will report the amendment.
Amendment to draft oversight plan, HE 31.
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Almost 3 years ago, the Supreme Court overturned Roe v. Wade, and since that time, people in states like mine that have outlawed abortion have been in crisis. And frankly, in my state, the crisis started even before the Dobbs decision, because what we have seen is that the vague and punitive laws outlawing abortion prevent access to reproductive health care much more broadly. In Texas, we have seen story after story after story of women who were sent home from the hospitals while they were having miscarriages, told to wait outside in their cars because they weren't bleeding enough. They didn't have a high enough fever. They weren't, as one was told, close enough to dying to get medical care. They were told to go home. We've heard from a lot of these women, and we've heard from families of women who were not able to get care at all and who have died. These are our fellow Texans, our fellow Americans in Houston, in Austin, in Vidor, across our state. The denials and delays in getting health care in states that have banned abortion is real. We hear it from patients and we hear it from physicians. They are not able to meet the standard of care that they have been trained to provide for their patients. And they live with the threat of losing their medical license or being criminally charged for providing reproductive health care to their patients. In Texas, doctors who perform abortions are subject to a $100,000 fine and life in prison. And anti-abortion lawmakers continue to say that these bans won't stop doctors from treating ectopic pregnancies or miscarriages, but that is not what we are seeing in our state and across the country. A recent report found that since the abortion ban in Texas, the rate of sepsis has increased by more than 50% for women being hospitalized for miscarriage. We also know that states like mine that have abortion bans have some of the highest maternal mortality rates in the country. And at least in my state, the State Maternal Mortality Committee has failed to fully review the deaths from the first 2 years since the state banned nearly all abortions from its reporting. There is no transparency. And as I understand it, a similar thing happened in Georgia. They just disbanded their committee. We need to be clear about the impact that these laws are having on our constituents. We need to understand it. And we need to understand something else that is critically important. Across the country, 40% of births in the United States of America are covered by Medicaid. In Texas, that number is 50%. So when the directive in the budget resolution that our friends on the other side of the aisle just voted for comes back to this committee to cut at least $880 billion in spending from our committee, we understand that that is coming from Medicaid. Cutting Medicaid from children and pregnant women, as this budget resolution dictates, will only make things worse. And it's not very pro-life. My amendment today states that this committee will support data reporting that tracks the consequences that state abortion restrictions have on patients and providers across the country. These are the things we should want to know if we are serious about understanding the impacts of the laws on Americans' health and safety and their ability to access the care that they need. It's more important than ever that we work to protect the health, dignity, and freedom of women and families across this country so that they can safely access reproductive health care and make their own decisions about their families. Thank you, Mr. Chairman, and I yield back.
Thank you. The gentlelady yields back. Is there any discussion on the Republican side? Seeing none. Gentleman from Georgia, you're recognized for 5 minutes.
Move to strike last word. Mr. Chairman, I move to speak in opposition to the amendment. Every child is a gift and a blessing. And Republicans have shown commitment to supporting mothers and babies at every stage of life. For example, this committee worked in a bipartisan fashion to move the Maternal and Child Health Stillbirth Prevention Act through the committee process and get it signed into law. We also worked on the Preemie Reauthorization Act and Preventing Maternal Deaths Reauthorization Act. And I hope we're able to continue this bipartisan work through this Congress to get these reauthorizations signed into law. The Dobbs decision simply gave individual states the authority to regulate abortion to more clearly reflect the will of their residents. The oversight plan already includes, and we've been saying this all day long, It already includes broad public health oversight, including maternal and infant health programs. That's the reason this amendment is unnecessary and it's only politically motivated. It is not necessary. The oversight's already in there. Mr. Chairman, I yield.
Gentleman yields back. Any gentlelady from Illinois? You're recognized for 5 minutes.
I move to strike the last word. Chairman, I speak in support of this amendment from what was just voted on. Republicans want to rip away Medicaid in the midst of our maternal mortality crisis. As my colleague said, Medicaid pays for more than 40% of all births in the U.S. Medicaid also pays for 75% of all publicly funded family planning services, such as contraception, breast and cervical cancer screenings, and HIV counseling. More hospitals in rural areas will be closed due to Medicaid cuts, increasing maternal care deserts. Half of counties in the U.S. are already maternal care deserts. Giving birth should not be a partisan issue, but this Republican budget will rip away health care from mothers and families, no matter their political party. Women and families deserve better than this budget, and I've been working on maternal mortality and morbidity for about 8 years now, or 9 years now, and at first when I brought it to this committee, there was a lot of fighting from the other side about was it really necessary, so everybody wasn't really on board from the beginning. I yield back.
Gentlelady yields back. Is there anyone on the Republican side seeking recognition? Seeing none, the gentlelady from Virginia.
Thank you, Mr. Chair. I move to strike the last word. I almost became one of the statistics of Black women who were 3 times more likely to die in childbirth in this country. When my placenta ruptured and I was rushed into the emergency room for a C-section, when my heart rate and my now daughter's heart rate both were crashing. The last thing I remember as I was being wheeled into the emergency room was my doctor saying, "I'm here," and a nurse putting an oxygen mask on my face and saying, "Everything's gonna be fine." And my last thought was, at that moment, I had the peace of mind of knowing that in that crisis moment, my doctor would make the decision she felt necessary in that moment. My daughter might not have that same peace of mind. Gisele Barnica didn't have that peace of mind. Amber Thurman didn't have that peace of mind. I could be here all night listing the names of women who, in the midst of an emergency or a C-section, went to a hospital in a state that bans abortion for a pregnancy they wanted. In some cases, desperately so after in vitro fertilization or fertility treatments. And they were denied care because they weren't sick enough. They were denied care until they were septic. They were denied care until they died. And that's why it's not a surprise that the states that have adopted abortion bans since the fall of Roe versus Wade also have the highest numbers of maternal mortality rates. And in the context of states where they won't provide abortions in the case of gross fetal abnormality, and those children are born, and in some cases, the minute their umbilical cord is cut, they die because they suffocate. That has physical and mental consequences for the mother and the family. That's what's happened because of these abortion bans. Now, in a lot of states, we know that the reason, so I want you to think about that in the context of cuts to Medicaid. where in many states and here at the federal level, coverage was expanded to the first year after birth. Why? Because for a lot of women, particularly Black women, you die from pregnancy-related complications within the first year, usually cardiovascular. Usually because you have an underlying health condition that has gone untreated because you don't have access to care. So by providing coverage for the first full year, we get you through and you're less likely to die. So now you got more women dying because of abortion bans. You're going to have more women die if we cut Medicaid because they don't have health care coverage after 6 months of pregnancy. And we need to look at the consequences of our actions. We need to look at the consequence. I'm a lawyer and I know words matter, but actions matter. And the unintended consequences of laws matter. And it's life and death. It was almost death for me. And I want us to be sure that the next woman wheeled into an emergency room in the middle of a miscarriage, in the middle of bleeding out, knows, first of all, that hospital will not have to call their lawyer and say, is she sick enough? That the hospital will be there because they were able to keep their maternity ward and their obstetrics unit open. And they had enough providers who said, I am willing to be an OBGYN because I don't have to worry about being prosecuted for providing the standard of care I think necessary. And that's why this is more than just politics. This is life and death. I yield back.
Gentlelady yields back. Is there anyone on the Republican side? Seeing none, anyone, the gentleman from New Jersey, you're recognized for 5 minutes.
Move to strike the last word. I'd like to thank my colleague from Texas, Congresswoman Fletcher, for introducing this amendment. I'd like to thank my incredible colleague from Virginia, Congressman McClellan, for sharing those stories, those real stories. And I would just challenge my folks across the aisle who said this is a politically motivated amendment. This is about understanding the real consequences of what's happening across the country with respect to state abortion restrictions and the impact that they're having on patients and providers across the country, and something that is 100% within our jurisdiction, and something we should absolutely be concerned about as Republicans consider drastic, immense cuts to Medicaid and all the incredible programming that they provide and coverage that they provide to women both during their pregnancy and postpartum. So this is definitely something of incredible importance, something that we should all be concerned about on both sides of the aisle, and that's why I will be supporting this amendment. Thank you, and I yield back.
Gentleman yields back. Anyone seeking recognition on the Republican side? Seeing none, anybody on the Democrat side? My friend from Florida, Ms. Castor, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I want to thank Representative Fletcher for her very thoughtful and important amendment. I want to thank Representative Kelly for her years of work on the maternal mortality crisis, and Rep. McClellan for sharing her very personal story. In Florida, we are seeing an unfortunate increase in maternal mortality. I've been in, since Florida's very draconian 15-week abortion ban was implemented, I've talked to providers in hospital and asked them directly, is this an impediment to providing the kind of care that you were trained to provide? And unfortunately, the answer is yes, because yes, it is the case. The providers said that they, in the case of a fetal emergency, they are not able to provide the care that they're trained and that is medically necessary to provide. This, as Rep. Fletcher mentions, leads to more cases of sepsis and a higher maternal mortality rate. This demands oversight by this committee, and what you're going to do with Medicaid is you're going to make it worse, because women will not be able to receive the prenatal care. They will not have the same kind of access to doctors during a pregnancy. That's not pro-life. That's going to make, unfortunately, women are going to die, and it's going to make this a lot worse. But what also adds insult to injury, and why I really wanted to speak on this for new members and for the members who are here. Remember, it wasn't that long ago that we worked together on a bipartisan bill, the PREMIE Act. That was part of the year-end package that was negotiated between Democrats and Republicans that we passed. We sent over to the Senate, and lo and behold, who is responsible for throwing a wrench into the PREMIE Act? That PREMIE Act provides resources for clinical, biological, social, environmental, genetic, behavioral factors related to prematurity. We put a little bit of money away to help prevent premature birth. And who was the one that threw a wrench into this and didn't let us get it across the finish line? It was Elon Musk at the end of the year who said, oh wait, that bill has too many pages, Congress. Too many pages, it must be a bad bill, ignoring the work that we had done. So I think the very least, knowing all the statistics, what is happening across the country with maternal mortality, the very least Republicans could do as you set this up to gut Medicaid and care for children and pregnant women that rely on Medicaid, the very least you can do is in your oversight plan say that women, pregnant women, and women facing crisis and the impact of abortion bans across the country deserve a little bit of analysis. So thank you, Rep. Fletcher, for bringing this, and I'll yield back.
Gentlelady yields back. Is there any other discussion on the Republican side? Seeing none on the Democrat side? If there's no further discussion, the vote occurs on the amendment. The gentleman from New Jersey requests a recorded vote, and the clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Miller-Meeks votes no. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Bedegan. Ms. Bedegan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no. Mr. Allen is not recorded. Mr. Allen votes no.
Anyone seeking recognition for the, Mr. James?
Mr. James is not recorded. Mr. James votes no.
Anyone on the Democrat side? Seeing no one appearing to call the roll, the clerk will report. Oh, sorry, there is one, Ms. Kamick. How is she recorded? Is she not there? Okay, the clerk will call the roll. Will report, I'm sorry. Getting late.
Chairman Guthrie, on that vote, there were 22 ayes and 26 noes.
6 noes, the amendment is not agreed to. For what purpose does the gentlelady from California seek recognition?
Mr. Chairman, I have an amendment at the desk.
Your amendment number?
CAT 4, broadband affordability, rather.
Okay. The clerk will report the amendment.
Amendment to draft oversight plan, Cat 4, broadband affordability in compliance with the law. Under the subsection titled, quote, "Availability of broadband," end quote, in the title of the subsection, insert, quote, "and affordability," end quote, after the word, quote, "availability," end quote. Under that subsection, after the phrase, quote, "helping or hindering broadband,"
Without objection, the reading of the amendment is dispensed with, and the gentlelady is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Closing the digital divide must remain a key priority for this committee. Truly closing the digital divide, however, requires more than building out the infrastructure necessary to connect the tens of millions of Americans still without reliable high-speed broadband. It also requires ensuring that everyday Americans can access affordable broadband and equipping Americans, from our seniors to students, with the necessary digital skills and devices to reap the full benefits of online access. Across all 50 states, broadband affordability and availability are the primary barriers to closing the digital divide. Unfortunately, this committee's oversight plan only prioritizes broadband availability. This is short-sighted and risks leaving many Americans behind. Democrats will keep fighting for the working class. That's why my amendment would ensure we also prioritize broadband affordability so that everyday Americans connect with their families, doctors, and schools online. Democrats can also keep fighting to hold the White House and federal agencies accountable to the American people and to the law. That's why my amendment calls on this committee to conduct oversight to ensure this administration is fully following the law when implementing federal broadband programs, including the bipartisan infrastructure laws, BEAD, and digital equity grants. Already, we've seen the chaos and confusion caused by the White House's malicious and misguided federal funding freeze. Even as courts weigh in, we can't deny the uncertainty this unprecedented power grab has unleashed for our states and communities as they question when they'll receive broadband funding and what the delays will cost them. This is especially important when our states and local communities have worked hard over the last few years to begin carrying out the BEAD and digital equity plans. States like Louisiana, Nevada, and Delaware are on track to put shovels in the ground this year to connect underserved communities. Many other states, including my home state of California, are hard at work building a fair and competitive award process and implementing digital equity plans so that our federal broadband dollars go to where they are most needed. All this progress, however, could be wasted if the Trump administration chooses to hold federal funding like BEAD or digital equity grants hostages. Freezing this funding ignores the law and harms the tens of millions of Americans who are counting on these programs to get connected. They can't afford to wait, and neither can we. We are the only oversight that these communities have. If we don't ensure affordability in addition to availability, we risk creating a two-tier system where only the wealthy can get online. With that, I call on my Republican colleagues to join us in voting for this common sense amendment to protect broadband affordability and send a clear message that no administration is above the law. With that, I yield back my time.
The gentlelady yields back, and the chair recognizes himself for 5 minutes. You know, I would probably be frustrated as well if I had voted for BEAD over 2 years ago, and I don't think one penny's been dispersed, nor 1 inch of fiber has been laid. If you want to talk about, if President Trump's been in office for a few weeks, and we're already saying that he's holding up the money. The money's been held up for 2 years. For the administration held the money to put restrictions on the spending of the money that was not in the law. So I know that's frustrating, but that was previous 2 years, not the last couple of weeks. And by having the money there, it's going to give us an opportunity. We are going to look at this program. We're going to make sure the money is going to be spent correctly. It's going to be spent according to law. And so I can guarantee you there will be oversight of this money, hopefully before any penny is spent. So I will yield back. Is anybody else seek recognition? The gentlelady from Virginia.
Okay, move to strike the last word. So part of the reason why the funding hasn't been used and cables haven't been laid is because one of the first steps that had to happen was that states had to do broadband maps. Because most states, Virginia included, did not have a map of where the unserved and underserved areas were. So you can't begin to have a plan for how you're going to roll out broadband cables until you know who needs it. So that's the first step. That took a while because providers needed to provide their data in a way that would ensure that it wouldn't be shared with their competitors. And so if we want to look into the reasons why the funding from the IRA isn't immediately putting cables in the ground, let's look at that. But let's be realistic about it and look at what does it actually take to go from nothing in the ground to figuring out where you need to go to provide service to under and unserved areas. And I know this because the last job I had before coming here was on how to do exactly that. So if we want to look at that, let's look at that. But let's also look at the full breadth of what needs to happen to ensure that every American not only has access to broadband, but that it's affordable. I yield back.
Gentlelady yields back. The gentleman from Georgia is recognized for 5 minutes.
Thank you, Mr. Chairman. The oversight plan already includes language committing to oversight of broadband programs, including the Universal Service Fund and programs related to broadband deployment and adoption, including those that were established as part of the Infrastructure Investment and Jobs Act. I'll note that we already have an affordability program, the Lifeline program within the USF. I know the Democrats want to blame Republicans for the end of the Affordable Connectivity Program, the COVID-era program that was designed to be temporary and end once the pandemic ended. I'll also note that as much as Democrats claim to miss that program, they controlled the Senate and the White House last Congress and couldn't agree on a proposal that could pass. I also find it amusing that the Democrats want to ensure compliance with statutory requirements in the IIJA when the Biden administration blatantly ignored the statute when they unlawfully forced states to regulate rates for broadband plans as part of the BEAD program, something the very law prohibits. Committee Republicans have fought to ensure compliance with that provision for the past 2 years and will continue to do so. Making sure broadband is affordable and accessible is important for Americans to participate in the digital economy, and we're open to working on policies that promote competition and reduce costs. All of this is covered by our oversight plan, so I plan to oppose this amendment.
Gentleman yields back. Anyone on the Democratic side seeking recognition? Seeing none, any further on the Republican side? If there's no further discussion, a vote occurs on the amendment. A roll call vote has been requested by the gentleman from New Jersey, the ranking member, and the clerk shall call the roll.
Mr. Latta? No. Mr. Latta votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Hudson? No. Mr. Hudson votes no. Mr. Carter of Georgia? Mr. Carter of Georgia votes no. Mr. Palmer? Mr. Palmer votes no. Mr. Dunn? Mr. Dunn votes no. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes no. Mr. Weber? Mr. Weber votes no. Mr. Allen? Mr. Allen votes no. Mr. Balderson? Mr. Balderson votes no. Mr. Fulcher? Mr. Fulcher? Mr. Fulcher? Mr. Fulcher votes no. Mr. Pfluger? Mr. Pfluger votes no. Mrs. Harshbarger? Mrs. Harshbarger votes no. Mrs. Miller-Meeks? Mrs. Miller-Meeks votes no. Mrs. Kamick? Mr. Obernolte? Mr. Obernolte votes no. Mr. James? Mr. James votes no. Mr. Bentz? Mr. Bentz votes no. Mrs. Houchin? Mrs. Houchin votes no. Mr. Fry? Mr. Fry votes no. Ms. Lee? Ms. Lee votes no. Mr. Langworthy? Mr. Langworthy votes no. Mr. Kane? Mr. Kane votes no. Mr. Ruley? Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Chakowski. Ms. Chakowski votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Trahan. Ms. Trahan votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Menendez. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
Is anyone seeking to answer the roll? Seeing none, they're playing on the Democrat side. Who has, Mrs. Clark? How's the lady from New York recorded?
Ms. Clark is not recorded. Ms. Clark votes aye.
Anyone else? Seeing no one else, the clerk will report the result.
Chairman Guthrie, on that vote, there were 22 ayes and 27 noes.
The amendment is not agreed to. So, Mr. Louise, this was for what purpose the
Yes,
gentleman
sir.
from California seek recognition?
Thank you, Chairman. I have an amendment at the desk,
Gentleman state his amendment.
ENG_05.
The clerk will report.
Amendment to draft oversight plan offered by Mr. Ruiz.
Without objection, the reading of the amendment is dispensed with, and the gentleman from California is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. My amendment states, quote, "The committee will also conduct oversight on the long-term impact to our national competitiveness with regards to batteries, critical minerals, and other 21st century energy technologies and materials and energy security from the freeze of grants, loans, and loan guarantees." My amendment addresses a critical issue that threatens our national competitiveness, energy security, and economic future. The unjustified delays and freezing of federal funds for clean energy projects, particularly those in Lithium Valley, located in my district. Located in the Salton Sea region, Lithium Valley holds the largest lithium deposit in the United States and the 5th largest globally, offering a historic opportunity to secure America battery energy storage dominance. The Trump administration, like the Biden administration, has prioritized domestic critical mineral development to reduce reliance on foreign adversaries. Lithium Valley is central to this vision by leveraging its vast lithium reserves to strengthen domestic supply chain, enhance grid-scale energy storage, and support national security applications. Under the current administration, the DOE has emphasized lithium's essential role in America's energy security by making strategic investments in lithium production. Yet, instead of moving full speed ahead, we are being stalled by bureaucratic red tape and funding freezes of their own making that jeopardize the progress we have fought so hard for. The Loan Programs Office at the Department of Energy is designed to invest in cutting-edge clean energy projects that drive the very American innovation and industrial growth this administration say they desire. By freezing the very funds meant to support lithium refining and battery manufacturing, the Trump administration is undermining its own goals to compete with China and other global producers who are rapidly securing their own supplies. By freezing these funds, President Trump is putting China first in the lithium extraction and battery manufacturing. Let me be clear. This is not just about my district. This is about American energy dominance. Every delay in funding means more critical minerals are sourced from adversarial nations, more missed economic opportunities, and a weakened clean energy supply chain. If we fail to act now, we risk falling behind in one of the most strategic industries of the 21st century. We must move swiftly to unfreeze these funds, unlock the full potential of our domestic energy resources, and secure America's leadership in the global clean energy economy. And it is important for this committee to ensure that American energy is dominant in the 21st century with 21st century technologies and clean energy, instead of doubling down on the 20th century technologies that have produced dirty energy production. We have to ensure that the U.S. can compete not just in critical minerals, but in batteries and other 21st century energy technologies. This should be easy. It should be bipartisan, and I urge all my colleagues to support my amendment. I yield back.
Gentleman yields back. The gentleman from Ohio is recognized for 5 minutes.
Thank you, Mr. Chairman. Move to strike the last word. Thank you, Mr. Chairman. The committee in its oversight plan will examine the management and implementation of clean energy and advanced technology grant, loan, and loan guarantee programs of the Department of Energy, which include programs related to batteries, critical minerals, and other 21st century energy technologies. This amendment isn't necessary to the underlying oversight plan and undermines the committee's ability to conduct effective oversight, distracts from the egregious federal overreach of the previous administration, and weakens our energy security. Further, our oversight plan importantly focuses on how DOE loan programs may fund production of clean energy technology in places like Communist China, which will hurt our national security on the global stage. As this committee knows, the Biden administration sought to spend finite taxpayer resources with reckless abandon and were advanced with little, if any, opportunity for proper oversight. Misguided decisions of the previous administration will only embolden our adversaries like Communist China, who exploit global supply chains for critical minerals, materials, and clean energy technologies. As Secretary Wright has publicly discussed, under his leadership, the Department of Energy will seek to ensure that all funding mechanisms will support and advance our national interests and lower costs for households that continue struggling under energy inflation. Importantly, as part of the executive order to unleash American energy, President Trump directed the Department of Energy conduct a 90-day review of the processes, policies, and programs in place to disperse taxpayer resources. Our oversight plan will ensure that this committee can work hand in hand with the administration to ensure any federal funding advances our national interests in American energy dominance. And Mr. Chairman, I urge a no vote on the amendment and yield back.
Gentleman yields back. Is there further discussion? Seeing no further discussion, if there's no further discussion, the vote occurs on the amendment. A roll call has been requested by the ranking member. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Schakowsky. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Ms. Clark. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Bedegan. Ms. Bedegan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier votes aye. Ms. Strahan. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
Ms. Kamick, Mr. Carter from Georgia.
Mr. Carter of Georgia is not recorded. Mr. Carter of Georgia votes no.
Ms. Kamick,
Ms. Kamick is not recorded. Ms. Kamick votes no.
Mr. Tonko,
Mr. Tonko is not recorded. Mr. Tonko votes aye.
Ms. Clark, are you recorded? Ms. Trahan?
Ms.
Oh, Ms. Clark's not, Ms. Clark, how's she recorded?
Ms. Clark is not recorded. Ms. Clark votes aye.
Ms. Schakowsky?
Ms. Schakowsky is not recorded. Ms. Schakowsky votes aye.
Ms. Trahan?
Mr. Han is not recorded. Mr. Han votes aye.
Ms. Lanson?
Mr. Landsman is not recorded. Mr. Landsman votes aye.
Anybody else seeking to answer the roll call? Seeing none, the clerk will report.
Chairman Guthrie, on that vote, there were 22 ayes and 27 noes.
Amendment is not agreed to. For what purpose does the gentleman from Louisiana seek recognition? Could you say that again in the microphone? I'm sorry.
I have an amendment at the desk, HE4.
Amendment HE4. Clerk will
Amendment to draft oversight plan HE4.
Without objection, the reading of the amendment is dispensed with, and the gentleman from Louisiana is recognized for 5 minutes in support of the amendment.
Mr. Chairman, gun violence is a major public health problem in Louisiana and around the country, even though gun deaths decreased for the third consecutive year, dropping 12% from 2023. There were more than 16,000 firearm deaths. When you account for those that use firearms to take their own life, that number more than doubles. Gun violence results in more than 40,000 deaths in 2024. In Louisiana, 1,153 people died and 3,345 were wounded on average each year. The number of school shootings in each of the last 4 years is more than 107% higher than any year prior to that for the last 25 years. In 2024, there were 330 incidents of schools around the country. Guns are the leading cause of death among children and teens in Louisiana and around the country. Gun violence hurts families, communities, and our public health workers, especially our mental health workforce, which is on the front line to help heal those affected by gun violence. I would urge this committee to adopt this amendment because gun violence should be considered a public health emergency. And I remind you that our young people are dying at alarming rates all over our country. And those bullets don't know party. They don't know race. Our community is depending on us to do something about this. And I would urge my colleagues to adopt this amendment. I yield back the balance of my time.
Thank you. The gentleman yields back. The gentleman from Georgia seeks recognition. Gentleman's recognized.
Ask to strike the last word.
Gentleman's recognized.
Mr. Speaker, Mr. Chairman, I move to speak in opposition to the amendment. The committee's oversight plan clearly states that the committee will conduct broad oversight of HHS, including the CDC, to ensure our public health agencies are taking actions that address true public health concerns. The gentleman's amendment is unnecessary, and I urge my colleagues to vote no on the amendment.
Does the gentleman yield?
The gentleman yield.
I yield.
Would you not consider this a real health
That's why, that is why we have oversight over HHS, including CDC.
So I'm sorry, the question is, so you don't consider this a health challenge?
No, that's not what I said.
I'm
What I
asking
said
this
is that
question,
we
sir.
have oversight already in this plan over HHS and CDC, which
I just-
address public health situations.
I just asked you the question. Do
Okay.
you consider this a health concern?
Do I consider it a health concern?
Yes.
I don't see the relevance in answering that in the sense that we've
Either
got
you do or
oversight
you-
on it.
either you
And
do or
if
you
the
don't.
majority of this committee considers it to be
People are
a
dying,
health issue,
Carter.
then
People are
certainly
dying.
we have the ability to look at it.
People are dying, and you don't think it's health, you don't feel necessary to answer that? That's an easy one, I think. People are dying all over our country, every day.
Gentlemen, it's your time.
It's reclaiming my time. I'll yield to the lady from Iowa.
Thank you, Representative Carter, and thank you, Mr. Chair. I don't recall, in all the time I spent 4 years on the Select Subcommittee on the Coronavirus Crisis and Pandemic, our colleagues talking about the numbers dying from school lockdowns, the number of suicides of children because they were forced to remain out of school, not be with their peers, and only have access to the internet and bullying. I don't recall anybody talking about that being a public health emergency. With that, I yield.
The gentleman yield back.
I yield back.
Gentleman yields back. Any further discussion? Gentlelady from Florida.
I can't believe you can't at least say that firearms that are the leading cause of death among children today is not a public health concern. I yield back.
Gentlelady yields back. Seeing no further discussion. If there's no further discussion, the vote occurs on the amendment. The gentleman from New Jersey has requested a recorded vote. The clerk will call the roll.
Mr. Latta. Mr. Latta votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter of Georgia. Mr. Carter of Georgia votes no. Mr. Palmer. Mr. Palmer votes no. Mr. Dunn. Mr. Dunn votes no. Mr. Crenshaw. Mr. Joyce. Mr. Joyce votes no. Mr. Weber. Mr. Weber votes no. Mr. Allen. Mr. Allen votes no. Mr. Balderson. Mr. Balderson votes no. Mr. Fulcher. Mr. Fulcher votes no. Mr. Pfluger. Mr. Pfluger votes no. Mrs. Harshbarger. Mrs. Harshbarger votes no. Mrs. Miller-Meeks. Mrs. Miller-Meeks votes no. Mrs. Kamick. Mr. Obernolte. Mr. Obernolte votes no. Mr. James. Mr. James votes no. Mr. Bentz. Mr. Bentz votes no. Mrs. Houchin. Mrs. Houchin votes no. Mr. Fry. Mr. Fry votes no. Ms. Lee. Ms. Lee votes no. Mr. Langworthy. Mr. Langworthy votes no. Mr. Kane. Mr. Kane votes no. Mr. Ruley. Mr. Evans. Mr. Evans votes no. Mr. Goldman. Mr. Goldman votes no. Mrs. Fedorchak. Mrs. Fedorchak votes no. Mr. Pallone. Mr. Pallone votes aye. Ms. DeGette. Ms. DeGette votes aye. Ms. Jakowski. Ms. Jakowski. Ms. Jakowski votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Tonko. Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Mrs. Dingle. Mrs. Dingle votes aye. Mr. Vesey. Mr. Vesey votes aye. Ms. Kelly. Ms. Kelly votes aye. Ms. Barragan. Ms. Barragan votes aye. Mr. Soto. Mr. Soto votes aye. Ms. Schreier. Ms. Schreier. Ms. Schreier votes aye. Mr. Han. Mr. Han votes aye. Ms. Fletcher. Ms. Fletcher votes aye. Ms. Ocasio-Cortez. Ms. Ocasio-Cortez votes aye. Mr. Auchincloss. Mr. Auchincloss votes aye. Mr. Carter of Louisiana. Mr. Carter of Louisiana votes aye. Mr. Menendez. Mr. Menendez votes aye. Mr. Mullen. Mr. Landsman. Mr. Landsman votes aye. Ms. McClellan. Ms. McClellan votes aye. Chairman Guthrie. Chairman Guthrie votes no.
Is anyone who can answer the roll call? It has not been. Seeing none, the clerk will report the result.
Chairman Guthrie, on that vote, there were 22 ayes and 27 noes.
The amendment is not agreed to. Is anyone seeking, was the gentleman from Florida seeking recognition? What purpose of the gentleman from Florida seek recognition?
For an amendment, CMT 16.
The clerk will report the amendment.
Amendment to draft oversight plan, CMT 16, CHIPS and science staffing.
Without objection, the reading of the amendment is dispensed with, and the gentleman from Florida is recognized for 5 minutes.
Thank you, Mr. Chairman. You know, when a lot of us saw a headline the other day, one of many, with federal staffers being fired, this time the 500 folks from the National Institute of Standards and Technology, 500 NIST staffers, including lab directors, expected to be fired, canned, doged by the Doge disaster. And people want to know, like, how did this start? Well, we saw back in 2018, massive Trump tax cuts, doubles the deficit, sets us on a path of debt that's now at $36 trillion. And now that this debt crisis has been passed, and here it is, we're in a fork in the road. A lot of people may remember that from this week. We could either do massive tax cuts for the few or health care for the many. And so here we are today at the oversight hearing, and we could either have an oversight plan or rubber stamp plan. And I know that we have a responsibility, and no one wants to just rubber stamp all this, right? And so we passed major legislation, the CHIPS Act, just a few years ago to make sure that we were lowering costs for Americans, addressing the slowdown during the pandemic, the chip shortage, and also address inflation, which is right now at a 6-month high, and to help with a manufacturing boom. We see a great CHIPS project in Central Florida and Neo City and Kissimmee, where we're doing aerospace and space microchips. And we see others across the nation, Arizona, Texas, New York, Ohio, Oregon, Idaho. And so that's why it doesn't make much sense to fire these 500 NIST staffers, because they're the ones who are supposed to be reviewing all these new microchips that go to market. AI development, which has been discussed so much, cybersecurity. These NIST delays will hurt both jobs, hurt tech development, hurt businesses, and raise inflation. Remember, the economy. That's what we all promised we were going to do, help streamline the government, help to lower inflation, help to boost manufacturing. But this will do the opposite. And Mr. Chair, it's my birthday today, so I'm hoping I have a shot at this one. So please vote for my pro-jobs, pro-innovation, inflation-reducing amendment. I yield back.
Is there any further discussion? The gentleman from California?
Thank you, Mr. Chair. I'm speaking in opposition of the amendment. So this amendment directs the committee to conduct oversight of NIST. Unfortunately, oversight of NIST is not in the jurisdiction of this committee. It's in the jurisdiction of the Science, Space, and Technology Committee. So it'd be appropriate to have this amendment in their oversight plan, not in this oversight plan. So I urge a no vote.
The gentleman will withdraw the amendment since it's not in the... What's the purpose of the gentlelady from Illinois seek recognition?
To strike the last word, and I'd like to yield my colleague my time.
I thank the gentlelady from Illinois. This deals directly with implementation of the CHIPS Act, which is in the subject matter of this committee. And if we're going to continue to oversee it, you know, this committee has fought with space science and technology on many occasions, including with satellites and in other areas to protect what we deem as ours, and the CHIPS Act is one of those. Plus, it was also co-jurisdiction between both committees. So I'd argue that we do have the jurisdiction to oversee it based upon our ability to oversee the CHIPS Act, and I yield back.
Is there further discussion? Seeing none.
Mr. Chairman?
Yeah, oh, the gentlelady from California is recognized.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlelady's recognized.
Mr. Chairman, I support my colleague from Florida and wish him happy birthday. Congressman Soto's amendment to conduct oversight on the severe drastic staffing cuts at NIST and the Department of Commerce. As co-author of the original CHIPS Act, I understand just how critical these agencies' work is to maintaining our leadership in chips and and AI. The CHIPS and Science Act is working as intended, leveraging the $50 billion of government funding to spur a nine-fold investments of $450 billion